All right, you got her seated.
All right, welcome everybody. Appropriations Committee, we have a number of bills today. We're going to start with the governor's bill. Governor, great to see you. Secretary Martin, Special Secretary Lopez, Miles, great to see you all. House Bill 694.
Vice Chair, to all the distinguished members of the committee, I cannot tell you enough how much we appreciate the opportunity to come and to personally testify on behalf of this bill and to continue to work together to address something that I know is something that we are fully committed to, and that's addressing the issue of concentrated and generational child poverty. Before I became the governor, I ran one of the country's largest poverty fighting organizations in this country, and it was an organization called Robin Hood. And during my time as CEO, we invested hundreds of millions of dollars that went to some of the best poverty fighting nonprofits in America. We helped scale projects that were working. We used data to identify the things that made sense, and we required more support to be able to make sure those organizations and that work was actually thriving. And to do that, we also made sure that we were meeting with governors, meeting with mayors, meeting with local electeds, meeting with village elders, and all of that, making sure that we were coordinating all of our efforts to make sure that we could actually come up with a long-term sustainable solution. And all of it was focused on the idea and the mission of helping to address the issue of children who are living in poverty. We knew that child poverty impacted every part of our society. And that when people said, well, how does poverty show itself? The answer is in every way. And unfortunately, it hurts the most vulnerable in the most distinct ways. And so we knew that that meant we had to engage everybody, that we would engage neighborhoods because our communities aren't looking for people to save them. Our communities are looking for people to actually listen to them and hear them and to act. That we knew we'd engage organizations because businesses and nonprofits are experts in best practices, in economic growth, in uncovering the promise of our families. We knew we'd engage unions because unions help to build our economy. So it's unions that are going to also help to strengthen our economy. We knew we had to engage governments because the law, the budgets, and the bully pulpits are the things that actually drive change at state and local levels. And we knew we had to engage households because the best way to support our children is by making sure that our children are growing up in strong and supportive homes. So I learned a lot during my time as the CEO of Robin Hood, and I've tried to apply that knowledge to the work of governing as a state chief executive. And this year, our administration has worked together with many of you actually in this room to help to craft a plan that can actually unleash the full power of engagement by using it to be able to tackle the issue of child poverty in Maryland. And it's called the Enough Act. And that stands for engaging neighborhoods, organizations, unions, governments, and households. But the thing that people will see is that this is not just an acronym. This is actually a governing philosophy. It's how we're going to actually get the work done. Our legislation will channel private, philanthropic, and also state resources to communities with the highest rates of generational child poverty. And it is not just spreading money around, because we know, and documents show and data shows, that that's not the answer. We're going to be intentional, we're going to be data-driven, and we're going to make sure we're actually involving the community when it comes to public investment. Together, we are going to target the places most in need of help, and we are going to uplift those communities in partnership. Because we believe that to fully address the challenge of poverty, you need to actually engage the people on the ground. And that goes from urban cities to rural towns and to everywhere in between. It means we need to be everywhere, and it means we need to look everywhere. I know you all have a copy of this map. This is the 2022 Child Poverty in the state of Maryland by census tract. We should all be embarrassed by this map. We should be embarrassed about how many pockets of red there are on this map. We should be embarrassed by the fact that this is not an urban issue. This is not a rural issue. This is not a suburban issue. The other thing that we should be embarrassed by is while this is the map of 2024, the map of 2014, the map of 2004, it does not look that different. This is generational. And what we're looking at when we're looking at these maps, when we're looking at these deep pockets of red, these are our children. This is the fact that our children are being born into communities and our children are being born into circumstances that their future is being determined for them before they even have a chance to determine their own future for themselves. That's what we can address. And that's what we can fix. And that is what I believe deeply is what this moment is going to demand. And that we're going to be judged on. That fighting poverty is not just a single priority of an administration, that fighting child poverty has got to be a focus of our state. It's got to be a focus of this moment. And that's why this piece of legislation, it calls on leaders all throughout the state of Maryland to come together and create more comprehensive plans that are going to help to make our neighborhoods better and going to provide more pathways for our children and to do it in partnership with our schools, with our community centers, with our civic centers, with local electeds, with our health clinics, and other key institutions. And so the premise is simple. Our communities will provide the vision. The state will provide the support, and not the other way around. We aren't asking Marylanders to create the proposals by themselves. Our administration will provide communities with support and guidance as they assemble their plans. And that guidance will focus on three core elements. The first, create safe and thriving communities. The second, support healthy and economically secure families. And the third, to ensure access to high quality education and healthcare. These proposals will give us a roadmap for elevating communities that is written by them and not simply for them. And all of us can use these roadmaps to guide our work, because the winning proposals that will come through the Enough Act will benefit from a mix of public and private money. But the thing that we know is that the Enough Act is about much more than just dollars and cents. There has to be a measure of intentionality that drives addressing the issue of concentrated poverty. So there needs to be, in terms of why it exists, so there needs to be a measure of intentionality to be able to address it at its root. We're going to build new partnerships with urban, rural, and suburban communities that receive the funding and provide them with the mentorship and the expertise, because the money is important, but strategy, accountability, and partnership are imperative. You know, I'll close, I say every so often, my phone rings in the middle of the night. And the one thing that I know is that whenever my phone rings in the middle of the night, it's never good news. It's never a good thing. And I remember about 8 months ago, my phone rang and it was Mayor Brandon Scott of Baltimore. And he told me that there had just been a mass shooting in the Brooklyn community in Baltimore. So that night, we ended up using that time to focus our energy to get the resources in place to be able to address the tragedy that was standing in front of us. But in the days and the months after, I've been completely unable to shake a much deeper tragedy. That across the state of Maryland, about 1 in 8 of our children are living in poverty. In Brooklyn, about 1 in 2 children live in poverty. We've seen similar numbers in Brooklyn for over a decade. You cannot understand what happened that night unless you're willing to wrestle with what has been happening many, many nights before. Child poverty is not just a consequence, it is a cause. It causes pain to endure. It causes potential to go unseen. It causes full potential to lie dormant. And that harsh reality is played out everywhere from Western Maryland to the Eastern Shore, everywhere in between, again and again and again. I know I'm thinking about the districts that many of you represent. I am not speaking to one of you or a few of you when we're talking about the issue of child poverty. Frankly, I'm speaking to all of you because I know your districts. We visited places together. And so to members of this committee, we owe it to the people that we serve to stop these cycles. We owe it to the people we serve to provide measurements of relief to a deep pain that has gone on for so long that it is no longer a piercing pain. Frankly, it's a chronic one. And it's one for many members of our community they've come to expect. So this becomes a time that we can say in a full voice that we have had enough. Enough of a time when we're just going to let generational child poverty continue to exist and not provide concentrated solutions in order to deal with this. We're going to say that not only is it enough, but we're saying with members of our community that we are enough. We're all we need. And this becomes a time when I think we're going to get this moment right. And so I urge a favorable committee vote on the Enough Act of 2024. I look forward to your questions. And I will now pass it off to our Special Secretary for Children, Carmel Martin, for her opening remarks as the leader of the Governor's Office for Children, where this is also going to be housed. So Special Secretary Martin, thank you so much.
Thank you, Governor. Good afternoon, Delegate Barnes, Delegate Chang, and members of the committee. As the governor has eloquently described, the Enough Act is a first of its kind effort to tackle concentrated generational poverty. The research is clear. Place matters. The neighborhood in which a child grows up has profound impacts on the child's ability to thrive in terms of income, but also across a broad spectrum of factors such as incarceration rates, college attendance rates, fertility rates, and marriage patterns. The research is also clear about what works. Jurisdictions across the country implementing neighborhood-based initiatives that are data-driven with community-driven, in other words, bottom-up, not top-down approaches can deliver results. We also know that tackling concentrated generational poverty will have a direct and substantial impact on our economic growth. As the governor laid out, the Enough Act will focus on the communities that have been left behind for too long: urban, suburban, and rural communities. Neighborhoods that have experienced decades of disinvestment and often intentional policy choices designed to keep their potential at bay. We will ask these communities to form partnerships across sectors, pulling together actors from government, nonprofits, faith-based organizations, philanthropy, anchor institutions, labor unions, small businesses, and corporations, but also across programmatic silos: education, workforce, healthcare, housing, public safety. And we will model this behavior at the state level through the Children's Cabinet, because the governor has made clear to his team that this is an all-of-government approach. Communities will be asked to develop a strategic plan leveraging existing services, supports, and funding with an eye towards the three core objectives that the governor mentioned: unlocking children's potential by providing a continuum of services and supports from cradle to career, helping families to secure family-sustaining income and high-quality health care, and building safe and economically vibrant communities, supporting small businesses, tackling community violence, increasing affordable housing. Funding will be allocated for technical assistance to support neighborhoods as they apply for and implement neighborhood-based strategies, neighborhood implementation grants, planning grants for communities who need additional time to assess needs and build a shared vision of community revitalization, and regional capacity building grants. The bottom line is that the Enough Act will spur philanthropic and federal investment, revitalize communities, and drive the state's economic competitiveness for the long term. I too urge the favorable committee vote on the Enough Act of 2024 and turn it over to my colleague, Secretary Lopez.
Thank you. Good afternoon, Chair Barnes, Vice Chair Chang, and honorable members of the committee. I'm Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We serve as one of Maryland's leading child welfare and anti-poverty organizations and believe the Enough Act will help us all spend smarter and wiser across state programs. While broader economic and policy factors drive poverty, children, youth, and their families are impacted by their environments every single day. Maryland's policy should center the lived experiences of children and their families to better align neighborhood and community resources. The Act calls on local grassroots efforts tailored to the people closest to the challenges because they are closest to the solutions. Without coordinated interventions to alleviate adverse childhood experiences, multi-generational cycles of poverty become even harder to disrupt. And every day at DHS, we see the impact and the cost of doing nothing. In the work we lead in child welfare alone, doing nothing translates into the disproportionate representation of Black girls in foster care in Maryland. While this is Maryland's current reality, it does not need to be the future. Over time, we believe the act will reduce family stress and the likelihood of a child or youth experiencing traumatic and unnecessary child welfare involvement. National research highlights families experiencing poverty are more likely to be reported for child neglect through no fault of their own. And what is another name for neglect in Maryland? It's poverty. Neglect is the most commonly reported type of child maltreatment in the United States of America. 75% of reports to Child Protective Services, just like ours in Maryland, involve allegations of neglect. Neglect is often reported when a caregiver is unable to provide food, clothing, shelter, medical care, or supervision threatening a child's safety. However, we must distinguish that an inability of a family to provide necessities for their children is not the same as an unwillingness to provide. Investing in families can build protective factors and decrease reports of neglect over time. Child maltreatment rates have declined by 56% over the past 30 years, but by contrast, rates of reported child neglect remain high. And Maryland follows this trend in every single one of its 24 jurisdictions. We can and we will do better, and the Enough Act will help us get there. We respectfully request your favorable report of HB 694, and I look forward to your questions.
Yes, and again, thank you for having me today. I'm gonna be brief. I'm here with some great distinguished members of this panel, and here to assist with any technical questions. So again, I urge a favorable report on the Enough Act. Thank you.
Okay, thank you all. Questions for the governor and his panel? Delegate Smith.
Thank you, Mr. Chair, and thank you, Mr. Governor, and thank you to Mr. Secretary. And are you a secretary or is it director? I want to make sure I address you appropriately, but great to meet you again. I just want to say thank you for, again, the conversation around poverty in children is something that we can't turn our heads from. It's very important. And I do want to point out that the fiscal note does acknowledge the legislature's commitment to addressing child poverty through the blueprint, as we all know is incredibly important. And the blueprint does dedicate hundreds of millions of dollars to addressing poverty. And so I wanted to know what your comfort level would be around maybe more closely aligning this proposal with our concentration of poverty community schools program, because these are the same communities of high need that I think are discussed in your bill. And I also am concerned about perhaps having two separate definitions of poverty happening simultaneously in separate programs when maybe we could be more closely hewed together. So I wanted to get a sense of where your comfort level was around that.
Thank you so much, Delegate, and appreciate your leadership and appreciate the question. And you're absolutely right. I mean, I'm thankful for the way the legislature has led on the blueprint. The blueprint is a crucial piece of legislation, and one that I think we've continued to show from an administration perspective that we are fully committed to making sure that the blueprint is actualized and the promise of the blueprint is fulfilled. And we actually see the way we're looking at Enough as complementary and not duplicative of the work that's happening within the blueprint. The way it would work where for institutions and communities to be able to participate inside of the Enough Act, there's really a few gating criteria that we have. You know, one is a community for just basic eligibility for 20% or more of the children inside that community are growing up in poverty. So we're looking at things like examples on the FPL, the federal poverty rate, et cetera. The second is an interest where we're not telling communities that they have to be involved in the Enough Act depending on their census tract or their zip code. It really is the community has to say, we think that we have the resources, we think we have the foundations, and we are ready to collaborate amongst each other to be able to make ourselves and put ourselves in contention. And the third piece really is the ability. Because we know that for certain communities, there are certain benchmarks or certain frameworks that they have to have in place in order for this type of investment to be successful. The way that the blueprint looks at it in a very smart way is looking at how can you think about the support of community schools and using the community school as the anchor out. The way that Enough really helps to supplement that work for community schools is knowing that community school alone is not going to support what is generational challenges of poverty that continues to exist. And so where we see Enough is really complementary of helping to reinforce the other infrastructure that is going to be required for that community school to be able to grow and thrive. It's being able to leverage additional sources of capital, because I think one of the frames of enough that's exciting is this is not just about the fiscal note for state resources. This is about the invitation of private capital, philanthropic capital, all to be able to leverage the multi-sectored ways that poverty shows itself in children's community. And so the blueprint was something that we looked at deeply in the creation of enough, and we think it's something that where enough really serves as an important supplemental guide, because many of the neighborhoods that we're talking about that will benefit from the community schools build will also be the neighborhoods that find themselves eligible for enough funding. I don't know if there's anything, I'm sorry, anyone to add as well.
No, I think that's absolutely right. I mean, our hope is that the partnerships formed under the Enough Act will bring additional community resources to the school to support their existing efforts with respect to community schools, but also address needs outside of the school day and other needs that the children and family in the community has. So very well aligned.
I do want to mention that a lot of community school coordinators work does happen outside of the regular hours of school. My son actually attends a community school, so I know this from, not just an academic perspective, but in real life. So I just wanted to note that, and that there's also the ability for community school coordinators to leverage their leadership to get additional resources beyond what we align a lot in the blueprints. I just want to lift that up as a practical matter. So thank you very much.
Thank you. Yes.
Thank you, Mr. Chair, and good afternoon to our esteemed panelists. I have a question. So the mandate for the program is $15 million, correct? Is that all for grants?
Automatically? Okay. Sorry. You guys are fancy here. I like this. I like this. So what we have is actually for the full build, and the grants. It's not just for the grants for the selected communities. We also have planning grants that are also going to be going out for individual communities, because we know that it is going to be a multi-year build and a multi-year frame. And so it's both about the communities that we're ready to invest in now. We assume and we expect that there will be communities that will be able to receive grant funding this year, but it's also for planning grants for additional communities who we believe might need additional supports as they're in preparation for long-term grants as well.
Okay, so let me make sure I have this perfectly clear. So the 15 million is going to be for grants, but for an array of different kinds of grants.
Correct. Yeah, there'll be different levels of grants that will happen for the individual communities. Some are further along than others. Certain communities are further along than others, but they will also be for communities that we feel might need some additional supports in order to make themselves fully qualified.
Okay, perfect. So on to Mr. Chair, if I may. Does the department believe that the $15 million can be spent in grants for FY25?
Yes, we do. Again, as the governor said, it would be different types of grants. We would provide some implementation grants for the larger grants for those ready to implement a plan during this fiscal year, some planning grants, and then we're also contemplating regional capacity building grants to support organizations that are working across a larger geography to support this type of neighborhood-based multidisciplinary initiative.
Okay, and perfect. And for the last question along the same line. So, and we may not be able to answer this now, we can just make this as a follow-up. So how many grants does the department picture for fiscal 25 and 26? And what does the dollar amount may look like?
So the number of grants and the size of grants will in part be determined based on the communities that step forward and the size of the jurisdiction that they are seeking to serve. So our plan is to size the implementation grants based on the number of children living in poverty in the community to be served. So we don't have exact numbers, but our hope is that in fiscal year 25 that we would be able to grants several implementation grants. We think that there are some communities that are ready for implementation, and then we would use the additional grant funding for the planning and the capacity building grants. And those would be smaller in amounts. Our planning grants are contemplated to be $300,000 per year, and the regional capacity building grants are contemplated to be $500,000 per year. So we would be able to do a greater number of those. The number that we'll be able to do, though, will be driven by the number of communities that are ready for implementation.
Perfect. Thank you. Thank you, Mr.
Thank you, Mr. Chair. Mr. Governor, esteemed panelists, thank you for being here. We very much appreciate your efforts behind these. And as you know, Mr. Governor, having visited West Baltimore many a time, this is much needed. I actually want to piggyback off of my dear seatmate and colleague on kind of getting a granular understanding of the difference between the neighborhood and implementation grant, as well as the regional implementation grant, and then the planning grant. And then can you give us a little bit more, again, detailed information about how you will vet those applications?
So we will be releasing an application package that has rubrics by which we would judge the grant applications. As the governor mentioned, our focus will be on several things. First, ascertaining that they are designed to serve children living in neighborhoods with the highest concentrations of poverty. The second is that the community has come together for implementation grants, have come together around a common vision for revitalizing their community. So we'll be asking them to explain how they have engaged members of the community, how they have set up an organizational structure that allows for ongoing engagement with the residents of the community as they execute their work. And then we ask them to explain to us how they are putting forth evidence-based strategies to address the needs across the three areas that we mentioned: supporting children, supporting their families, and revitalizing communities. So for the implementation grants, that's the general framework, and we will be providing that in advance to applicants, also providing support to applicants. So as they put their applications together, support with grant writing, assistance with data they may need to make their needs assessment. With respect to the regional capacity building grants, those are designed for organizations that would be supporting this kind of work across a larger geography. And there would be asking them to put forth how they are proposing to support the communities that are receiving implementation grants or would like to receive implementation grants, and supporting their efforts to build those partnerships and build those plans for success. With respect to planning grants, there as well, we would be asking them to show us how they're going to be using that funding stream to build the organizational backbone to do this kind of work, and put forward initiatives that will improve their communities.
Okay, well, thank you so very much, Mr. Governor. And ever since you gave the Black Caucus that map at our breakfast, it's been pinned to the wall, and it is a focus, and we're glad to support you.
Bless you. Thank you.
Joined by our colleagues from HGO, including Delegate Austin, who has a question.
Thank you, Mr. Chair. Good to see you, Mr. Governor and
see you,
secretaries. So I was just wondering, have you all considered opening up the community organizations to include faith-based organizations? Because I know in my area of the state, we have a lot of faith-based organizations doing this work, and often they're excluded from programs like this, and they do really good work, but because they're faith-based, they're not often considered. So I'm just wondering, have you all thought about that? And then I do have a follow-up.
I absolutely enter briefly, and thank you so much. And yes, when we look at organizations, we include faith-based organizations in the list of under nonprofits organizations are involved. So they are very much involved in the planning process, because you're right. I mean, for many communities, the faith-based organizations, they serve as the anchors for the community. So absolutely.
Okay, great. Thank you. And then if you could speak to how you anticipate the healthcare outcomes working with this, what can we be doing, or what should organizations look to do to improve healthcare outcomes in these areas? Because we know that's a huge problem with a lot of these poverty-driven areas.
Great. I mean, I can take it briefly and then Secretary Lopez. We look at that, healthcare is actually one of the KPIs that we are looking at for our young people, both to determine where the need is and then also determine where the remedies are. One of the things what has been very specific and intentional about building out, and Special Secretary Martin mentioned it, is there are actually 11 departments within our state government that are involved in the enough framework, to include DHS, to include DHCD, and to include the Department of Health. And so looking at healthcare, looking at health and healthcare and health supports for children and for the families is both one of the gating criteria that we're examining, and also one of the remedy implementations that we have in place as well. Secretary.
Happy to join you, Governor, on this. Thank you for the question. So there's a couple of ways to think about this in terms of overall health well-being for the state of Maryland. And when we think about patterns in Maryland and specifically children living in poverty, we know that children don't live in households on their own, right? They are in families with moms, dads, aunties, uncles, grandparents, other kin caregivers. So there's a couple of ways, two things I would like to lift up for you, Delegate, that might help you think about the kinds of things we'd be looking toward, but ultimately be driven by the priorities set by the neighborhoods and organizations themselves. So, for example, in the governor's budget is proposed an investment of one of the legislature's signature leadership efforts in the last couple of years to expand Maryland Summer SNAP program. Over the last couple of years alone, and in 2023, for example, Maryland served roughly 90,000 children in 14 jurisdictions. Leveraging a couple more additional millions of dollars on the state general fund side, we are eligible as a state to receive an additional $60 million in direct benefits to feed 500,000 children in the summer of 2024 in all 24 jurisdictions. So that's an example of leveraging specific access to food for children. That benefit is $120 per child over the 3 months in the summer period as an example that directly ties to health and well-being of children. The second issue I'd like to bring up to Delegate is the way we think about approaching SNAP outreach and engagement overall. Special Secretary Martin and the governor have mentioned the importance of listening to community first about what's a priority. We know that in lots of our communities across the state, there are food deserts, right? So when you think about how might we get more families who are eligible today for existing eligible programs with no new money, what is that delta? And as we look at the US Census tract across the state of Maryland, we've come to learn that we believe that we have an estimated 178,000 individuals that could enroll, households that could enroll. So when we think about that, that's a lot of people that are eligible for existing programs today. That's a SNAP, which is the Supplemental Nutrition Assistance Program, which is another shadow indicator of health itself. So I wanted to give you two specific examples of things we're working on now: expanding outreach and engagement, listening to community, and being responsive around food deserts and access to grocery buying benefits, so that overall we can help turn the curve on those kinds of health indicators.
Thank you.
Thank you, Delegate. Delegate Harris.
Appreciate it, Mr. Chair. Thank you, Mr. Governor, Secretaries, and Miles.
Miles is special too. You're special, Miles.
The blueprint requires MSD to study something called the neighborhood indicators of poverty. The idea was that for free and reduced price meals is not the correct proxy for poverty so Blueprint asks MSD to find a better policy. MSD has submitted reports on this, but this committee has not felt like that formula is ready and needs to be fleshed out more. With the establishment of this new office that is really focused on poverty, would the Governor's Office of Children be interested in either taking this research lead with resources or assisting in developing this report? I really think this bill needs more about how this office is going to be the poverty fighting office in coordination with other agencies.
Please.
Thank you for the question. I think our office would be delighted to work in collaboration with MSDE on that report and ensuring that it advances and we get that information, which I think is critical information to have.
Absolutely. Appreciate you.
I'll just echo on that. The way that poverty and child poverty is evaluated in this country is wholly insufficient. Things like the federal poverty line are not a real number. And anyone who believes they're not spending enough time in communities to see that line, that oftentimes when you're looking at especially how the FPL, it's not accurate to really harness and understand the pain that families are enduring.
Good amendment.
Delegate Metzger.
Thank you, Mr. Chair, and thank you so much, Governor.
Thank you.
Several years ago, I was on the second generational poverty, and Secretary would remember, we've got so close, we got to the finish line almost, and then COVID hit, election, and it fell apart. We're living in a time where 60% of Americans living paycheck to paycheck. That explains, I think I have 13 schools in my district that are Title I, 100% poverty level. Just last Wednesday, a week ago today, a local church in our district, the faith-based that we're talking about, fed 1,837 families. 2 weeks prior, 1,760. So my question is, are we going to get to the finish line and drop it off? Are we going to go all the way to the finish line and celebrate at Preakness?
I'll just say briefly, and then I'll pass off. There is no celebration.
Well, what I mean is, we want to get it done. There's
Completely
nobody
agree.
that has a compassionate heart in this room than Delegate Rick Metzger.
Yeah. No, and
That's a good spot to say amen.
No, but it's and I think that's one of the reasons why we believe enough is so necessary. It's because, to your point, Delegate, when people say, well, what's the best way to address poverty? Is it, focusing on education or housing or transportation or the environment? The answer is yes, because that's how poverty shows itself in our families and in our children. And so by being able to engage every aspect and segment of our society, by being able to take a full government approach to it, by being able to leverage additional dollars from elsewhere and being able to use real data and best practices to be able to attack it, I think that really has to be the goal. Because, I say poverty in many ways is it's like water. Right? Where when water floods in, it doesn't pick and choose where it goes. Water doesn't go left or it doesn't go right. It goes anywhere where there's a hole. And that's the way poverty shows itself. It'll attack any vulnerability and any weakness. So I agree. I think none of us are here because we're interested in moving things around the edges on it.
This for me, and I'll conclude with this. When I was a kid, I heard words were just words, but actions speak.
Amen.
And I think that words is enough. And I think we need to, for once and for all, attack this and put the action to what we're doing.
Here,
Thank
here.
you.
Thank you.
Sounds like a bipartisan bill. Delegate Forbes.
Thank you, Mr. Chair. Thank you, Governor Moore, for being here today with us and using your voice and your platform to look for solutions to the incredibly difficult problem of intergenerational poverty. Thank you to the secretaries for being here today. My question in the bill is about the eligibility for a neighborhood implementation grant. In the bill, it says the applicant must serve a community with a certain percentage of poverty, represent a partnership that includes at least one community-based organization, one public school, and one local governmental identity. But the term community-based organization is not defined. And it seems like every community will have an undefined community-based organization, one public school, and one local governmental entity. So will there be additional standards for applicants later defined or fleshed out?
You want to take it first?
Sure. Yes. And I just also want to note that our hope will be, we will be encouraging applicants to have partnerships that go beyond those core partners.
Yeah.
But we felt it was important to name that it needed to be public, private sector and community-based. So our hope is that there would be nonprofit organizations, could be faith-based organizations from that community, working in collaboration with nonprofit organizations that, again, may work across a larger geography. But as the governor has mentioned, the acronym ENOUGH spans a much broader frame than that. So we will be encouraging local organizations to partner with unions, with small businesses, with anchor institutions, higher education institutions, healthcare institutions in their communities to have more robust partnerships than just those three actors. And then we'll be laying out standards for the criteria which we would be measuring the applications, with a heavy emphasis on readiness to do this kind of work, thinking across sectors, not just public-private sectors, but thinking across education and healthcare and workforce and housing. So we will definitely, our goal here is to arm people with the information that they would need to put forth a comprehensive plan, again, based on data-driven actions that have shown to tackle poverty.
Thank you. One more. Oh, well, thank you. I appreciate that, and I appreciate that answer. There are existing nonprofits already working in some of these communities and doing good work, but they might not be from the community itself. Would they be eligible to continue their work and get funding from this, for these?
Yes, as part of this partnership.
Thank you.
Delegate Peterson.
Thank you, Mr. Chair. Thank you, Governor, and all of the esteemed members of the panel. It's great to see you. I have the honor and privilege of representing the neighborhood of Brooklyn as one of the communities in my district. And one of the things that I heard over and over again as I was meeting with members in the community seeking their support was how desperately they want to have a seat at the table when plans are being formed, not just when they're being announced.
Yes.
And I had the joy of joining you at the public announcement of the Enough Act. Of course, there are plenty of elected officials and members of the media in the room, but what I was really struck by was how many community members there were in the room. And to me, that that was a statement of the intent of this act, which is to lift up those voices, which are, in my opinion, the most important ones. The question I have for you is, how do we collectively work to ensure that through the life cycle of the implementation of this bill, that remains the case, that those remain the voices that are at the table when the plans are being formed and not just when they're being announced?
Right. Great question. Thank you. And I think part of the intentionality of placing it with the Governor's Office for Children, part of the intentionality of having it to where it into becoming a cross governmental platform, and part of the intentionality of having where the involvement of the Governor's Office for Children with the communities, it literally starts from pre-application, through the application, through the acceptance, through the life cycle. And so we hold and we will have very clear accountability measures to make sure that where the intention is being laid out is what's being actualized, to make sure that if there are blind spots that the community feels that we have about our approach, or if that we feel that the community has about its approach, making sure, have you thought about including this group? Have you thought about this segment or this sector of the population? That those things are assessed and understood early, because that's the kind of accountability measures that we're going to look for when we're trying to measure what are the KPIs, the key performance indicators that we'll look for about, is this actually making an impact and making a difference? Having all those variables covered down on is one of the KPIs that we'll have for our work.
Got it.
So thank you.
Thank you, Mr. Chair.
Thank you. Delegate Wallach.
Thank you, Mr. Chair. Good afternoon, Governor Moore and members of the panel. I really appreciate your leadership on this issue, as well as your presentation. I think when we look at the world of policy, we're looking at how to solve all these problems that we see out there. And poverty is really a root cause issue. And so if we get that right, we get so many other things right. And so again, I really appreciate your leadership on this, and also thinking of it holistically by bringing together economic opportunity, safety and security, and education for children. With that, my question specifically is about the creation of the Office of Children as a separate agency. The office now is responsible for funding and oversight of the local management boards, and local management boards are a key to community resources in the state. And is the department open to incorporating more oversight for the LMBs and possibly funding into this bill and including them as a more defined partner in the program?
So our very much our hope is that they will be part of this program. That's an example of an entity that could receive a regional capacity building grant, but also on the neighborhood implementation grants. We would expect that in many jurisdictions, the partnership could include the local management board. So I think our vision is that they would be key partners in this, not just with respect to the grant making, but again, the directive from the governor is that this is not just a program, but a way of governing. So I see it as my responsibility to work collaboratively with local management boards to do similar types of work across counties and the city in partnership with the local management boards. And then we'll also be working with my partners on the children's cabinet as we are executing policy at the state level to also be bringing the tenets of this initiative into that, thinking about ways that we can support the jurisdictions in the state with the highest concentrations of poverty, assist them in applying for grants, whether they be state grants, federal grants, or working with philanthropy to meet their needs. So it really is the governor, one of my first meetings with him said, and we're going to be in enough state that this isn't just one. This is a piece of a larger set of initiatives that will be driving to tackle these issues and taking this approach of listening to communities about what they need, thinking across silos, and looking for partnerships, including public-private partnerships to get the job done.
Thank you.
Delegate McComas.
Mr. Chair, may I add one piece to that response? Thank you so much. My apologies, Delegate. But I think it might add. I wanted to build on Delegate Wollick's question, actually Delegate Smith's original question. So I had the privilege of serving as the CEO of a local management board many years ago here in Maryland. I led Baltimore cities. And one of the things that's a hallmark there, and I know across many of your jurisdictions, is the absolute integration of community schools as being leaders and a force for change around the exact question you asked. So for example, we took for the first time in Maryland's history, a very small summer snack program in a few schools in Baltimore, leveraged a Share Our Strength, the national grant, and expanded for the first time ever in Baltimore and then the state, making comprehensive out of school time snack program and the first ever summer supper program. That was that partnership between LMBs who know communities well, serve as backbone institutions, and leverage the extraordinary networks of community schools. That I wanted to lift up here because, to the special secretary's point, we don't want to reinvent the wheel. We want to build on what already exists in community, and LMBs might just be the ones to be the leader. We're not sure, but we're not telling them. We're saying, if you'd like to do that, step up. What are your ideas? How might we strengthen the infrastructure? Because the other thing that this administration is trying to do is rebuild the Governor's Office for Children and the Children's Cabinet. As you know, Delegate, there had been some historical decreases in the investment in LMBs as part of being the strength around strategic planning for children and families. So I wanted to make sure I connected those dots about leveraging on the legislature's investment historically in local management boards.
Thank you. Delegate McComas.
Thank you, Mr. Chair. I appreciate it. I just want to commend the governor and his folks here, staff or cabinet level people for being here. With that said, I wanted to ask you a question. I'm sitting here trying to grasp what you want to do, and I'm thinking what you need is you almost need small little cities within Baltimore City or the other counties, basically to have some kind of leadership mechanism or leadership structure, because basically you're going to go to different groups and you're going to try to see if they're interested or whatever, but they're volunteer. Many of them maybe don't have the kind of community development training that you need. So I'm just kind of asking you, is there some kind of template that you are expanding upon, okay, whether it's a small study or a big study, and then how do you make sure that the folks that you develop, that they're going to have the necessary leadership skills that you really need to make this happen? Because personally, I'm sitting here thinking this is overwhelming. So, because I'm kind of thinking, how are you going to fix it? So if you can answer that question, I'd appreciate it. Thank you.
Thank you so much, Delegate, and maybe I'll take it first and pass on. Appreciate the question, and I think the thing that we know and continue to see in the communities, and I think Secretary Lopez mentioned it before, is for the communities who are dealing with these issues, whether they be urban, rural, or suburban issues in the state, oftentimes they know where the needs are, they know where the answers are. They're just hardly ever asked. Whereas, it was said earlier, the people who are closest to the challenges are the ones close to the solutions. They're just hardly ever at the table. And so really what Enough is basically saying is that we plan on working with them to be able to identify if you are in a community that qualifies, that is an eligibility target area, that we want to be able to hear your ideas, your thoughts, your work, and also then be able to provide our measurements of support and guidance as they're going both through the application process and also the build process. The thing that we do know is this is while Maryland will be the first state in the country to be able to do something like this from a statewide perspective, this is not new work. The idea of place-based investments are things that have been going on around the country. Place-based investment, you'll hear later on about the work that's being done in Atlanta around place-based investments that has significantly not just decreased violence rates, but also increased economic growth probabilities. We've seen this work taking place in Cincinnati. We've seen this work taking place in New York. And so Maryland will be the first state in the country to be able to add a state level guidance and supports on it. But place-based investing works. And the data continues to show that place-based investing work. This is just asking for us to add a measure of scale to it.
Yeah, exactly. And we will be providing supports to the community members who want to take on this work. As the governor mentioned, one of the national organizations that does this work across the country will be testifying a little bit later today. Purpose-Built Communities is the name of the organization. And we've engaged with national partners that do have resources available for local communities as they work to build their organizational backbone or organizational structure to do this work. This week I was in Prince George's County with the Lieutenant Governor, and we met with members of that community that are already investing in the workforce. Board is already investing in capacity building around the nonprofit organizations in the county, exactly to give them the ability to do this work and to think across programs and silos and work in collaboration with each other. So, I mean, I think you're absolutely right to point this out. It's hard work. It's easier to sort of think in silos, but we have seen it done successfully around the country. There are tools available to help support organizations in Maryland, and we've received a lot of interest in organizations coming to help and support the work that we're doing.
And we're going to do 3 more questions.
Just real quick. How you doing, man?
I'm good.
My governor, excellent panel. I wanted to support my committee chair. This piece of legislation is already bipartisan. Scrolling through the sponsors, I see old Cornbread's name on there, so we already got that checked off. I may not be the most compassionate person in this committee, but I walk my talk, and I co-sponsored this bill. So, speaking of compassion, Mr. Governor, I just want to say publicly, I appreciate the way you walk your talk. I mean, ever since we first met, the lower shore, we've always kind of felt like we were second fiddle, kind of geographically left behind. And you've been over there a lot. And I just want you to know I appreciate that. And I know how this program will benefit the place where I grew up. Amen. From Chrisfield to West Baltimore to Cumberland to everywhere in between. I haven't been this excited about a piece of legislation in a long time. And I just want you to know, man, I'm in. We're coming. We're going to do our best to allow generations, bless the generations come behind them. And so the question I'm going to leave with, is
no, let him keep going.
Yeah, Chair wants him down. Sorry, my dad's a preacher. Sometimes it gets rolling, Is this not the best committee in Annapolis?
That's a damn good question. So we're going to hear right there. The answer is absolutely yes, and I'm gonna let Miles take that one.
Yes, yes. Enthusiastic. Very good. All right, Delegate Lewis.
Thank you, Mr. Chair. First, I want to say, we appreciate you, Miles. I see him all the time. I just had to put it on the record. We all know who Miles is, and he's appreciated for his hard work. So my question, deals with actually the Office of Social Equity wasn't here. So as we all know, we passed a bill on cannabis, not too long ago and created the Office of Social Equity. 30% of the tax revenue is going to the Community Repair and Restore Fund, which I think are going to touch on very similar neighborhoods that the Enough Act is going to target, similar to the Thrive program that I think the governor and the secretary for starting. My question is can you all collaborate? Because I feel like these programs are going to touch the same neighborhoods, and anything that results in more dollars in neighborhoods that need them, whether that's in Prince George's County, like Capitol Heights, or Baltimore City or Crisfield. I think we're for those things, but I think from an appropriation standpoint, we want to make sure that we are leveraging strategically these limited public dollars as well as possible. So if we can collaborate the Community Repair and Restore Fund with Enough, be greatly appreciated. Thank you, Mr. Chair.
Thank you so much, Delegate, and absolutely, whether we're talking about, OSC or we're talking about additional funds, the level of collaboration has been baked in. Both in terms of legislation, but also in terms of how it's going to be operationalized within the governor's office of children. And you're right, where there will be neighborhoods where we will see overlap. There will be neighborhoods in some cases where we won't see overlap. I think the challenge that we continue to see when we just had an Enough event, as Special Secretary mentioned, in Capitol Heights yesterday. We were in the Shore, we're actually in Cambridge, I think 2 weeks ago, talking about the Enough Act. And so there will be places where we will absolutely see overlap, but also we want to make sure that we have a platform, and in the places that they don't, that they are still going to be seen, because they're still dealing with this issue of generational child poverty. But thank you.
Delegate Ivey.
Thank you, Mr. Chair. Thank you, Governor Moore, for being here and for proposing this legislation, and for showing up in my community, just like so many across the state. I was looking through, and it says that the awards would be attempted to be distributed in a manner that reflects the geographic diversity of the state, which I really appreciate that. My question is, how are we going to notify these organizations that could apply? Thank you, Governor.
So we're engaging stakeholders right now, so raising awareness about the initiative. But once hopefully when the bill is enacted, we definitely have a plan to engage stakeholders, enlisting local management boards assistance in that effort. They've made it clear to me that they're eager to help us with that role, but also other stakeholders in the healthcare sector, poverty sector, education sector. We're talking to them now, but we'll be ramping up those efforts to engage and partnering with the national nonprofits that have done this work in other places to provide them with additional tools and resources to understand the scope of the work and the things that they'll need to be thinking about to build an organizational structure to do this kind of work.
Be helpful in any way that we can. So
great. Thank you. Delegate Smith.
Second. Thank you, Mr. Chair. Sorry for a second bite at the apple, but some of the conversations prompted a thought. So Delegate Forbes had mentioned if there was an organization already working in community, but not necessarily based in that community, that they would still be eligible. But I do know that in many communities of high need, even if we look at the map provided, there's still gradations of intensity of poverty, even within that, that map. And so sometimes when you think about social capital, there may be more social capital in some of those communities that are, though poor, not as poor as some others, right? And so when we're thinking about equity, it's about trying to get down to the communities of highest need. And sometimes there may not be the same social capital to engage in what would be necessary to apply for a program like this in the communities of highest need. So I guess I have a question about how your rubric would account for intensity of the concentration of poverty. And then also around not corporations, maybe it's because sometimes some nonprofits are corporate in character, just to be candid. And so some of these organizations that would be eligible to help may not have leadership or staff that reflect the demographics of the community they might want to partner in. And so where I have a little concern is that sometimes the community organizations that have the most credibility may not rise to the radar of the state. They may not have a snazzy website or the other hallmarks of like activity that would be relevant to the community, but maybe not accessible at the level with which you're providing leadership. So I just wanted to know, does your rubric account for how grounded an organization is in community? It's different if they're already there, but this could incentivize parachuting into communities that you have no real demographic or leadership relationship to. And does your rubric account for that?
Yes, is the short answer. Thank you for that question. It's a great one. I mean, our intention here is to help the communities you're describing build that social capital. That's a core objective of this program, not necessarily, but at the same time, partnering and relying on existing capacity with, there's a lot of great nonprofits that might not live in that community that can offer assistance. So we're not going to turn that away, which again gets to the point that there's a few types of organizations that must be members of the partnership, but we'll very much be looking and judging applications based on their ability to build robust partnerships that go beyond those partners, but at the same time, building the capacity for the people living in those communities to be active participants. And we will hold the grant recipients accountable for showing that they have a governance structure, an organizational structure that shows that the people who live in the community have a seat at that table. And honestly, the idea behind planning grants and regional capacity building grants is to ensure that the communities you're describing, they might not be ready to fully implement in the next year, but the idea behind those resources is to very deliberately, intentionally build the social capital in those communities.
Thank you.
Great questions, committee. Governor, I want to thank you for using your powerful voice to lift up poverty and child poverty and making it an issue front and center in the state. I know this entire committee, you can hear, appreciates that. I do think I would be remiss though if we didn't take a step back a little bit to consider the fiscal climate that we're in. We know the state's facing a $3 billion shortfall in the general fund and a $3 billion shortfall in our transportation trust fund. So I want to give you an opportunity to address some who may say, how do we justify new spending given the fiscal climate?
I'd say two things. And first, I definitely understand it. I think that if you look at how we approach the budgetary process and how we approach the legislative process, the budget reality, it sits on us and it's real. We understand some of the challenges that are there, some of the challenges that are inherited, and we know that it's our responsibility to be able to help them navigate through them. I would say there's two things why I think this bill still becomes important. One is I think it goes to show why being able to be laser focused and data driven about how we're using resources, about why that matters. The thing that we know is just simply adding more capital or just spreading more capital. That's not going to be the answer. And we've had enough examples, frankly, in state history about that not being something that's going to significantly move a needle, whether it be public dollars, private dollars, or philanthropic dollars. We were speaking earlier, Debbie Edison, when we were, over in Brooklyn, talking about the amount of capital that, for example, has gone into philanthropic capital that went into Harlem Park and Sandtown Winchester between the years of 2015 and 2018. We're talking tens of millions of dollars. But if the money is not focused, if the money is not centered, if data is not driving the decisions, if there's not measurements of coordination, then you're just simply adding more money, but you're not going to actually change the indicators that we're all hoping for. That's why we believe this approach matters, because it really is a data-driven and heart-led approach about how we're using resources wisely to have core KPIs and core accountability. The second part, though, is we can't forget why so many of the economic challenges that the state is facing, why they exist. Part of the reason that we have grown by 0.2% over the past 5 years as a state, our economy, when the average state in this country has grown by 7.5%. Part of the reason why when we first came on board, Maryland was ranked 47th in economic momentum is because we continue to have concentrated pockets of poverty. Let's be clear. This is an economic drain on the entire state, that we have so many communities that are so deeply neglected that ends up having real economic consequences on our ability to grow GDP. And so I would say that, you know, that we are going to be disciplined. We are going to be data driven. I think if there's one thing that this administration and this team has shown is that we take governance seriously. We take the details seriously. And we also know this is we cannot, even in a time where we know we have some difficult decisions to make in terms of fiscal notes in our budgets, we cannot continue to looking at children who continue to be condemned in pockets of poverty and say, well, they're just going to have to wait. We can be smarter about the way we're making our investments to make real impacts that's both going to support our children and support our GDP and our economic growth.
Well, I think your answer gives voice to a lot of us here who understand that essentially what you're saying is, how can we afford not to?
That's right.
And I get that. What keeps me up at night is that, you know, we left here 3 or 4 years ago, passing the blueprint. We've expanded Medicaid. Hopeful we're going to pass this bill. And we've done these things that are so powerful and they're so necessary for our communities, but we're not just going to spend smarter our way out of $3 billion. And it keeps me up at night thinking next year we come, having passed this bill and been very pleased with ourselves, like the blueprint, only to have to cut it, only to have to cut the program and cut the blueprint. We're spending $367 million this year on concentration of poverty grants in the blueprint. It would be a shame, a damn shame, if we had to cut any of these programs. So I had bills yesterday in Ways and Means to raise revenue. And I do think at some point we're going to have a conversation about being serious about raising revenue to protect these investments that are so important to you and so important to this community. So I hope we can consider you a partner on that at some point.
No, if there's one thing I think we continue to show, we are active and eager partners inside this work. So we look forward to any and every conversation to be able to ensure that we're doing what's in the best interest of the people of the state, both now and in the future.
Thank you. Thank you for your leadership. Thanks for being with us. We're going to give you a couple minutes to exit because I know you like to say hello to everybody on your way out, but just a couple minutes. All right.
Thank you again, Mr. Chair.
Thanks for being with us.
Chair. Thank you all. Appreciate it.
While the governor's exiting, we can bring up Cheryl Boast, Carol Naughton, and Rashern Baker also on the governor's panel. I should announce that we, for all the witnesses here today, we do 2 minutes for witnesses, 2 minutes apiece. We let the governor and his panel go longer than that, but you know he's the governor, so 2 minutes.
Yes.
Do you remember?
How are you doing? How are you? I'm good.
All right, we do have a busy agenda, so if Mr. Secretary Miles, if you can see your way out. Let's give it one more minute here. All right, Ms. Boost, good to see you. And we did have just about an hour and 10-minute getting into the details of this, so no need to sort of get into the details. Just give us sort of why you're for the bill. Thanks.
I'll be quick, and then if, with your indulgence, I will then leave the panel because I'm up to testify across the hall. So, good afternoon, Chair Barnes, Vice Chair Wang, and esteemed members of the committee. I am Cheryl Boast, a Baltimore County 4th and 5th grade teacher, proudly serving as the president of the Maryland State Education Association. We represent over 75,000 educators who are right now working diligently with over 900,000 students in Maryland's pre-K to 12 public schools. At MSEA, we are always focused on children, and we're proud to stand in support of the Enough Act, the U, and Enough is a union, and the Moore-Miller administration's continued focus on eradicating childhood poverty. MSEA has long understood the need to support the whole child, the families, and the communities surrounding that child. The Moore-Miller administration's multi-pronged poverty fighting initiatives will nicely complement the priorities for our students laid out in the blueprint.
As educators, we know that poverty, particularly concentrated poverty, brings with it all types of challenges and traumas and obstacles to the success in the classroom. As a fourth grade teacher for many years at a Title I school in Baltimore County, I saw firsthand the impacts of childhood poverty. It was hard for students to focus on their academic success when in reality, they were wondering where their next meal would come from. Will they get to and from school safely? Will they have a warm coat on a cold day? And will they even have a place to sleep? I worked with parents who desired to feed and properly clothe their children and get them what they needed, trying to do their best, but knowing the funds they do have are not secure and barely cover the cost. These students and their families need more support than we can provide them at school and during the school day. The Blueprint for Maryland's Future and the more administration support for that landmark formula and you spearheading that will maximize the support we can give them at school and now even further in the community. So we urge a favorable report for the Enough Act. Thank you.
I think that's fine. I
Thank
think the
you.
county executive can answer any questions.
It's always good to be back in my old committee. Good to see you, Mr. Chair, Mr. Vice Chair, members of the committee. As I said, it's great to be back in my old committee. At one time when I had hair and it was black, I sat in these seats. So I just want to be here. I'll briefly just talk about why I support the governor's initiative. It's similar to something that we did in Prince George's County. When I came in, we saw a record number of homicides in the county. We saw truancy rates through the sky. Our loans were bad. Businesses weren't investing in the county. And if you look at the county as a whole, which is urban, suburban, and rural, there were 6 places in the county that if they didn't exist, Prince George's County would be one of the richest places in the United States. But those 6 places actually did exist. What didn't exist was a program that actually targeted them at the grassroots level of what the governor calls neighborhoods, what we call transitioning neighborhoods. And so what we decided to do, and the delegate over here, right here, actually said the right thing when she said, what we want are mini Baltimore cities. The idea is you take these areas and you treat them as their own cities or counties. And so you break down the silos of departments and you target them with neighborhood commitment. And so what we did in the county was we took every department and put them in these 6 areas, but we didn't just leave the departments there. We then got neighborhood committees to be a part of it, business committees, and we used that to see if we could turn around these areas in the county. Schools, state's attorney's office, all of these, as you know, Mr. Chair, were part of it. Now, it took time, and that's the thing you're going to have to know in the committee. It took time, but we saw reductions in each of those 6 areas, and we saw improvements in economic development over an 8-year period in there. So thank you, and I ask you to favorably move this bill out.
Good afternoon, everyone. My name is Carol Naughton. I'm the CEO of Purpose Built Communities. I'm delighted to be here. Thank you for this opportunity. Purpose Built Communities is a nonprofit that works with local leaders nationwide to strengthen neighborhoods of concentrated poverty so that they become places with deep, durable pathways to prosperity for everyone who calls that neighborhood home. I'm here today in support of the Enough Act. Purpose Built supports more than 25 neighborhood revitalization initiatives around the country, including one here in Maryland in the Cherry Hill neighborhood of Baltimore. Purpose Built works only where we're invited, and we are excited to be part of the governor's transformative effort to give those in underserved areas a pathway to a better life. I've submitted my written testimony, but I want to share a few additional thoughts with you based on what I've learned in my 30 years of leading people-centered, neighborhood-focused work that is designed to drive upward economic mobility, improved health outcomes, and greater racial equity. First, neighborhoods matter to all of us. They shape us, and in turn, we shape them. But not all neighborhoods and their residents have the same resources and opportunities. Some neighborhoods have been impacted by the intentional policies and practices that made life more difficult for Black and brown people while advantaging white people in their neighborhoods. And sadly, those policies have long, sticky tails. Now, none of us here are responsible for creating those policies, but we have a shared responsibility for unwinding their impact. I don't think this is just a moral imperative. but it isn't a moral imperative. It's an economic imperative as well. In order for Maryland and our country to be competitive in an ever-changing world, we need every young person to be prepared to be a lifelong learner and earner, ready for jobs that don't exist today. Our country is program rich and outcome poor when it comes to creating pathways for low-income people. We know siloed approaches don't work. Comprehensive place-based strategies that are both cross-sectoral and interdisciplinary can have great outcomes for kids. Strong collaborative partnerships between public, private, and nonprofit sectors result in outcomes that no one sector could achieve on their own. Addressing the fundamental conditions in which children and their families live, play, work, and learn can set people and their neighborhoods on upward trajectories with transformative and sustained results. For example, in the Eastlake neighborhood where I've worked for 25 years, that neighborhood's enjoyed a 90% reduction in crime, and that number has been sustained for 25 years. Incomes for the hundreds of families receiving deep housing subsidies are 5 times higher than in the public housing communities that predated the mixed income redevelopment. And neighborhood children attend one of the highest performing schools in Atlanta from pre-K through 12th grade, with graduation rates over 90% every year. In short, graduation rates are up, income rates are up, and crime is down. The neighborhood is inclusive, and deep and permanent affordability assures that the community is accessible. You know, I heard somebody ask the question about the blueprint before, and I wanted to say the kids do great when wonderful things are happening both inside their schoolhouse and outside the schoolhouse. And that's what we aim to try. You know, this is really long-term work, and while we'll see short-term outcomes in just a few years, it would be unrealistic to expect that challenges and obstacles that developed over generations can be remedied quickly.
Thank you. Thank you so much.
You're welcome.
For your
Thank you.
testimony and your passion and what you do. Any questions for the panel? Well, thanks to you both, and Mr. County Executive, it really is great to see you. Don't be a stranger, Mr. Chair.
Thanks.
Thank you. All right, we have the final governor's panel, Chancellor Perman, Council Member Porter, Kevin Beverly. Come on up. Welcome. Whoever wants to start.
Chair Barnes, Vice Chair Chang, members of the committee, thank you for this chance to testify in favor of the Enough Act. The governor describes this bill as a full frontal assault on childhood poverty, which, as we know, often metastasizes into lifelong poverty, generational poverty. It might seem counterintuitive for the chancellor of the university system, whose primary constituents are no longer children, to speak to the importance of this bill, but it's not. The USM has a tripartite mission: education, research, and service. Our universities are not merely in Maryland communities, they are of those communities. We are the anchor institutions whose partnership this bill requires. All of our universities partner with community leaders, nonprofits, agencies, schools to improve health, strengthen education, support families, create community wealth. We know that our job as universities starts long before children turn 18. If we want to prepare Maryland students for the opportunity of a higher education, we must first remove the obstacles that prevent too many of them from accessing it. Children who are hungry, who are cold, who are unsafe, vulnerable, they can't learn. Their path to an education is far steeper. So our mission is to level that path. But what we've learned along the way is that our communities must lead, exactly as the Enough Act specifies, because community-led is community engaged. Because if you want to know what your neighbors need, it's a good idea to ask them. And so we're eager to contribute our people, our assets, our expertise to these community-led efforts, collectively, collaboratively have an even greater impact on the public good. The USM enthusiastically supports the Enough Act. Thank you.
Good afternoon, everyone. I'm not going to call anybody by name because I don't know most of you. But I do thank you for the opportunity to speak on this today. I'm Kevin Beverly. I come here today having had a successful career as a CEO of a multinational public health research company. I live in Montgomery County. Wasn't always the case. I grew up on the Eastern Shore of Maryland. I grew up in poverty on a small island called Taylor's Island near the Blackwater Wildlife Refuge. Dorchester County has the second highest rate of child poverty on the Eastern Shore. And in Cambridge, our county seat, 1 out of 2 children live in poverty. The county suffers from both generational and situational poverty, where more minority children and families are impacted by generational poverty, and our seniors suffer from situational poverty. Why is this so significant? These children are our next generation workforce, and I speak to you from that perspective. You heard earlier, this is more than just a moral imperative. It's an economic imperative. The governor talked about if we don't do this, what are our chances of having that next generation workforce? The significance of why living in poverty for our children and those who are growing up in poverty are all those unmet nutritional needs, the substandard housing, the experience of trauma because of elevated crime and violence in their neighborhoods, and the lack of basic health care and underperforming high schools, elementary schools, and middle schools. So I come to you today as a business leader who is now taking over the local management board in Dorchester County with an effort to reimagine how that organization really does bring a different value to how this implementation of this bill, this act will really happen. We play a critical role in acting as a neutral convener and looking at all these cross-sector shareholders and stakeholders. We see a part of this that hasn't been mentioned, and that is our private side. Our private industries want to participate, but they don't know how to get in. They're looking for avenues where they can see something that looks like it might work and joining. Public-private is the only way this is going to work. And our abilities to invite and engage the business community is going to make you talk about where you're going to get your dollars from. Businesses are making money. How they deploy it in their communities to make sure they're getting what they deserve in terms of that next generation workforce. I think seeing programs like this and acts like this give us hope that we're now on a course to actually work towards solving this. The $15 million that you are going to spend on this gets us there. But thank you for the opportunity.
Thank you. For the record, I am Felicia Porter. I am the city councilwoman in Baltimore City, representing communities like Brooklyn, Cherry Hill, and some that were named today. And I'm also a public health scientist here to share my support for the Enough Act. Governor Moore emphasized the critical truth. A government is now, more than ever, working together. However, this unity must not halt here. If Maryland is to emerge as a beacon for the nation in eradicating child and concentrated poverty, we must intertwine all aspects by calling upon the philanthropic community to collaborate with city, state, and federal partners to combat the systemic issues afflicting some of our most affluent yet vulnerable communities. The Enough Act represents a pivotal step harnessing political will, cultural competency, and $15 million in state-level funding to ultimately diminish the number of children living in poverty. A key component of this legislation revolves around constructing neighborhood-level infrastructures to formulate strategies for more efficient access to the existing resources. As was mentioned, both public and private partnerships will prove indispensable during this implementation phase, building upon the existing infrastructure that many of our community-based organizations are dealing with every single day on shoestring budgets. In Montgomery County, eastern parts, including Breaks, Cheney, and Fairland neighborhoods, the challenges are palpable. Greencastle Elementary School illustrates this reality with nearly 2/3 of its students qualifying for free and reduced price meals. Moreover, unemployment rates soared to nearly 20%, significantly higher than the county's overall average, as one of the major affluent counties in the nation. Thank you. In Beltsville, Maryland, 8.6% of the population grapples with poverty, while meanwhile in other communities such as the Edgewood District, nearly 10% are caught in this grip as well. Wheaton echoes the tales of food insecurity, where the Hughes Methodist Church extends a lifeline to approximately 700 individuals each Tuesday. Yet poverty extends far beyond income alone. Another example in Allegheny County stands as a stark example, with severe housing problems gripping 13.8% of its population. Food insecurity paints an equally troubling picture, with Allegheny County leading in the state of 16.9%, followed closely by Somerset and Baltimore City. Equity just isn't a concept. It's our daily battle cry across the state of Maryland. And this is not something that impacts simply Baltimore City or Prince George's County, as I've demonstrated. This affects all of the 24 jurisdictions in the state of Maryland. And this is something that we need to do in order to make sure that our children, our next generation, makes a difference. Thank you.
Thank you so much, and thank you for your leadership. Any questions for this panel? Okay, that concludes the governor's panel. Thank you all for being with us. We are gonna strictly enforce the 2 minutes moving forward. Witnesses. I'm gonna call witnesses in 3 or 4 at a time. So when you get called, please come on up. Heidi Stevens, Andrew Masters, Ellie Mitchell, Elizabeth Sachs, and when you get whoever's at the desk first can just begin.
Good afternoon, committee chair, vice chair, and committee members. I'm Heidi Stevens, the Poppleton Neighborhood Zone and Community Schools Director for the United Way of Central Maryland. I've worked in communities all my life and in Southwest Baltimore for 7 years. I'm here on behalf of the United Way to support the Enough Act, HB 694, and to give you reasons why you should support it. I jumped at the opportunity to testify today because I've seen how communities that join together and focus on their individual, collective, and unique strengths can bring about fundamental transformation. So many times, communities struggle because of a lack of resources and disinvestment, and because people who live and work in that community lose hope. They work in silos, trying to move generational challenges designed to get the results we see now. People become frustrated. Some move away, and others resign to the fact that what they see will always be. In the Poppleton neighborhood of Southwest Baltimore, community organizations, faith leaders, community members, community schools, and strategic partners used to work in silos. Now we've formed a collaboration that hosts monthly community dinners designed to share stakeholders' resources and strengths. We have healthy and productive discussions about moving the needle forward in Poppleton regarding housing, jobs, mental health, and safe neighborhoods. Learning from information shared by the United Way Neighborhood Zone Community Advisory Team and the Community Association.
You do need to wrap up.
They work together to write grants that will benefit the entire community. Enough will allow communities to start from a position of strength, and we hope that we have a favorable outcome. Thank you so much for your time.
Thank you, and thanks for your work, United Way. Very critical. Yes, sir.
Good afternoon, Chair Barnes, Vice Chair Chang, and committee members. My name is Andrew Masters, Senior Director of Neighbors United, also with the United Way of Central Maryland. For nearly 100 years, United Way has been working across our region to meet the critical needs of individuals, households, and families. One of our keystone areas of work has been efforts in neighborhoods. This work closely aligns with the Enough Act that the committee is considering. And we at United Way of Central Maryland are for this bill and hope the committee gives it a favorable vote. The intergenerational, place-based approach that the Enough Act supports aligns closely with our approach to community building and resident leadership. We support this bill in its aim to develop cross-sector partnerships and recognizes the depth and breadth of complicated factors that families who battle poverty must overcome. A few years ago, United Way launched our Neighbors United initiative as a structured way to partner with community organizations and support the growth and strengthening of leadership capabilities of residents in Severn, Lansdowne, Aberdeen, Columbia, and Mondawmin to address the upstream or root cause issues that residents face. Our work in these communities have resulted in residents feeling more ownership of their communities and an increased sense of leadership and well-being. We partner with organizations and governmental entities in the implementation of Neighbors United, just like the Enough Act calls for, and have seen the success in our communities changing and residents growing to feel that they have control and leadership in their community. Residents like Mr. Eric and Miss Sandy. Mr. Eric recently launched his own nonprofit called Man Up. Because of Neighbors United and his involvement, he was able to take an active role in making the change he wanted to see in his neighborhood. This resulted in the community going over 100 days this summer with no shootings, which marked a tremendous monumental effort in their community. Thank you.
Good afternoon, Mr. Chair, Mr. Vice Chair, and members of the committee. My name is Elizabeth Sachs, and I'm a Deputy County Administrative Officer for Health and Community Services in Baltimore County. And I am here today because Baltimore County supports this legislation because we are doing this as I speak. It goes into detail in my written testimony, but we have used our American Rescue Plan dollars to do this very place-based partnership-oriented initiative. We started in the community of Essex. We knew that there was both child poverty and any number of other indicators of health disparities, income disparities, and using the data, we chose that initially as our target community. And as you can see in my written testimony, we are partnering with community organizations, MedStar, CCBC, all of the partners that also come together through other funding streams. But this is the one where it's totally rooted in the community. And while it's only about a year old, we are seeing success along indicators like trash and rat eradication. We've partnered with the Ripken Foundation. We are working with the community school. And so I'm here to say, having listened to the first panel, that this can work. And that, in fact, I would argue it's one of the best ways to make sure that the CRRF, we are actively trying to figure out how to deploy it within this model. I think it is probably one of the best ways to make sure the other funding that comes from the federal government that you have passed over the years can actually be deployed both to meet community needs, but also hear from communities. We are working with associations as described in the first panel as to what do they want and absolutely ensuring that they have a seat at the table. We've since expanded the model to Dundalk and Woodlawn. Aging shopping areas would have sparked community concern, but in fact, we are digging deeper to find out what additional concerns are in Woodlawn in particular, building up the commercial district so that we can begin to create economic opportunity. So I ask you to submit a favorable report because we are seeing this work in Baltimore County. Thank you.
Good afternoon, members of the committee, Chair Barnes, Vice Chair Chang. My name is Ellie Mitchell. I am the director of the Maryland Out of School Time Network. We also serve as the backbone for the Maryland Coalition for Community Schools, and we are also here on behalf of the Maryland Education Coalition. We're thrilled to see the triumphant return of the Governor's Office for Children. Collaboration, coordination, and collective action on behalf of children living in poverty has been missing support at the state level in Maryland. We know from research and practice that this is what it is going to take to really move outcomes for children. The Enough grant program will incentivize inclusive, systemic efforts, which we know will connect to community schools, will connect to our efforts around expanded learning. And despite the fiscal climate, we're actually not sure that $15 million is enough, but it is a good start. And I do agree that it will leverage additional funding at the local level, private level, and definitely federal opportunities that we have left on the table on behalf of children. And so we urge a favorable report for the Enough Act of 2024. Thank you.
Panel? Okay, thanks again.
Thank you.
All right, Tricia Swanson, Pamela Brown, Angela Martin, Kim Eisenreich.
Good afternoon, Chair Barnes, Vice Chair Chang, and delegates. I'm delighted to be here this afternoon. My name's Pam Brown, and I am the Director for the Local Management Board in Anne Arundel County. We're called the Partnership for Children, Youth and Families. I'm also the Legislative Chair for the Maryland Association of Local Management Boards. We had only just got over celebrating that the Governor's Office for Children was back with that marvelous model, which is the Children's Cabinet, Governor's Office for Children and Local Management Boards, which is unique to Maryland, and along came the Enough Act. We are delighted to support the Enough Act. It is part of our work. Every local management board does a needs assessment. Here's mine, Poverty Amidst Plenty. This is version 7. We have been talking about pockets of poverty in Maryland. Here we are, Poverty Amidst Plenty, for over 30 years. And finally, we are finally looking at place-based strategies that will address those issues. And I will simply say that we are also huge proponents of community schools. And what was said about this work being complementary is exactly right. Families and neighborhoods have to be okay for children to be okay. Children do not exist on their own. So I think what place-based strategies say is we've got to be in those neighborhoods. We've got to be working shoe to shoe with the families who live there and their children to make change. And that's how you change intergenerational poverty. We are in absolute support of it, and I am going to end there.
Thanks. Good afternoon. Thank you, Chairman Barnes and members of the committee for this opportunity. My name is Kim Eisenreich. I'm the director of the Howard County Local Management Board and chair of the Maryland Association of Local Management Boards. And as Pam said, we are in support of the Enough Act of 2024. Over 30 years ago, Maryland established a three-pronged approach to health and human services that has consistently received national recognition. The Children's Cabinet, Governor's Office for Children, and local management boards make up this infrastructure, with local management boards as the conduit between the community and the state. All 24 LMBs act as a neutral convener of our local collective impact strategies, tackling issues that contribute to child poverty, such as food insecurity, behavioral mental health, education, workforce development, and the racial disparities that compound these issues. We understand that each neighborhood is unique and experiences different challenges while leveraging unique assets. Our job is to understand these assets and challenges, work together with institutions, organizations, and community to address these needs so children, youth, their families, and their communities can thrive. And one way we do this in Howard County is through our place-based strategy called local leadership teams. Our approach aims to support community members by identifying inclusive strategies to eliminate disparities while working toward the cultivation of shared values and a vision for a more equitable community. This effort provides neighborhoods with a process for re-envisioning community that brings attention to creative integration of people, places, and processes that supports community needs while building stronger bonds among community members. Our approach differs from the traditional deficit view of community support to a strength-based approach that empowers community members by placing them in roles as leaders and as decision makers. Public agencies are supportive with resources, delivering technical assistance and training as determined by the community. So if the Enough Act is passed, it will enhance and expand local management boards' ability to tackle child poverty at the neighborhood level, transforming outcomes for Maryland's children, youth, and families. So we urge your support of the Enough Act. Thank you.
Good morning, Chair Barnes. Well, good afternoon, Chair Barnes, Vice Chair Chang, and committee members. I'm Angela Martin with Maryland Community Action Partnership. We represent the state's federally designated anti-poverty network of community action agencies, which serve every county in the state and provide those critical services needed for families and children to move them to economic mobility. We were created in '64 to address poverty. We were the answer then and we're the answer now. Our services align with the Enough Act. We support this act because it aligns with the mission and the goals of community action agencies. We are trusted partners in the community. We know how to effectively address child poverty. In order to address child poverty, you've got to address the whole family. Right now, we are implementing a statewide 2G approach. So we are immersed in this work. We are moving we're developing pathways for families to move towards economic mobility. So we support this bill. We feel like it strengthens what we do. It strengthens our work and makes it possible to see real change in our communities. While we support the overall goals of this Enough Act, we recommend an amendment to this legislation, specifically proposing funding for community action agencies be made available and existing exclusively for community action agencies as identified by Maryland Community Action Partnership in our written testimony. These agencies have a proven track record of addressing poverty and the needs and are well positioned to implement the objectives outlined in the bill. We urge your favorable support. Thank you.
Thank you all for being here. Have a good day. Damon Millard, Ia Shabrat Barber, Liz Parker, Michael Sanderson. Damon, good to see you.
Mr. Chair, it's a
My
pleasure.
friend from Young Dems. Don't tell him how many years ago.
No, I'm not gonna say that. Not gonna say that at all.
Good to see you.
Good to see you as well. Good afternoon, Mr. Chair, members of the committee, Damon Millard, President and CEO of Family League of Baltimore. You've heard a lot from my colleagues, Ms. Brown and Ms. Eisenreich, regarding the role of local management boards. So I don't have to go through that. You have our testimony. We do conduct our community health needs assessment, which really we were able to partner with Morgan State University that did a scan with an actual health equity lens. So if you see in terms of the community statistical areas, breaks it down between in terms of babies being born healthy all the way to juvenile justice arrests, or also in terms of high school graduation rates. You see in terms of those disparities within each of those community statistical areas within the city of Baltimore. There is a direct correlation in terms of those disparate outcomes with child poverty. From that standpoint, I'm just going to not speak as the head of a local management board, but as a son of the city of Baltimore, growing up in the 1980s during the dawn of the epidemic of crack cocaine. That's when you saw the disruption of our social fabric and networks within the city. Looking at a single mother raising a son, not knowing how she's going to raise him to be a man in that environment, she was brave enough and smart enough to know that she couldn't do it alone. So there was a village. The village included a number of folks who supported it, but also I think in terms of Arnold Mitchell, who had a karate school on the corner of Pennsylvania Avenue and Fulton Street, looking at it from a standpoint in terms of not about self-defense, but how to govern yourself in terms of physical fitness, as well as your mental fitness. And I apologize, sir. You also have Rosalie Hennigan, who had a drama corps that allowed individuals to show their theatrical pursuits, that was able to address head-on a fear that a young man had when it came to public speaking, to be before you today. And then none other than the mother of one of your colleagues from the 10th Legislative District. And her name was Edna Phillips. She was not only a Sunday school teacher, but she presided over the youth and young adult program at Wayland Baptist Church on Garrison Boulevard and Fairview Avenue, who was a painstaking mentor and tutor, and also drilled into me in terms of the importance of knowing the Robert's Rules of Order. So what I would like to say to you, that the scaffolding is there. You have an opportunity to help build that foundation. I thank you for your time.
Good afternoon. Thank you for allowing me to speak today. Liz Park from the Maryland Association of Youth Service Bureaus. I wanted to speak today in support of the Enough Act. Youth Service Bureaus are already in the communities. Before 1996, there were 22 youth service bureaus across the state in 10 jurisdictions. Today, there's only 7. We really are looking forward to having an opportunity to apply for some of these grants, to be back in those communities. We have agencies in Baltimore City and Baltimore County, Annapolis, Montgomery County, who are looking to come back on board. They're already in those communities and ready to help serve those youth. The majority of the work we do is mental health work, which children growing up in poverty have developmental trauma. and they need help with that trauma of living in poverty and having the experiences that they have to be able to be successful. So having that mental health piece be part of this bill, we were very excited to see. We are working with the governor's office just to make sure that there is some amendment language to allow quasi-governmental and governmental agencies to be partner agencies, not just lead agencies. Many youth service bureaus, like those in Prince George's County, are connected to their local government. Mine's in Greenbelt. We have them in Bowie, Laurel, District Heights, College Park. And then there was one in Rockville, Annapolis Youth Services, Baltimore City. At the Family League, we had some youth service bureaus. So we're just here in support of that and looking to work with the governor's office for children to really get in there in these communities and provide the services children need. Thank you.
Any questions? All right, great to see you both, Damon. Great to see you. Be a stranger. Christopher Cano, Bridget Blunt, Frank Boston, Christopher Dews.
Chairman Barnes, members of the House Appropriations Committee, we at SCIU Local 500 represent over 20,000 hardworking union members who serve the people in various roles from cradle to career. Many of our members come from working class backgrounds that began in underserved communities, and the Enough Act is meant to help. Living paycheck to paycheck, sadly, a way of life for far too many people in this nation, where many families can't afford an emergency expense of a few $100s. Systemic poverty is rampant in both urban and rural areas where outcomes in life can be correlated by your zip code, and these issues warrant action, and the Enough Act is a good first step in addressing them. And time again, neighborhoods-based solutions to address systemic issues are the best way to solve inequalities faced by our residents, and the Enough Act does much in making solutions as local as possible. We support these partnerships to solve major issues alongside local government, local schools, fellow labor unions, nonprofits, small businesses, faith-based, and other community organizations. The Enough Act aligns well with its goal of cradle to career education, with our role in the community and our members that are already providing these vital services. Ensuring all children have access to high quality education and care will equip individual families and in the communities for future success. Community initiatives that meet the needs and tap into opportunities in their neighborhood, including violence intervention programs, increase access to safe and affordable housing, improve public spaces, including parks and community gathering spaces, and economic development programs designed to bring good jobs to the community and support locally owned businesses and entrepreneurs to meet these neighborhood needs can be funded through grants set forth in this historic legislation. The rebuilding of neighborhood infrastructure with additional support for children and families should go far in eradicating the causes of poverty. And we'd like to thank Governor Moore, the leadership of this body, and you esteemed members of the colleagues for pushing this forward. And we ask you for favorable support.
Good afternoon, honorable members of the Maryland House Appropriations Committee. My name is Bridget Blount, and I'm honored to represent Baltimore's Promise as the Deputy Chief Executive Officer. Baltimore's Promise is a cradle to career collective impact organization and the only Strive Together network organization in the state of Maryland. We are dedicated to addressing inequitable outcomes for youth and families in Baltimore. I am here today in my official role as the Deputy Chief Executive Officer, but also as a child who grew up in the Park Heights community of Baltimore City. I should not be here today, but I am. And I stand before you in unwavering support of Governor Moore's Enough Act, because we recognize its potential to enact transformative change in our communities. If this act had been available when I was growing up 20 years ago, many of my peers may have had better chances at survival and fared better in life. Our organization has witnessed the power of community-led initiatives and understands that sustainable change requires the active involvement of leadership and individuals who are intimately understanding the challenges faced by our communities. The Enough Act's emphasis on community-driven solution ensures that the voices of those who are directly impacted by inequities are not only heard, but actively shapes the policies that will affect their lives. Additionally, place-based strategies acknowledges the unique challenges faced by different communities within our state. What we need in Park Heights, where the Preakness is often held every year, is different than what we might need in Rockville. Passing the act is crucial. It targets root causes of violence, fostering safer neighborhoods. Cradle to career access to education and support services set young people on paths of economic mobility. Investing in programs like Grads to Careers, which is operated by Baltimore's Promise, ensures residents have jobs. In conclusion, I urge the Maryland House Appropriations Committee to wholeheartedly support Governor Westmore's Enough Act. Thank you.
That's on me. Yes, goodness. My name is Christopher Dews. I'm representing the Center for Urban Families here today to support the Enough Act for one primary reason. With the Center for Urban Families, we operate in District 40, where 33% of the children live in poverty and 26% of the individuals generally live beneath the poverty level. And we have created what was called the Baltimore Communities Assisting and Advancing Neighborhoods Program, which is currently sponsored by the Robin Hood Foundation, which is, of course, the organization that Governor Moore was a part of that led to the creation of the Enough Act. But the mission was to fight poverty throughout Baltimore City with an emphasis on West Baltimore and a variety of neighborhoods that are a part of it. Its ideas and projects were inspired by an advisory council of city residents and 20 community organizations who designed the change that they would like to see. And for the last 2 years, we've worked with 286 community members who participated in a variety of leadership trainings, received case management services, job services, employment services, and the like. We've created and actually funded 8 different community programs that have to do with workforce development, education, specifically targeting individuals ages 14 to 24. We've seen a lot of success with that. I just mentioned all that to say that the Enough Act works. We've already seen it as a microcosm through the Robin Hood Foundation, and we see that if this were to be expanded, we hope that we can continue our work through the BCAM partnership with the Center for Urban Families and Robin Hood Foundation, as well as now with the Governor's Office of Children to expand this work to a greater capacity. And with that, I thank you for your time.
Thank you all for your voices and leadership. We have a last panel and then one virtual witness, Ari Plout, John Willems, Summer Cook.
Good afternoon, Mr. Chairman, members of the committee. My name is Ari Plout. I'm here on behalf of Baltimore Promise. Frank Boston was on the previous panel. He was in another committee hearing that's unable to attend. You heard from Bridget from Baltimore Promise. We are a nonprofit organization dedicated to addressing systemic issues affecting youth and families in Baltimore. We're in strong support of this bill, House Bill 694. We believe this bill will have a tremendous positive impact on communities tackling child poverty. Baltimore Promise uses the power of data to identify and prioritize mechanisms to tackle youth and family issues. The emphasis on community-driven solutions is essential, and we applaud the governor for including this. We support place-based strategies as each community has distinct and unique problems. This bill is focused on that, which we believe will create safer neighborhoods. This bill will promote access to high-level education from early childhood. And as a cradle to career collective impact organization, we strongly believe in and support these initiatives articulated in the bill. Thank you for your time. We ask for a favorable report. Thank you.
Hello, my name is Summer Cook, and I am a lifetime resident of Rockville, Maryland. I want to thank the Governor Moore for introducing this legislation and the Appropriations Committee for considering this bill. Thank you for the opportunity to speak in support of the Enough Act. As a lower income single mom who has struggled to make ends meet, I strongly support the Enough Act. This bill will provide much needed support to programs that are working to reduce child poverty, programs like the Montgomery County Community Action Agency, which has had a significant impact on my life. I have been fortunate to have my taxes prepared by the Montgomery County Community Action Agency's Volunteer Income Tax Assistance Program for over 12 years. The program connected me with the Earned Income Tax Credit, Child Tax Credit, and other credits that I was eligible for, which really increased my tax refunds and helped me to pay for basic necessities. I was also able to save enough money from my tax refunds over the years for a down payment on a house where me and my daughter and I currently live. In addition to the VITA program, I was in the Head Start program and my daughter was in the Head Start. The Community Action Agency oversees the county's Head Start grant, and many community action agencies in the state operate Head Start programs directly. I'm sure you are all aware of the incredible impact that Head Start has had on reducing poverty and improving outcomes for the millions of children nationwide who has participated in the program since its creations in the 60s. As someone who has received services from the Community Action Agency, I know firsthand the impact that these programs have. I therefore strongly recommend and amend to the bill that would allow half of the funding to the Community Action Agency, which has been working to reduce child poverty for nearly 60 years. Thank you for the opportunity for me to be able to testify today, and I strongly support the Enough Act and ask for the committee for your support. Thank you.
Doing, I think it's really important.
Thank
Really
you.
important context for what we're doing today. Any questions? Okay. John Williams.
Mr. Chairman, members of the committee, John Willems, representing the Maryland Association of Boards of Education on behalf of all 24 boards here today. Please be testifying in strong support of House Bill 694. I think the committee has heard and engaged in some questions around the role of public schools and community schools and the community schools program under the Blueprint for Maryland's Future in particular. That makes us integral partners in this work and strong supporters of launching the Enough Grant program. I would say that in the kind of like it or not category, we brought in an internationally recognized consultant to the Kirwan Commission to help develop the blueprint. And right off the bat, and if you go to the Kirwan Commission report, the first page is dedicated to acknowledging that the rest of the world, the rest of the first world, doesn't allow women and children to live in poverty. They have safety nets in place that prevent conditions that are endemic to the lives of far too many Americans and far too many Marylanders. And so the programs that we're standing up to address neighborhood, community, family, and child poverty are essential to creating a stronger foundation on which we can build a successful and world-class public education system. And with that, again, would urge a favorable report on this bill. Thank you.
Okay, thanks for being with us.
Thanks.
Have a great day. All right, last witness on this bill, online. Carol, do we have Grant Schmelzer? Grant, welcome. I understand we have a mutual friend, so even more happy to see you today. You have 2 minutes.
Chair Barnes, I appreciate it. Committee members, my name is Grant Schmelzer. I am the CEO of the Independent Electrical Contractors Trade Association, which is based in Laurel, Maryland. I'm a Montgomery County resident. I really like this committee. I've never testified in front of this committee. You guys are fun. I'm normally in a lot of other committees, but never testified here. So IEC is a trade association. We are the largest apprenticeship program in the state of Maryland. We are training almost 1,000 apprentices across the state. We have training sites in as far west as Hagerstown at Hagerstown Community College, all the way to Salisbury and everywhere in between. I come before you to just share some information. I am not here testifying on behalf of any committees that I'm appointed to, but just to lend some context to my comments. I have sat on the Maryland State Apprenticeship Program, Apprenticeship Training Council for 4 governors now. I am currently on my second round on the Youth Apprenticeship Advisory Council under obviously Governor Moore. I'm very thankful to Delegate Smith, who made the correlation between the blueprint and what this Enough bill is going into. My biggest concern is on page 3 of the document under partner organizations. Many small businesses just don't have the resources to participate. And as an association, we would like to see an amendment to this section to include association works. There does call for organizations in there, but it doesn't specifically spell out that trade associations can be part of this conglomerate. Dr. Brown, I've worked with under the definition, if they were going to be going for one of these grants, I don't know that IAC could partner up with Dr. Brown. I also sit on WorkSource Montgomery, so I'm very familiar with the workforce system. IAC Chesapeake has more than 20 of its employer members that are currently employing youth apprentices as part of the blueprint. We continue to grow that program. We are participating with Baltimore County, Montgomery County, Howard County, Anne Arundel, and Prince George's County. We are expanding the program. We are also currently running pre-apprenticeship programs with Howard, Montgomery, and Anne Arundel. Our biggest success has been in Anne Arundel County with Anne Arundel County Workforce Development Corporation, focusing in on Meade and North County high schools, two very schools that are at-risk populations. And this would really help, this legislation would significantly help us be able to capacity build and build this and provide opportunities for our young people who are in at-risk situations. So I thank you. If you have any questions, feel free to ask. Thank you, Chair.
Okay, thanks for making the amendment succinct. I think we followed it, and we'll do our best to get it in there for you. Thanks for being with us. Hi to Ari for me. Thanks. Have a good day. That concludes the bill hearing. We're going to now move. I think our treasurer has joined us. Miles, great to see you. I'll give Miles a shout out on the way out. It's a joke from earlier, Mr. Treasurer. So don't. How about a round of applause for the treasurer on his way in? And anybody you want to bring up, Mr. Treasurer, nice to see you.
Nice to see you, sir. How is everybody today? Which bill would you like to take first, sir? 846. First of all, good afternoon once again, everybody. This is my team. To my immediate left is Kate Allen with the Office of the Attorney General. To her left is Laura Addis, my Deputy Director for Public Policy. To my right is the Chief Deputy and Office of State Treasurer, John Martin. And to his right is Keith Morris, the guy who runs our investment division and makes all the money. So that's us. Listen, you all have my written testimony, so I'll just give you an abbreviated version of what's going on with this. And if you have any questions, obviously we'll take that. Last year, when we were before this committee, we were given additional powers as it relates to investments, to invest in more high grade securities, commercial paper, et cetera. And it's worked out great, by the way. We had 300 million last year, generally did about prior, in years prior, we did maybe a high of 58 million. This year, the estimate is that we will also again bring in 300 million in new revenue. So I know that's not even a dent in what you guys are facing, but it's still, it's still something more. But what we found out during this process, which is why I have the Attorney General here, or our Assistant Attorney General, is that we interpreted a section more broadly than what they believe we had the authority to do. Just a misunderstanding, didn't cause any problems, except they, in some of the commercial paper that we invested in, because we've been advised we didn't have the authority, I was advised that we should sell that prior to maturity, but doing that would cost us 15 to 20 million, and I wasn't doing that. That wasn't going to happen. So we're here, seeking a new structure that would allow us to do it by regulation and not by statute, and B, to also allow us to be able to keep those investments until they reach maturity. I don't think I left any. Did I leave anything out? We're strengthening the partnerships, our partnerships with the county. I think Mako is going to testify favorable with amendment as well. And with that, Mr. Chairman, members of the committee, that's the bill. Yes.
Great. Do we have any questions for our treasurer panel? Looks like you did get it all, Mr. Treasurer. Oh, I'm sorry. Doug Schmiegel.
I'm sorry, Mr. Chair. Thank you. Thank you, Mr. Treasurer. I just wanted to ask, I know that local governments are also subject to state rules as to what they can and can't invest their funds into to get some interest on. And I'm wondering if your team knows whether the regulatory changes that you might make if this bill passes would affect what local governments can invest and cannot invest. I know you mentioned Mako was going to be here later, but does your team have a sense as to whether or not this would affect local government's ability to invest their own funds?
We do, and John, take this if I get it wrong. We do sort of set the rules, if you will, but part of the amendment that they're offering, or did we offer it or they offering it?
They're in our amendments as well, it's consensus.
We have a consensus amendment that will protect their authority to do what they are interested in, but still allowing the state to have the flexibility to be able to move and to do it through regulations and not statutorily.
Great, thank you.
All right, we do have one witness, Mr. Sanderson. Okay. Michael Sanderson, come on up. And Treasurer, you're welcome to stay there since your bill's next, if you'd like.
Thank you very much, Mr. Chairman, members of the committee. Michael Sanderson with the Maryland Association of Counties. You've already heard the prelude. We're on board with these consensus amendments. When it comes to investment policies, the state's the dog, local governments are the tail. The original version of the bill gave us a little bit of pause, but the treasurer and his staff were very accommodating. The amendments will say that they consult with local governments who would be affected, whether it's a broadening or more particularly if it's a narrowing of investment options. We'd have to catch up with the state on that front. Consultation sounds great. That's in the amendments and we support them.
Thank you very much, Mr. Sanderson. Are there any questions from Mr. Sanderson? Great, thank you very much. That concludes the bill hearing for House Bill 846. The committee will now move on to House Bill 1150, Treasurer Maryland Uniform Disposition of Abandoned Property Act, Maryland 529 Program Exemption. Mr. Treasurer.
Thank you very much, Mr. Vice Chairman. This particular bill rises out, you'll never guess, a problem with the 529 program. And that's the gift that just keeps on giving. As it relates to, maybe I shouldn't have said that. Anyway, as it relates to the abandoned property law, back in both 2014 and in 2019 legislative audits, they sought guidance from the Office of the Attorney General as it relates to Maryland 529 accounts and unclaimed checks. The long and short of it is that it's been determined that the law should have applied or should be applied to the accounts, should not be applied to the accounts, but should be applied to the unclaimed checks. So this bill is basically that we have before you to codify that guidance. And with the amendments that we're proposing, it would exempt accounts but not checks for the Maryland College Investment Plan, the Maryland Prepaid College Trust, and the Maryland ABLE program from the abandoned property law. This will enable my team to develop procedures to govern account activity and to identify a process for transferring unclaimed checks to the comptroller's office. And with that, we ask for a favorable amendment. Favorable with amendment.
Great, thank you very much, Mr. Treasurer. Any questions from members of the committee on this bill for the treasurer, House Bill 1150? Okay, great. Thank you very much. That concludes the bill hearing for House Bill 1150.
All right, I guess we're ready for the BFA. Secretary Grady, nice to see you. Mr. Nicole, come on up. Guess I should say for the record, House Bill 352.
Thank you and good afternoon, Mr. Chair, Mr. Vice Chair, and members of the committee. My name is Helene Grady. I'm Secretary of Budget and Management, and I'm here with Deputy Secretary Mark Nicole this afternoon. We thank you for the opportunity to present the administration's Budget Reconciliation and Financing Act, which implements several actions to balance the fiscal 2025 budget and to provide out-year structural budget relief. These budget actions provide approximately $1.8 billion in general fund savings through fiscal year 2029, including $1 billion in savings between 2024 and 2025. First, I want to share some context for this BRFA. I know we do not have consensus on the approach the administration took with this budget, but I hope the testimony today will help folks understand why we proposed the measures that we did. The governor's fiscal 25 budget proposal continues the administration's commitment to fiscal discipline, addressing some of the state's critical and immediate needs while providing out-year structural budget relief. The governor and administration have been clear-eyed about the structural deficit and have acknowledged the problem since prior to assuming office. This transitional budget reflects progress on key objectives and allows us time to work in partnership with the legislature to address our longer-term structural challenges. The governor's proposed budget meets the Spending Affordability Committee's recommendations to balance the budget on a cash basis with a minimum $100 million fund balance, reduce the fiscal 2025 structural deficit by at least 33%, and maintain a rainy day fund balance of at least 8.5% of general fund revenues. The proposed budget accomplishes these objectives while also making critical and in some cases historic investments in top priorities for Marylanders. These include public safety, education, childcare, housing, economic development, and workforce development, as well as critical investments in our state workforce that will help our agencies better serve Marylanders. We agree with many of the important and laudable programs that were previously established, and you see many of these reflected in the proposed budget, including historic funding under the blueprint for pre-K through 12 education, an increase of $461 million in the proposed budget, and record funding for the Child Care Scholarship Program, an additional $270 million annually and nearly $490 million over 2 years. In order to meet our fiscal responsibility objectives, while also prioritizing these critical investment areas, the administration had to make some difficult trade-offs and worked to refocus state government toward funding what we see as some of the state's most core responsibilities, evaluating how and what the state is spending its money on before considering asking taxpayers to contribute more. This requires reining in some spending that grew unsustainably during the pandemic years in order to redirect resources across what we see again as some of the state's most core responsibilities and highest priorities. The approach taken by the administration reflected in the BRFA includes providing relief from various funding mandates, both one-time and ongoing, increasing revenues to the general fund in both the short and long term, expanding allowable uses of certain funds and revenues, as well as authorizing fund transfers, and making other changes to current law to provide budget relief in the short and or long term to both the general fund and the transportation trust fund. As DLS's forecast indicates, this work is only going to get harder in the years to come. The measures included in the BRFA, in our view, represent a strong starting point for the hard work ahead. For the sake of time, I don't intend to speak to every measure, of which there are more than 30 in the BRFA, but plan to speak to some of the most significant measures, although we are happy to answer questions on any of the measures. First, when it comes to mandate relief, the BRFA allows the administration to propose meaningful mandate relief in both the short and long term to address the state's structural budget challenge. To this end, the BRFA includes 13 such provisions, the most significant of which include a provision that seeks to rebase funding for the CADE formula for community colleges in fiscal 2025 and the out years. Under current law, funding for the local community colleges has grown by 57% since just fiscal year 2021. The BRFA provision still allows for more than 50% growth in funding over the last 4 years, an increase of $125 million annually versus the $250 million in funding just 4 years ago. Per FTE spending grows by 86% from fiscal year 21 to fiscal year 25. Another provision seeks to rebase funding for the Selinger formula for non-public higher education institutions by tying the formula to undergraduate enrollment only rather than total enrollment. Under current law, funding for private colleges and universities has grown by 132% since fiscal year 2021. After the BFA provision, funding for the program would grow by 19% over the last 4 years. Moving to the next category of measures, the BFA includes 4 measures that seek revenue adjustments, with the 3 most significant being a measure to reduce the downward adjustment to general fund revenues from revenue volatility to $100 million in fiscal 25 and 2026. Second, a measure that increases interest revenue to the general fund for 25 through 28 by limiting the number of special funds allowed to earn interest on their fund balances. And third, a measure that proposes to reduce the commissions paid to lottery agents from 6% to 5.5% on sales and from 3% to 2% on cashing. Under current law, lottery commissions have grown by $56 million or 34% since fiscal 2020. After the BFA provision, lottery agent commissions will have grown by closer to 15% over the last 5 years. The proposed adjustment also brings Maryland's commission rates more in line with neighboring states. Moving to fund transfers, the BFA expands the allowable use on 3 special funds. Additionally, the bill authorizes 6 transfers to the general fund, the largest of which include $149.5 million in the dedicated purpose account reserved for cybersecurity, $44 million in the dedicated purpose account reserved for capital projects that are no longer needed, and $40 million in excess funds in the reserve account established by the state to pay unemployment compensation for state employees. The BFA also includes 2 measures that reflect cost avoidance. One authorizes the Maryland State Department of Education to implement a freeze in the Child Care Scholarship Program enrollment, if needed, to ensure that the program is able to live within its newly expanded funding levels in fiscal 24 and fiscal 25. The second cost avoidance measure allows the Maryland Department of Health to establish a limit on the dollar amount of individual directed and family directed goods and services provided to a recipient. Additionally, the BFA includes several provisions needed to align program spending with available funding in support of the January 2024 Consolidated Transportation Program. Finally, one notable other provision within the BFA is the provision that seeks to authorize the transfer of $90 million from the Strategic Energy Investment Fund to the dedicated purpose account. The funding will be used to support the implementation of the Climate Solutions Now Act of 2022 and Maryland's Climate Pollution Reduction Plan. A majority of the funding must support programs helping low and moderate income families or overburdened or underserved communities. With that summary, I'd like to ask Mark Nicole to summarize briefly a few proposed amendments that we're bringing as well.
Thank you, Good to see you. Thank you, Mr. Chairman. For the record, Mark Nicole, Deputy Secretary of the Maryland Department of Budget and Management. The administration is offering 9 amendments that make clarifications and modifications to the Budget Reconciliation and Financing Act. These amendments support and provide additional budget relief in support of the governor's budget plan. The amendments begin on page 8. The first amendment would expand the allowable uses of the senior prescription drug program. The second amendment clarifies the intent of the provision in the original Budget Reconciliation Financing Act so that it applies to fiscal year 2024 in addition to 2025 through 2031. The third amendment expands the allowable uses of the Maryland Police Training and Standards Fund to be used for both police activities and correctional activities. Amendment number 4, adjust the revenue adjustment under revenue volatility provision to be 0 in both fiscal years 2024 and 2025. Amendment number 5 reduces the supplemental retirement contribution from $75 million a year to $50 million a year. Amendment number 6 increases the amount of transfer from the state's self-insured unemployment insurance fund from $40 million to $60 million. Amendment number 7 transfers $10 million from the school construction revolving loan fund to the general fund. Amendment number 8 makes some minor modifications to original amendment in the Budget Reconciliation Act, reducing the transfer from $355,000 to $151,000. And amendment number 9 is a clarification on a provision that was provided in the governor's fiscal year 2024 budget for PAYGO capital for an organization where the amendment would allow for some expanded use of those funds. And we also are planning, Mr. Chair, to submit an amendment to the capital budget bill. We did not decide to include it in this bill, but it will be to deauthorize some longstanding capital authorizations dating all the way back to, in one instance, 2003. And that will total about $9.1 million.
In closing, the Department of Budget and Management believes that the BRFA of 2024 as amended is necessary to ensure a balanced fiscal 2025 budget and to provide out-year structural budget relief. For these reasons, we urge the committees to vote favorable with amendments on HB 352.
Madam Secretary, questions for Secretary Mr. Nicole? Delegate Smith.
Thank you, Mr. Chair. Thank you, Secretary Grady. Thank you for your presentation. I wanted to just ask about the child care subsidy copays. I know that there's a lot of tough decisions that had to be made, but that is a new revenue source, and it's something that would be imposed on obviously some of our neediest working families. So I wanted to just understand more about that decision.
Sure. Sorry, and thank you for the question. So it's true that as part of the budget, the administration, first and foremost, I do want to reiterate, we're really, I was going to say proud, but I don't think that's the right word, but we take very seriously the significant investment in the proposed budget for the Child Care Scholarship Program. As you can see from all the BRFA items, that was not an easy investment to be able to do within the rubric that we were working under the governor's direction with this proposed budget. But it was prioritized toward the top of the agenda among just a couple of other really important priorities for a lot of good reasons. And in doing so, I think what I would say is that in our first year in the administration, we had a very quick lesson on how the current Child Care Scholarship Program works and the important changes that have been made in recent years by both the General Assembly and the MSDE to enhance and expand that program, all with great intention and great alignment with our broader policy priorities. At the same time, it became very clear and apparent to us this fall that the budget management and ability to project accurately and manage to projected investment amounts for that program were nowhere near where we need to be able to live within the budgeted amounts. And I think that recent changes to the program that broadened it to reflect more of an entitlement program were done without necessary management techniques and tools to be able to manage to the budget or to be able to project accurately in the budget what those costs would be. So that was a lesson hard learned by us this fall, and hence the 2024 investment that you see in the governor's budget to fully fund that this year. As part of evaluating our response to that and thinking through lessons learned and how can we manage the budget for the Child Care Scholarship Program going forward in a way that's sustainable, and not to echo some of the chair's comments from the earlier bill hearing, but so that we are not in a place where we have to be back in future years cutting that program, particularly given the critical importance across so many of our policy priorities that it represents. We felt incumbent on two measures. One is in the BRFA, which relates to the ability to wait list if needed. The second, and Carmel Martin, who was here earlier, was actually really helpful in this regard, but we were able to quickly benchmark some of our program parameters against the national, other states, and what the federal government is really recommending for states. We found that our copay structure was far below even what the federal government recommends for states. And so we did see that as an area, particularly given that our income eligibility is relatively high, where a sliding scale, where families contribute a little bit more toward the cost of their childcare, particularly at the upper levels of that sliding scale, makes sense in partnership with the investment that the state's putting behind the program to really expand the services available. Is that responsive?
No, I appreciate your response, but I am just deeply troubled that the hard decisions around how to access new revenues are still being made on the backs of the poorest families. We haven't asked a lot of Marylanders broadly, and so I do feel some of the budgetary constraints we're discussing are a bit artificial and arbitrary, and then putting undue pressure on people who clearly need to access subsidy to afford childcare in order for them to be tax-paying workers. So I appreciate the considerations that were made, but I do find it troubling that new revenue is only associated with some of our poorer families. Thank you.
Delegate Mangio.
Thank you, Mr. Chair. Thank you, Madam Secretary, for being here. And I wanted to ask a question on behalf of a couple of constituents that reached out in regards to the Department of Developmental Disabilities, and a question that stems from the self-directed care. So the question, and I'll just throw them out and you answer them and I'll leave you alone, but they just want to hear what you have to say in terms of, number one, doesn't setting an artificial cap on one category limit the individual's ability to access their funds according to their individual needs? So if you can answer that, and then I'll have two quick follow-ups.
Sure, and I might ask, Mr. Chair, we do have a representative of the Maryland Department of Health here to support us on questions related to the self-directed services. Is it okay for them to join me at the table?
Yes. Yep.
Thank you, I appreciate that.
Good afternoon. Thank you. For the record, Erin McMullen, I'm Chief of Staff at Maryland Department of Health. The BRFA provision that you cited would go back to what happened before the Self-Directed Services Act was passed by the General Assembly in 2022. So before that bill was passed, we had a cap at the department on the individual and family directed goods and services that you mentioned. So this would, this change in the BRFA would return to that prior provision. I just want to say that the list of individual goods and services is very, very specific. So people will still be able to utilize their budgets. There are not other changes in the BRFA related to the Self-Directed Services Act. There were a number of other things added, like 30 hours for a support worker monthly. So all of those things are still intact.
Okay, and then the follow-up would be very simply, were all the stakeholders involved in these discussions about ways to save without that restriction that you put on?
So leading up to the budget decisions, the administration worked closely with the Department of Budget and Management on those as we were putting together the governor's budget. I think that we have met with the self-directed advocates. We met with them earlier this week to talk about this item and have met with them prior to session. I think to be fully transparent, the fiscal note for the Self-Directed Services Act did not include a fiscal impact as it relates to, it said it was indeterminate what the effect of lifting this cap would be. And what we have seen in fiscal 24, since that has been enacted, is it has really created an unfunded mandate in DDA's budget.
Thank you for your answers, and I'll follow up with any questions that this individual may have. So I appreciate your time.
Delegate Shetty.
Thank you so much, Mr. Chair. And I actually have some follow-ups to Delegate Mangioni's question. So thank you for calling on me in this order. Thank you for your testimony today. I have two areas I need to ask some questions on. So one is related to the DDA self-directed services. How did DBM and the Department of Health come to the $5,000 cap? Like, how did you pick that number?
Sure. So we were looking to return to what had previously been in place prior to the Self-Directed Services Act being passed.
Okay, and what happens to individuals whose plans and budgets and expenses have been approved by DDA? They have budgets there and then they hit the cap, but they still have money left over. What happens?
Sure. Are you asking specifically if this change would go into effect?
Yes.
What would happen?
Yeah.
Sure. So changing the statute would just be the first step. So since this is a home and community-based services waiver that's approved by the Federal Centers for Medicaid and Medicare Services, we cannot make this change without going through a few different public comment periods. So we will have to seek a waiver from CMS in order to implement that cap. At the state level, there's a 30-day public comment period that we would have to account for, and the federal government also has a 30-day public comment period. So we would have to work through all of those things as we think about modifying our waiver should this provision pass.
Okay, thank you. That's helpful, but not exactly what I was asking. I apologize. Maybe I wasn't clear. So the question was, we're hearing from families who have children who receive services through this program, and they are telling us that all of their expenses, all of the programs are approved by DDA before they're able to access them. But if they were not able to, if the cap goes into effect, the money will remain in their budget that has already been approved by DDA. Is that accurate?
Yes. It's because individuals self-direct their services, people's budgets are unique to them. So it's hard for me to comment at an aggregate level of what would happen at an individual budget level, since everyone's budgets are individualized based on their service needs.
Okay, and these are budgets, so where DDA has determined that these services are required for this individual.
So the self-directed, the way someone's budget would be put together is based on their individual needs, but then there's ability for that individual who's self-directing their services to shift funds between different services, individual family goods and services being one of them. That's how it works today. People can put in a budget modification if they want to do that.
Okay, and then my last question is related to the Pediatric Cancer Research Fund. That program was funded just a few years ago, and the money as passed in the law says that it cannot be transferred. I think there was like $5 million appropriated to it. The department has been working on regulations, I believe, with stakeholders on how to distribute those funds. And I know that there's legislation in this legislative session to provide further guidance and support. Why was the decision made to zero out the $5 million despite the legal requirement that not occur?
So I can take that question, and Aaron may want to add to it if I miss anything important, but I think just it comes down to decisions that we were making in order to balance the budget. The BRFA item recognizes the fact that the law stated what it stated, and that's why this is an item appearing in our BRFA. I think it was based on the premise, one, that the program had not yet quite gotten off the ground. And secondly, when I talked a little bit about how we went about our process of landing on these decisions and trade-offs, we were looking at, from our perspective, coming in as a new administration, what do we think are some of the state's most core responsibilities? And how do we fund those to the best of our ability and direct the resources as strategically as we can? When it comes to biomedical research, I think our position as developing the budget and the BRFA was that, state funding for biomedical research is very much secondary in our view to federal funding through the NIH and the other federal agencies who really take on that mission and who fund our research institutions here in the state of Maryland to very generous levels. And our research institutions do amazing things with the federal dollars they receive. In our view, as we were studying how state dollars are allocated, that was one area that we came down on the side of decision that, in our view, again, that not being among the most core responsibilities for state government and state general fund dollars. And in light of the mandate we have to balance the budget within the confines of the Spending Affordability Committee recommendations, that is one trade-off that we decided to propose.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Chair. Delegate Harris.
Appreciate it, Mr. Chair. Thank you for your testimony at this time. So quick question, want to dive into our colleges, especially our community colleges, which do a lot. And we disagree with how we arrived at these numbers. And instead of cuts, I think we should have a global conversation on a formula for what they were, for what's needed. So how did we arrive to these numbers and to this particular formula?
Sure, I'm happy to address that. And I would like to say on behalf of the administration, we value our community colleges as much as the committee members do. I think our governor's been a champion of community colleges and other alternative paths for higher education. I think when it comes to the budget and the proposed BRFA measure regarding CADE formula, what I would say is that, again, our approach to balancing the budget this year involved taking a look at one factor we looked at was areas of spend that grew at what we consider now potentially unsustainable levels during pandemic years when significant revenue was flowing into the state. And since that revenue flow has dried up, our work became much more clear, I would say, in this recent budget process. And in taking a look at the CADE funding, we certainly appreciate the extent, the meaning and significance of the formula and the work the General Assembly's done over the years to fully fund that formula. But when we look at the numbers, the really incredible growth, and I would say that the governor in particular was particularly proud in his first budget in fiscal 24 to provide record funding for community colleges at $393 million, significantly beyond the historic levels closer to $250 million. Given the sea change on state revenues and the fact that the pandemic cushions that we were feeling in the state budget have significantly curtailed, this was one area that really jumped off the page with regard to questioning whether that particular level of spend going forward is truly sustainable in light of the challenges we face. I would say that the BRFA provision on this item in particular, which proposes to bring that funding level down from $393 million this year to $375 million going forward, still second record high funding for community colleges and $125 million or 50% higher than just 4 years ago, continues to reflect, while we admit this is a reduction in our community colleges, along with all of our other institutions in the state of Maryland, are going to feel some pain from those reductions. We do believe it's a fair and reasonable budget proposal for the community colleges that continues near record level funding going forward, even in spite of, what we still have and acknowledge significant structural issues ahead of us.
So with this cut, if it stands, community colleges are going to have to increase tuition, which is revenue. So they're doing the hard things on the backs of students who need the resources the most.
I can't speak to the decisions the colleges will have to make. I just would want to emphasize again, this is a 50% increase, $125 million more than what the historic funding levels have been.
Follow up. Just on the community colleges, do you think there's room for partnership with the administration? And when we look at the community college formula, it's old, quite frankly. It was put forth at a time when most of the students at community colleges were two-year associate students. Community colleges are doing so much more now, and workforce development and certifications that aren't really reflected in that formula. Do you think there's room for us to partner maybe in a long-term shift in how we do the formula to reflect those students and capture sort of the work they're doing beyond just the two-year associates?
I'm sure the administration would welcome that.
It's good to hear. We
I
have more
would,
questions.
if I can comment on that
Sure.
briefly, just another item related to the budget, which isn't in the BRFA, but in this year's capital budget proposals, there were some capital proposals for a couple of community colleges related to workforce training facilities, very different than the normal traditional classroom facilities. The administration debated with MHEC and others pretty significantly before, primarily because state government, MHEC and our capital budget team and others don't really have a framework or rubric for evaluating those types of projects on our community college campuses. The governor felt very strongly about supporting that work that's going on in our community colleges, which is absolutely vital to jumpstarting our economy, which is our one of our among top priorities. I know it's a shared one. And we did come down on the side of funding a workforce development facility at Howard Community College. I understand from MHEC that that's sort of a new model. And I think that's reflective of the type of partnership you're talking about.
Okay. Delegate Grice.
Thank you, Mr. Chairman. On this same exact topic, and it seems like you're reading our minds today. We're sort of have a flow here, going from one topic to the next. One of the challenges that we have, is trying to be consistent. And if anybody on this committee knows me, I'm all about tightening belts. And I mention that all the time. I'm like, let's take some cuts, let's be responsible. And then here's the inconsistent part of me. When we get to the BRFA and I see cuts to our community colleges, I'm like, no. We got to defend our community colleges, and I say that because we rely, at least in the rural areas, we rely so heavily, on our community colleges, with continuing education. We have a lot of students who, either they can't afford to go to a four-year school, or maybe they don't qualify for four-year school. So they go to community college for a year, or they go to community college for 2 years. And that's their front door. That's their door to get to a four-year college, in Maryland, because in most cases, all the credits they take in community college will transfer. In 2020, one of my most proud pieces of legislation that I passed was House Bill 603. What that did is it created a partnership between the 5 counties on the mid-shore, would create a regional technology school. And this was during the same time we passed the blueprint. And it made sense because on Pillar 3, this is how we're going to help, our students with college and career readiness. And part of that is technical training. And the challenge that we have in the smaller counties is that we don't have the student population to fill classrooms. We tried an HVAC program in Caroline County, but we just couldn't get enough students to fill up. But we also have a huge demand in that career path. So our answer to that is to partner with the other 4 counties in the mid-shore to be able to do this. And we're seeing progress. In fact, one of our capital requests now is a new building at Chesapeake College to do just that. And so, obviously, when we're changing the CADE formula, it is concerning to me. And we're talking about enrollment. Enrollment's actually up in our community colleges. And, certainly if enrollment's down, and I see that in Kent County, in our public school system, if our enrollment's down, we're not going to cut their funding. In most cases, their funding might go down a little bit because it's tied to per pupil, but the intent isn't to cut their funding just because enrollment went down. But with our community college, our enrollment's actually up. And here I am saying tighten our belts, but I guess my question is, moving forward, if we can restore that funding at least for this year in FY25, is this going to be a priority for your department to look at as a potential cut next year or the year after that? I'm hoping that what the chair was saying is if we can come back to the table and sort of, because it seems like it's a priority for most of us. I don't know that anybody's going to come to the table and say, hey, this was a great cut.
It's very difficult for me to say what the administration might be considering for next year's budget. We're trying to get through this year's. All I can say is that per the DLS projections, we're all very aware that the headwinds are only getting tougher, and difficult to say.
Delegate Watson.
Thank you, Mr. Chair.
I have two subject areas, two questions. Thank you for being here today and for giving us this presentation. The first question is on the highway user revenue. My understanding is that you have funded the first year of the law that we passed a year or two ago, which increased the percentage of the gas and motor vehicle revenues account to go to the local jurisdictions. And that this year, that number is 18% of that fund, and that you are funding 18%. But in the 26 and 27 fiscal years where we passed the law requiring it to be 20% in each of those years, you are reducing that back down to 15.6%. Is that correct, my understanding?
That is correct.
Okay, and can you just explain your thinking behind those reductions in that bill for the highway user revenues to our localities, and particularly Baltimore City, which takes care of all of its roads inside the city?
Sure. Again, if it's okay, and I know people have been waiting a long time, so we're trying to be concise, but if it's okay, we do have Jacqueline Hartman from MDOT here to help speak to transportation questions. Is it all right for Jacqueline to join us?
Good afternoon, Jacqueline Hartman, Assistant Secretary for the Maryland Department of Transportation. Excuse me. Thank you for your question. So yes, in the proposed BRFA, we would fund the highway user revenues at 18% in fiscal 25, and then goes back down to 15.6 moving forward. I think much like some of the challenges we're seeing on the general fund side as we're looking forward, the highway user revenues is being increased each year, the amount of grants that are going out to local jurisdictions in current law. So as you're all well aware, we had to make significant reductions to both the operating budget and the capital budget for MDOT. And so we're trying to balance, where we're giving increases to the local jurisdictions at the same time that we're making those cuts across the department. So I think it was a very tough challenge. We are trying to partner closely with our local jurisdictions to make sure their funding needs are met. But it is a balancing act of making sure we're trying to meet many demands on the transportation system.
Thank you for that. I would suggest that the needs of the local jurisdictions on the highway user revenue was very well documented when we passed this original bill. And if you were going to balance it, perhaps you would have gone somewhere between 20% and 15.6%. But taking it all the way back, I think, is going to be a problem for our local jurisdictions. So I'll just leave that there and I'll move on to my second question, if that's okay, Mr. Chair. And that has to do with the Maryland Resiliency Fund. We have had quite an increase in the severity of storms, particularly climate-induced intense rainstorms. The entire state has experienced flooding, whether Baltimore City, Prince George's County, Montgomery, Crisfield, Cambridge, Ellicott City. And what we've learned through the last 10 years of trying to combat this is that our infrastructure, our stormwater management infrastructure, is not calibrated for these new climate induced severe storms. And so therefore, a lot of jurisdictions have to go back and create new infrastructure or improve infrastructure so that we don't have flooding and property loss and economic damages go on and on and on. So there are federal grants available in some of these cases, but there are a lot of gaps, as we have learned over the years. And that is why the legislature formed the Resilient Maryland Loan Fund. It's a revolving loan fund. We funded it with $25 million. And the point was for jurisdictions to be able to borrow low interest, less than 1% loans, pay them back over a long period of time to help them leverage and provide matching funds to federal funds, but also to help them be able to finance some of these improvements that are needed. So the BRFA includes a $5.8 million reduction, and I'm wondering why that is a reduction in that $25 million total, because my understanding is we have enough applications in that would exhaust the entire $25 million in grant funds.
Okay, thank you for the question. I have a little bit of a different understanding, but I can certainly explain how we landed on this decision regarding, again, another difficult trade-off in balancing the budget. Funding was originally intended, as I understand it, to be $25 million in GO bonds in fiscal 22. However, the agency instead received $25 million in PAYGO funds in fiscal 2023. The agency applied for federal match in April 2023 and received $6.5 million in federal funds. My understanding is that the agency is pending guidance on how the federal funds may be distributed amongst local applicants and suggested that they are waiting to see if they'll receive additional federal funding. The agency, to my understanding, and to what informed our decision in the budget, the agency had spending plans for all but $5.75 million of the available fund balance. Therefore, this became a budget balancing measure within the governor's allowance.
Okay, so you do understand that this is an annual grant program with the federal government, the STORM Act, and also the BRIC Act. And so local jurisdictions will go every year, every April, to apply for these funds. And those funds are then leveraged by the amount in that $25 million fund. So even if your information is correct and they had 5.7 million, that money would easily have been used in this budget year, the second round of the STORM Act. So what I'm saying is, my understanding from talking to MDEM is there were 7 applications from jurisdictions around the state, some of which I mentioned, all of which are $5 million or more. So and I believe this may even be new information since you made this decision. So I'm just making the case that we put this out there. We need our local jurisdictions to be able to fund their own projects by helping them with matching grant money. And now we're taking that away when need is so great and growing. And so I would just put that out there as, I think, a problem in this BRFA.
Thank you.
Delegate Ruff.
Thank you, Mr. Chair. I wanted to move on to the provision of the BRFA that would enable the administration to implement an enrollment freeze of the child care scholarship program. And I have a feeling that I usurped my colleague here, so I'm actually going to pass the mic.
Hold your time, Mr. Chair. Well, thank you. I appreciate it. Thank you for yielding your time. I too am troubled, as well as my fine colleague mentioned about the child care scholarship, the burden being placed on our families when it comes to possible waitlisting and possible co-pays. And so I'm thinking 2 questions, one quick one, if you can help me remember. When families become eligible, they are automatically eligible for 1 year, correct?
Yes.
Okay. And then thinking about the blueprint and projecting, we have the 3 and 4 year olds who are going to possibly move into eligibility into the blueprint, pillar 1. And so I'm thinking about, has there been any conversation about those populations that may be moving out of the scholarship and into the blueprint side?
It's a really great question, and it is a topic that we've begun discussions with MSDE, with Governor's Office of Children, to begin to plan for that. I would say that at this point, I'm not knowledgeable that we have hard information or hard plan for how we're going to manage that transition. We are all acknowledging that that's a really important component of this picture for early child education. And it's an area that we need to spend a good bit more time on over the months ahead.
Thank you. I appreciate it. And I appreciate if you keep us posted on what the plans may be. And I surely will be following up, because we do want to protect our vulnerable families and give them some ease on that possible copay. Thank you, Mr. Chair.
Thank you, Delegate. Delegate Spiegel.
Thank you, Mr. Chairman. Madam Secretary, and to your team, thank you for your work on this. My colleagues beat me to the punch on questions about CADE and highway user revenue, which is not surprising. But I do have one small follow-up to Delegate Watson's questions about highway user revenue, which also should not be surprising to anybody who knows me. I was a longtime municipal official, an MML president, I spent many, many years laser focused on advocating to restore highway user revenue funding to local governments after they were devastated in around 2009 in the wake of the Great Recession. And it was a long fought and big win for local governments to get those HURs fully restored through state legislative action. But it took a good decade of advocacy to make that happen, and incremental legislation along the way. And so, certainly I want to say thank you for the supplemental for fiscal year 2025, which holds HUR harmless for 1 year. But with our representative from MDOT here at the table, I just kind of wanted to ask, isn't it true really when we talk about when you say all we're doing is rolling back increases in the formula that were set to take effect in 26 and 27, that doesn't exactly account for all the losses that local governments had to incur between 2009 and 2018 or so along the way when they weren't getting the funding under the formula they were supposed to be getting in those back years. So I kind of just want to put the idea of it being an increase in the context of the broader losses that they had to deal with over those years. Thank you.
Chair, thank you, Madam Secretary, and to your team, recognizing that, you had a lot of difficult decisions to make. One of the ways that you are intending to balance the budget by use of the BRFA to follow on Chair Watson's questions, focus on cuts to things like HUR and cuts to a lot of programs in the Consolidated Transportation Program, the CTP. It's a signature policy initiative of this administration to reverse the decision of the prior administration to cancel the red line. It's my understanding from all of the experts that I speak to that, when the federal government looks at our application for federal funding to support the red line, they're going to look at how we do things like keep our current system in a state of good repair and maintain the existing system that we have. I'd like to get a little context on how the decisions were made to make those cuts, which it's my understanding will harm our application for federal funding for the red line. And it does not appear that we're going to be in a position to fully fund the red line without federal resources.
Yes, thank you for your question. So we have restored the red line. We are working towards moving that project forward. It is a very important project across the state. There are also many steps to go in that process to the point where we need full funding for that project. It's still several years away from construction. However, we have been doing a lot of investments in transit through this budget. So on the operating side, there's a lot of additional money flowing into the Maryland Transit Administration to help fund their operations. On the capital side, we've also through the restoration or the transfer of $150 million of general funds to the trust fund, we were able to restore another $15 million of state of good repair funding for transit. So we are very focused on that area. I think with many of these tough decisions, we're making sure that we have that right balance, but that is certainly an area that we have been committed to and are putting a lot of funds into, making sure that we are starting to enhance that level of funding to our transit system.
Got it. Thank you.
Okay, good questions, committee. Madam Secretary, thank you for your work. We know how hard your work is. We know it because it's our work too. And I think what you're hearing from the committee today is how impactful some of these cuts will be to HUR, we jotted them down, childcare, self-directed care, community colleges. I think it's important for the audience and the 30 or so folks we're going to hear from today about how these cuts impact them, that we be honest with them. And I think you have been, but I think it's important to put a finer point on them. These cuts are $250 million. They are the tip of the iceberg. They are a drop in the bucket compared to what we are facing in the years to come. Think about these cuts in the context of 10 to 20 times these cuts. If we don't get serious about addressing our long-term problems, this committee does not want to see a place where we have to take these cuts or 20 times these cuts. And I think they are avoidable. I think they are avoidable, but we're gonna have to have a serious conversation about revenue and about raising revenue, which is, I was really heartened to hear the governor pledge his partnership in hopefully sooner than later dealing with our revenue issues so that we don't have to face communities like we're gonna hear from today in another year facing these cuts. So I'll leave you with that. And again, thank you so much for what you do.
Great, thank you.
Thank you.
We're going to hear from Department of Legislative Services now, who also have great information to share with us. Tanya Zimmerman, Carrie Cook, come on up.
Thank you, Mr. Chair. We have DLS has produced a couple documents for the hearing today, the fiscal note, which is produced and available. We also have a separate document with some summary of the provisions and recommendations. We're not going to go through all of the provisions in the BRFA as the administration has already covered them. But we want to highlight some of the areas where DLS has some additional or alternative recommendations. Some of them may be related or similar to things that you heard that the administration has also offered as amendments to the BRFA. But on page 1 of our document, this is kind of a summary of the items in the BRFA as introduced. With the revenue and the transfers and the actions, I would just want to point out a few places where DLS has made recommendations on language or dollars. Most of these are to kind of just reduce the funds directly rather than making them just contingent on the BRFA. The largest of those is the reserve fund, but also includes the sweeper, the OPEB sweeper and the retirement sweeper, as well as the school construction revolving loan fund and the business facade improve program. Those are all consistent with the BRFA as introduced, just reducing the funds directly. There are 2 places related to an MDH transfer in the BRFA related to the health information exchange where DLS is making technical corrections. One is just to modify the language so it's consistent with what the BRFA actually does. And the second is there was funding that was made contingent, federal funding that was made contingent, which was an error as it's a special fund transfer. But after that said, I'm going to turn this over to Carrie Cook, who's going to go through the DLS recommendations on the BRFA.
Thank you, Tanya. Thank you, Mr. Chair. Beginning on page 3 in your document, we have information on the DLS alternatives to provisions that are included in the BRFA as introduced. So we have 3 items here. 2 of them are related to mandate relief. So as was just mentioned, the state of good repair funding for the Maryland Transit Administration as introduced, it reduces the amount of funding that the governor must provide for this purpose. DLS recommends striking this provision as the supplemental budget removed a language that would have reduced funding contingent on this provision and restored the funding. Also for MDOT highway user revenues, the BRFA as introduced advances the reduction in the highway user revenue formula that's going to those jurisdictions. And DLS recommends further reducing the local rate distribution to 9.6% beginning in fiscal 2025. The last DLS alternative item is related to the Strategic Energy Investment Fund. The provision as introduced authorizes a transfer of $90 million from balances from the SEIF to the dedicated purpose account. And DLS recommends restricting transfers out of the energy assistance account and directing that more of the transfer be from the administrative account within SEIF. So what we're really recommending here is sort of changing the sub-accounts where these transfers are coming from. And there is more details on the sub-accounts as introduced by the administration and as proposed by DLS on page 12 and 13. Moving on to page 5, which is the new recommendations by the Department of Legislative Services. First item deals with retirement system funding. So DLS recommends reducing the amount of additional retirement contribution above the actuarially required amount from 75 million to 50 million, and that's each year beginning in fiscal 2025. This recommendation also includes altering the calculation beginning in fiscal 2026. We have 4 items related to transfers to the general fund. The first three items all deal with the dedicated purpose account. So the first item is authorizing a transfer of 25 million from the dedicated purpose account to the general fund. And this represents funding provided in fiscal 2023 for critical maintenance in the Department of Natural Resources. The second dedicated purpose account item is a transfer of 7.6 million from the DPA in fiscal 2025 to the general fund. And this is for various purposes in the Department of Health, for specific funds that were provided in fiscal 2023 that were not used. The third dedicated purpose account item is for MSDE. This will authorize a transfer of 4.5 million from the DPA to the general fund, and that is for funds that were provided in fiscal 2023 for the Learning and Extended Academics program, and those funds were also unused. The last general fund item has to do with Baltimore City Community College. In terms of their construction for the Bard Building project. So this is withdrawing 2 million that was appropriated in fiscal 2022 for this demolition project that is unneeded based on the current contract award that was approved. We also have a few items that are using funds for other purposes. The Senior Prescription Drug Assistance Program balance authorizes 5 million to instead of being used for that balance, to instead be used for the Behavioral Health Administration in the Maryland Department of Health, which is a requirement to take those funds from that fund balance. The second item is regarding program open space. So this is allowing POS, which is special funds totaling 6.7 million, to instead be used for personnel costs within DNR in the Park Service and the Forest Service. That's for fiscal 2025 only. And then moving on to page 6, the last two sort of miscellaneous items. First one has to do with the calculation of higher education formulas. So this is a clarifying item that the full-time equivalent student count be used in the calculation for the Cade, Sellinger, and Baltimore City Community College formulas. And that should be using self-reported numbers for institutions that calculate it based on a credit hour basis. The final item is regarding local income tax reserve. So this specifies that 10 million of the annual distribution to the local income tax reserve account from fiscal 2026 through 2060 will be used, to repay 350 million transferred from the account to the Education Trust Fund in fiscal 2010 and ends that distribution after fiscal 2060. The following pages in your packet provide additional information and details on each of the proposals that the department has made. And that concludes our formal presentation. We're happy to take any questions.
Thank you for the great analysis, both of you, as always. Any questions for our analysts? Okay, thanks. Thank you for being here. We'll move with our witnesses. I'm going to call 3 or 4 witnesses at a time. Come to the table as you're able, and as soon as you get there, you can begin your testimony. Bradford Sims, Timothy Trainer, Michael Patty, and Weymouth Spence.
Great. Thank you, Mr. Chairman. Michael Patty here today on behalf of the Maryland Occupational Therapy Association, the Licensed Clinical Professional Counselors of Maryland, with 2 concerns about the fund transfer from both of their corresponding boards. It's on page 35, lines 24 through 27 in the bill. $1.6 million and $776,000 transferring from both of those boards' funds to the Behavioral Health Administration. We just have a lot of concerns with that high number. We think that that leaves the board a bit deficient in their existing funds. You know, these funds come from licensing fees that these health occupation professionals pay yearly, every other year. There's a healthcare shortage. We think that, you know, this money should be reinvested in the profession, getting people invested in that profession that serves those communities from the Eastern Shore and Western Maryland in Baltimore City. So we would just ask that when the committee is considering changing numbers, moving numbers around, that those 2 numbers really get a hard look. I'm sure there's colleagues of yours in other committees that can tell you all about the healthcare shortages across the state right now. So with that, I'm happy to take any questions. You'll hear from a few more occupational therapists after me. Thank you. Great, thank you.
Sonia Lawson, Jenna Yeager, Amy Miller, and Stephanie Stevenson.
Mr. Chairman, I'm Tim Trainer. May I go ahead and proceed?
Yes, sir.
Well, good afternoon, Chairman Barnes and committee members. I'm Tim Trainer, president of Mount St. Mary's University in Emmitsburg. I've been the president since 2016, and I can personally testify to the impact the Sullinger program has had on our campus. Prior to arriving at the Mount, I served 33 years in the Army and saw how young people's lives were positively transformed by the opportunities afforded them in the military. Today, young people from Maryland are afforded opportunities at the Mount due in part to the Sullinger program. We are the largest private employer in northern Frederick County, providing 781 jobs, and we invest in the area. We partnered with Frederick Health to bring an urgent care center to our campus that is open to the public, and we are opening a new school of health professions later this year in Emmitsburg. Since 2016, our student body has grown 14% and diversified considerably. Our undergraduate population is 45% students of color and 32% students are Pell eligible. Expanded access to a Mount education would not have been possible without the Sullinger program. Maryland offers its residents the opportunity to pursue higher education at an institution that is the right fit for them. MICUA members have the highest graduation rates compared to competitors across all demographics, and we graduate our students quickly, which means they start earning faster and stop accumulating debt. We would not be able to accomplish this for your constituents without the Sullinger program. We understand the pressures you're under and are trying to find a shared middle ground. We urge you to restore the Sullinger formula that has been in place for several decades and add a cap so that no single institution can receive more than 35% of the total funding. This will result in about a 20% reduction in Sullinger funding for MICUA institutions versus the 50% reduction currently in the BRFA. Thank you very much.
Thank you.
Good afternoon. My name is Sonia Lawson, a licensed occupational therapist from District 13, representing the Maryland Occupational Therapy Association. We urgently request an amendment to House Bill 352. We understand that this legislation is necessary to balance the state's budget, but ask the committee's consideration in reversing the proposed fund transfer of over $700,000, almost $800,000, from the Board of Occupational Therapy Practice to the general fund. I know that $700,000 is not the millions that you guys have been talking about already, but it's a lot to occupational therapists who pay licensure fees that in the scheme of things with other states is expensive. And so we would like to see those licensure fees go towards benefiting our therapists, which in turn benefit the constituents. As a person that has paid licensure fees to the board for almost 40 years, I'm very concerned about the disproportionate amount being taken from the board's fund as compared to amounts proposed for other health boards. The board will be left with only 68% of its annual budget. Our board has taken steps to efficiently manage the monies that providers pay in licensure fees, and now it seems the board is being penalized for doing so. When the board is able to hire up to 4 staff to manage activities, our board has been able to do this with only 3. Because of the depletion of the board's funds, license fees will likely increase to recoup those lost monies. This adverse action will hit providers that are already stretched and in short supply. Currently, the board has not been able to use their office space due to the presence of black mold at the Spring Grove location. No other state office space is available, and funds will be needed to acquire commercial space. It is unacceptable to take monies from an efficient board already operating on limited office space resources.
You can
I'll stop. Can I continue? I just have one more statement. Additionally, the board is preparing to join the Occupational Therapy Licensure Compact, which we put forth at least a couple or 3 years ago, and we're excited about it. However, this will require an IT upgrade, which is costly. Depletion of funds would essentially be taking away opportunities that support interstate practice that could reduce workforce shortages. Your consideration in reversing the proposed fund transfer is crucial and very much appreciated. Thank you.
Thank you.
All right, good afternoon, Mr. Chairman, Vice Chair Ching. Nice to see you again. My name is Amy Miller and I am a constituent of District 14 and I am here with the Maryland Occupational Therapy Association to support House Bill 352 with an amendment that excludes the Board of OT from having our funds moved. I am about to graduate with my doctorate in occupational therapy, so I'm currently budgeting to be able to pay my licensing fees to the Board of OT so that I can enter the workforce here in Maryland, which has a current shortage of occupational therapists. When paying these fees, it is my understanding that they will go towards forwarding the profession of occupational therapy in the state of Maryland. So if you remember nothing else from my testimony, please remember these 4 things. Number 1, cutting occupational therapy will make healthcare costs go up in Maryland. Full stop. OT is the only healthcare profession shown to actually reduce healthcare costs overall. So from a long-term financial standpoint, it is in the best interest of the people of Maryland to put more funding into OT and not less. Number 2, taking money that is only there due to our board being efficient and saving and planning ahead for these upcoming costs only incentivizes waste, fraud, and abuse. So we are especially grateful that this committee is taking the time to review and adjust this bill to keep that from happening. Number 3, these funds come directly out of the pockets of occupational therapists in the form of our licensing fees. And taking this money now will penalize individual therapists for our board's efficiency by causing licensing and renewal fees to go up. And number 4, at the end of the day, the proposed funds transferred from OT constitute a relatively small amount of the government's overall budget, but since we are such a small profession, they constitute a significant portion of occupational therapy's budget. It's also worth noting that Occupational Therapy's board, all right, well, we are being disproportionately affected by this bill. Psychologists will have 117% of their projected operating budget left over after this bill takes the money out. Counselors and therapists will have 127% left over, but occupational therapy will only have 68% of our projected budget. So thank you for your time.
Good afternoon. My name is Stephanie Stevenson, and I'm a constituent of District 35A. I'm speaking today on behalf of the Maryland Occupational Therapy Association as well. I've been a licensed occupational therapist in the state of Maryland for 31 years. I'm deeply concerned about the proposal within the House Bill 352 to reallocate a large chunk of our budget from the Maryland Board of OT practice to other agencies. Over the course of a 40-year career, each individual OT could pay well over $7,000 in state licensing fees to the Board of OT practice. Again, a small number, but a big one to us. The board is funded through our licensing fees and has worked very efficiently in using those fees to serve the OTs of Maryland, who in turn serve the citizens of our state. Everyone in this room likely has family members or friends who have returned to independence after illness, injury, or disability with the help of occupational therapy. OT services have been proven to reduce overall healthcare costs, but despite this, there is a shortage of OTs within our state. So we are in support, but with the amendment to reconsider taking funds from our board. Thank you for your time.
Good afternoon. I'm Dr. Jenna Yeager, and I live in District 42A. I'm also here today representing the Maryland Occupational Therapy Association to express our support for House Bill 352 with an amendment to eliminate the requirement that our Maryland Board of OT practice disproportionately lose over $700,000 of our funding to another agency. It's our view that this is unfair and inappropriate to allocate our funding in this way. The function of the Board of Practice includes assuring safe and equitable provision of occupational therapy healthcare services to the citizens of Maryland. You are likely aware that there is currently a shortage of qualified OTs, exacerbated since the pandemic and threatening the ability to provide critical healthcare services to meet the needs of your constituents. As an OT professor, I can also tell you that our graduating students, like Amy, are managing the cost of their education as they prepare to enter the workforce. Increasing their licensure fees at this point in their careers is placing an undue and unfair burden on them. So again, we are here to present our statement that it is not reasonable, nor is there an acceptable rationale for this disproportionate loss of funding. Thank you for listening to our remarks.
Thank you.
Thank you so much, everyone. I'm Geneva Stone. My son Rob and I testified in favor of the Self-Directed Services Act of 2022. I'm asking you please to strike section 7101 and 7409 from the BRFA, sections that would fundamentally alter this existing Maryland law that supports the community integration needs of people with disabilities. That is, their civil rights under the Olmstead decision and the ADA. I'm concerned that the governor has been misled into requesting a change that would work against his vision for an inclusive Maryland. Children and adults with disabilities and complex medical needs, like Rob, are a group that the state consistently leaves behind. Our families are clustered in self-direction, in part because MDH and the DDA leave us little choice. Because our children have medical needs, they cannot enroll in any of the traditional provider services along with their friends with whom they expect they attended public school. It's in the waiver. That is a form of segregation and discrimination, I believe. Yeah, so lifting the IFDGS cap was supposed to level the playing field for Rob, allowing him full access to his own DDA budget so that he too could afford enrichment activities and classes that let him socialize with his disabled peers, just as he did in school, and so that he too could have his administrative needs met, just like his peers in traditional services. The day-to-day administrator position is a key piece of long-term sustainability for our children after I am gone. So please don't let the DDA erect more barriers to community for Robert. And Robert has something, let me stop. Patient advice. Yes. Well, I'm sorry. Sound up.
My name is Rob Stone. My name is Rob Stone. I use self-directed services. Dear Governor Moore, I admire you, but I think you're making a mistake. You don't understand that I need more IFDGS funds for my community activities. This arts, UCR classes, spirit club, and my music lessons. That's how I hang out with my friends with disabilities. If I can't see my friends, I will be sad. Please let me keep my IFDGS funding. Thank you.
Thank you very much.
My name is Rob.
Okay, sorry. We would like to tell you again. We have to go. Thank you so much. Okay, Rob. Yes, your name is Rob Stone. My God, we all got that. Thank you, everybody.
Okay. We're gonna now go to Lisa Klingmeyer, William Miles, Jim Spiropoulos, Matt Power.
Thank you, Mr. Chair and members of the committee. My name is Lisa Klingemeyer. I'm the Executive Director of Maryland Rise, which is an organization that works to create an economy that works for everyone. We're here today in strong support of the Child Care Scholarship Program, and in that support are asking for an amendment to strike the provisions of the BRFA that would allow the administration to unilaterally institute a wait list for the Child Care Scholarship Program. We thank the General Assembly for the amazing work that you have done over the past couple of years around the child care scholarship program. We've expanded access, and it has really made meaningful differences in the lives of families. We know that there are budget challenges ahead, but as so many of you mentioned, and we thank you for that, we are deeply concerned that the child care scholarship program is being looked at as a place to find cost savings and mandate relief. The child care scholarship program allows working families to stay in the workforce, generating our economy, and it provides places for children to learn and to grow. The last time waitlists were in place, it took 7 years for them to be reopened to all Maryland families who were eligible. Allowing there to be waitlists goes against our shared vision of creating a Maryland without childhood poverty and growing our economy together. We also echo many of your comments that it's alarming to be having conversations about childcare scholarship, community colleges, self-directed services, all these important programs, and not talking about bringing new revenue into the state. So we're not having to make these impossible choices between these programs. And we strongly urge the administration and the General Assembly to talk together about revenue so that we're not having to make impossible decisions about our safety net programs. We thank this committee. You all have done amazing work over the many years that I have come before you around safety net programs. And in that shared vision of creating a Maryland where all Marylanders are supported, we ask you to strike the provision in the BRFA around the child care scholarship. Thank you.
Hello, Chairman Barnes and committee members. Thank you for having me. My name is Jimmy Spiropoulos. My family owns Town Center Market in Riverdale Park in Prince George's County. I've been a Maryland lottery agent for 36 years. I can say the relationship my store has had with the Maryland Lottery is one of the best business partnerships I have ever experienced. The product, support, and services provided by the Maryland Lottery is unmatched. My store is an ex-cap location, meaning we can cash tickets up to $5,000. With that, I am required to attend quarterly meetings. At every one of these meetings, John Martin would share the ever-growing revenue numbers that the Maryland Lottery generates for the state. He always makes sure to let retailers know that we are the reason revenues continue to grow, and he thanks us for our efforts. The retailer focus on lottery is very clear, as lottery terminals are placed in the most visible areas of our stores. As rents, mortgage rates, and labor costs increase, retailers must generate maximum return on these most visible areas in our stores. Being a lottery agent is not without challenges. I must have cash on hand for large payouts, which creates security issues. I must devote multiple employees to operate the machines. I have experienced several overnight break-ins and even a Sunday afternoon when thieves bypassed expensive bottles of liquor to target instant tickets. If I were to cut my best employee's hourly wage by $6 an hour, I am fairly certain she would no longer be my best employee. I would have disincentivized that employee to be the best that she can be. I understand the dilemma at hand, but cutting lottery commissions will initially save the state monies, but I believe it will cost the state lost revenues in the long run. Please do not disincentivize us and harm one of the best business relationships that I have ever been a part of.
Thank you, Chair Barnes, members of the committee. For the record, Matt Power, President of MCUA. The General Assembly saw the importance of linking funding for nonprofit and public institutions of higher education over 50 years ago. The thinking was to create the workforce that Maryland needs and the opportunities for Maryland residents that they desire. The state needs healthy public and nonprofit institutions. It worked so well that 20 years later, they established the CADE formula to establish a true ecosystem of higher education with linked funding to create access, opportunity, and affordability for all Marylanders. This committee has consistently championed Maryland's 55% degree production goal. Collectively, we failed to meet it. We're about to set a bolder goal, and yet we're literally cutting funding for Selinger and CADE. It makes no sense. We'll never meet the goal. MCUA supports a blueprint for Maryland education. We produce 50% of Maryland's education degrees at or above the baccalaureate level. Selinger is the reason that we can do this because it lets us provide additional funding for financial aid for teachers. Who is going to implement the blueprint if we can't provide you teacher candidates? We recognize the fiscal realities you're facing, and we're happy to help. The Selinger program is 0.2% of the budget, yet we are by far the single largest cut to any program in the BRFA. Does the state of Maryland want to see our closures in nonprofit institutions? We ask you to accept our proposal in our testimony. If every other entity that testifies at this table today was willing to accept 20% reduction to our program, which is what our proposal does, none of you would have to spend the sleepless nights that you are balancing extremely worthwhile but competing priorities. We are willing to do our fair share, but please make it fair and make it equitable among our institutions. We're asking you to please work with us. Mr. Chairman, I had 2 presidents that were unable to get in the door that were called in the first round. Is it possible for them to testify? Thank you. Appreciate that. Thank you.
Mr. Chairman, members of the committee, Bill Miles on behalf of the Association of Forest Industries and a former committee staffer of this committee for 5 years back in the mid-80s. So I, for one, absolutely know exactly what it is you go through in the budget committees for what that's worth. But I know how hard you all work. We definitely had some structural deficits in the 80s and 90s when I was staffing the committees and worked for legislative services. I'm here today on behalf of the trees. I mean, I pains me to hear all these stories about childcare and hospitals and whatnot. But you know, Maryland's got about 2.5 million acres of trees and a 6 million acre landscape. And there's only one fund in Maryland that actually finances, sustainable forestry management. It's called the Melnoan Woodland Incentives Fund. In 2009, the General Assembly enacted it's become an historic act. National accolades all over America, and it was called the Sustainable Forestry Act. But what that act did was it declared the statutory nexus between a healthy Chesapeake Bay and a sustainable forestry management system. In essence, trees filter all the harmful nutrients, cleaner water. Well, this Woodland Incentives Fund was finally funded since 2009. Years and years and years we waited. We thought something would happen. And finally, in 2022, courtesy of Delegate Dana Stein and Delegate Eric Lukey at the time, was able to convince the General Assembly to add $1 million into the Great Maryland Beautiful Act. And this past July was the first year of it. And the Forest Service, the DNR, desperately and absolutely needs to have that money to fulfill the statutory mission of the Woodland Incentives Fund, which I will not go over because it's part of our testimony, and we would ask you to reject the BFA recommendation of a $500,000 hit to that fund.
Okay, thank you for your testimony. Thank you all on this panel for your advocacy. Appreciate you all being with us. Great day. Matt, you want to grab your 2 presidents and they can each have a minute. Welcome.
Thank you, Chairman Barnes. I'll be quick. I'm Bradford Sims. I'm president of Capital Technology University. We're located in Laurel, Maryland, kind of between NSA and NASA. We are a majority university, and I'm here to hope that you accept the Sellinger proposal that MICUA is offering, because as a university, we'll be taking a 52% Sellinger cut. And for us, any money we use for financial aid out of Sellinger goes 100% to the undergraduates. Our focus at Capital Technology is creating a direct pipeline between our institution and the workforce and providing students with great careers so they can take care of themselves and their families. We're so confident in our ability to meet the state of Maryland's workforce needs that our undergraduate students get 2 guarantees. One, that they will walk out the door with a minimum starting salary of $52,000 a year, or we'll cover their and their parents' quarterly student loan payments until they exceed it. And 2, if they don't have a job in 90 days in their career area, we'll allow them to come back and get a certificate in another area for free. We can do this because we have such a high placement rate with the industry in Maryland. 36% of our students are Pell eligible, and 80% come from Maryland, and they stay in Maryland. For us as a university, we rank high in return on investment for our students. A report that came out from Georgetown University's a first try for ROI of 4,500 colleges and universities across the US ranked us number 213 for a 20-year net present value return on their investment. We were also ranked in Forbes top 500 last year for ROI on our students. Our graduates earn money. That's true of other MICUA small institutions. According to the College Scoreboard, MICUA schools graduates far outperform the United States 4-year publics and privates in median earnings after graduations.
Thank you. Thank you. Thanks for the great work you're doing.
I appreciate it. Appreciate it. Yeah. Yes, sir.
Yes, sir.
I'll turn it over.
Chairman Barnes and member of the committee, I'm Weymouth Spence, president of Washington Adventist University located in Tacoma Park, Maryland, the only residential four-year institution in Montgomery County. I'm the current chair of the McHugh Board of Trustees, guiding both the association and my institution through some of the most challenging times in higher education. I strongly urge you to reject the current language in the BRFA. Reduction of this size will devastate many of my fellow McHugh members. Let me share with you a little bit about Washington Adventist University. Since 1904, 120 years ago, we have been providing higher education to our local, national, and international communities. Our core values are rooted in compassion, service, and academic excellence. We have more than 50 different collaborations and affiliations with other institutions within Maryland and throughout the country. We have also been strongly embedded in a local Tacoma Park community since 1904. Often, we are the single institution of choice for our students. As the DLS Higher Education Overview pointed out, Washington Adventist University is a top-ranked institution in the state of Maryland for economic mobility. The Economic Mobility Index accounts for the price to earnings premium, which measures the average time it takes for students from families earning $30,000 or less to recoup their costs of obtaining a credit in combination with the proportion of students for low and moderate income households. 6 of the top schools in the highest 3 tiers of the Economic Mobility Index are McHugh institutions. We know how to help low-income students succeed, attain degrees, and help the economic ladder. We know how to partner with students for them to graduate on time with little or no debt, ready for the 21st workplace.
Thank you. Thank you, sir.
Thank you very much for your time.
Thank you both for the great work you do and representing McHugh here today. And sorry we missed you earlier, but glad we could get you in.
I appreciate it. Thank you.
Have a great day. Thank you. All right, we'll go back to Michael Sanderson, Jack Milani, Mike O'Halloran, and Kirk McCauley.
Go ahead and get started, Mr. Chairman. For the record, my name is Mike O'Halloran here today representing the Mid-Atlantic Petroleum Distributors Association. Our members own and operate convenience stores. Therefore, they act as retail lottery agents. So we're here to talk today about the proposed cuts in the BRFA to our retail lottery agents and the commissions that they make. You have my written testimony. I know you have a long afternoon ahead of you, so I won't belabor this point. But I will leave you with the fact that this does mean a $35 million cut to these businesses. So that averages to about $8,500 per location. Some actually, it'll be a larger cut to them. And as you heard from a previous panel, from a operator himself, you know, the cost of doing business is rising in Maryland, not just in rent, but in labor costs. Whether it's the minimum wage, which is not just the starting wage, but also, you know, those making $17, $18, $19 an hour. You know, in the next couple of years, there'll be more labor costs in the name of the family and medical leave insurance. So all these costs add up. So while, you know, certainly appreciate the job you all have in front of you, this $35 million, it's going to have a real impact on these small businesses. Particularly as they're facing, as I mentioned, these rising costs. So with that, I'll conclude. I know you hear from some actual operators this afternoon, but we do respectfully request that you do not go forward with these proposed cuts. Thank you.
Mr. Chairman, members of the committee, Jack Milani. I am the legislative co-chair for Maryland State Licensed Beverage Association. I think the secretary said it best. They looked at us because the commissions rose over 4 or 5 years. You know, it wasn't raised during that time was the rate of commission. So that commission rose because the partnership between the agents and the lotteries set records, I think 4 or 5 straight years in sales. And the reason we did that is because they allow us to make money. I can put someone in a chair, and in my case, 70 hours a week, I have someone on the lottery machine. That's all they do. I believe lottery is an impulse. If someone's in the chair, you might buy a scratch off. If they're not in the chair, you might just leave the store. But for me to do that, it cost me without overtime and without benefits about $1,300 to do that. So that's $65,000, $68,000 a year coming out of my pocket. And I do make money on the lottery, so I'm willing to do that. But if you're going to start talking about cutting, and especially for the reason it was because the commissions went up. Imagine being a producer in any sales job, and everyone's having record years, and then they say, you know what, we can whack the person who's doing the work, and we'll still probably get some of that money back, and that's our concern. I don't know why you want to disincentivize our folks, because listen, when I hear the plates, Mr. Chairman and members, I wouldn't want to be in your seats right now, because those are very compelling arguments you're listening to today, but we produce revenue. So why would we want to take a chance of hurting us where we're not going to be able to produce revenue? And Mr. Chairman, in the interest, we had discouraged our members from signing up because we knew this was a massive day. But is there any way they can stand or raise their hands? Because they did show up, but they did not sign up. Thank you, Mr. Chair.
My name is Kirk McCauley. I employed by WMD Car. We represent convenience stores, service stations, auto repair shops, state of Maryland. There's 4,400 lottery agents in the state of Maryland. For a majority of them are small businesses. The lottery means a lot to them. The 6% commission on lottery barely pays most of them the employee to run the lottery machine. They take a lot of high risks. They handle a lot of cash. You can't play the lottery with a credit card, so it's cash flowing into the place. Very risky in today's atmosphere in a lot of places. It takes a high cost mentally and physically. The lottery agent now averages about $50,000 a year. If you took 4,400 lottery agents and put it into the amount that was paid to them, it's about $50,000 a year. That can't pay for an agent on a machine. It'll pay for some. You'll get some people coming in, they'll buy other things. But as far as the money that the lottery agents paid, that's a push shove. You're not making a whole lot of money on it. It's stuff to do. The lottery agent receive net profit of $714,256 last year. That was because our agents did one hell of a good job. Truthfully, they did a good job, and it's because the lottery agency, Director John Martin, he did his job. He give us the tools to do the work with, but we got to have the people to do the work. And if you have the people, you got to pay them.
Mr. McCauley, if you could summarize.
So please take on page 26, lines 1 through 8 out of the lottery and find the money elsewhere.
Great. Thank you very much.
Mr. Chairman, committee members, I'm Michael Sanderson with the Maryland Association of Counties. We put in written testimony. I've got some ground to cover. I'll be economical. 4 points, 2 building on your questions and 2 building on stuff that's already coming from your subcommittee. Number 1, CADE formula, really good policy, still good policy, even though it's on tap to be cut. Tough decisions, we get it, but the reason we built that formula, even though it took years and years to get there, were good, strong reasons. Community colleges need your support. It's about tuition. Second, highway user revenues. What's before you are cuts for 26 and 27. This table was full of advocates from local governments talk about local transportation. The mayor of Baltimore County, executive from Baltimore County, experts from across the state. The point is you don't need to make these cuts right now. It's not spending affordability. It's not the general fund. Doesn't affect a nickel of either of those. Don't fold your hand. You can just check. Next year, let's come back. We'll have the train commission reports. We'll see the big picture plan for all of transit, all of roads, all of highways. Let's do it all next year. Fine. Two more things. Coming from your health subcommittee, local health departments are facing a tricky situation. The department agrees it's time to study core funding and other money that goes to local health departments. But unless you put something in the BRFA, counties are going to get surprised with a double or triple match coming out of nowhere this year. You can fix that with language in the BRFA. There's already a study coming this fall. Study it then, figure it out for next year. And finally, with disparity grants, it wasn't a decision by the administration, but we're in a down year for disparity grants when the poorest jurisdictions need the help. Places like Caroline, Wycomico County, Prince George's County, all of them down because the formula is fluky. Another thing you're already studying, and the Department of Legislative Services recommended, DBM agreed, include in that study some attention to smoothing that formula out so you don't have a roller coaster like this. A 3-year average, something along those lines, great idea. Fix it now or at least fix it later. Thank you, Mr. Chair.
Thank you very much. Are there any questions from members of the committee for this witnesses? Delegate Watson.
Yes. The last witness there, you mentioned that we didn't have to make those cuts to highway user funds for 26 and 27 now. And you also mentioned that we will have train next year. And my question for you, is there any reason we have to wait for train?
I think you would have strong support from local government leaders if for part of a larger package saying, here's the solution on transportation to bring it all together. If it's tomorrow morning, we'll be there. But if it's next January, we'll also be there. But my main point is a lot of things that are before you in the BRFA are about resolving the general fund today. This particular piece of the BRFA is not.
But you would agree the sooner the better.
Agreed.
Thank you.
Thank you. Are there any other questions for any witnesses? Great. Thank you very much.
Thank you.
Next, we'll call the next set of witnesses, Matt Rice, Michael Gautam, Sharad Doshi, Carol Kuster, how about Patricia Saylor? Please, please go ahead, start, sir.
Okay. Good afternoon, Mr. Chairman, members of the committee. My name is Matt Rice. I am the Executive Director of People on the Go of Maryland, Maryland's statewide self-advocacy organization ran for and by those with intellectual and/or developmental disabilities. We are here in respectful opposition to the Budget Reconciliation and Financing Act, which proposes cuts to the IFDGS line item or individual family and directed goods and services. I think as Rob Stone and his mom already eloquently stated in their testimony, a lot of people rely on this very heavily. We're talking about 3,000 people that self-direct their services. So while it is a significant number of people, it is still a drop in the bucket in terms of overall funding. What we would suggest with our partners at the Self-Directed Advocacy Network is let's strike the relevant lines from the BRFA and let's have a work group to study the issues of utilization and self-directed services. I think this is important because we've already seen a tendency on the part of the department to make unilateral decisions without public input. We've seen people, we've seen people in self-directed services have difficulty in accessing rate increases and other things that they need. So please give us time to look at this and come back to you in a responsible way where we can be partners. Thank you.
My name is Carol Custer. I'm the Secretary of the Self-Directed Advocacy Network. And I know that the representative from the department noted that we did talk to them. We talked to them Monday at 8 o'clock. We had no notice about this coming. After you all had unanimously passed this law 2 years ago, all the tenets of it just went into effect July 1st, 2024. It's FY 2024. We haven't had a time to see what the real effect of this law is. And the budget analysis said, so far this fiscal year, it's $557,000. That's a far cry from the estimate that the DDA representatives gave at their budget hearing of up to $270 million. And that would be $90,000 per person in self-direction. That's not going to happen. And we hope that you will strike the items just like Matt did and give us a chance to talk and work with them and find ways to save money that does not harm those 3,000 people. Even though it looks like a minor change, it's a big deal, and there is going to be harm in this community. Thank you.
Hi, good afternoon. My name is Mikhail Goitom. I'm a small business owner. I have 5 stores on the Baltimore City, and also I'm ex-cap or support agent for the lottery. Support agent means we cash it until 5,000. Today, I'm here to say no for the bill HB 352, because at this time, the cost of living has hit to the roof. The minimum wages increased, the rent was increased, the food cost was increased, everything was increased. This is the worst time is to cut the commission. This bill is gonna hurt to the small business owners like me. It's not gonna hurt the big corporations. So also, the minimum wages increase. We don't pay minimum wage. I'm paying $18, $19, $20 to an hour because my employees, they can survive within $15 an hour because everything is increased. The apartment rent is 40% was increased. So that's why we paying them is from $18 to $20 an hour. So this is, if you cut it, this is gonna be hard for us. Thank you for listening.
So Honorable Chairman, Vice Chairman and the committee member, my name is Sharad Doshi. I'm a Maryland resident since 1995. We moved here for the business. We are Maryland lottery agents since 95. And it seems like we did a good job by providing the services to the customers and others. So we are penalized. Instead of, as Chairman said before, why don't we look into increasing the revenue, balance the budget? When you are asking state budget, you have millions and billions of dollars to match. As a small business owner, it's much more difficult. Today, lottery revenue is about, give and take about 50% of my profitability. Now, if you decrease that, so it's going to decrease by at least 20% on my profit line. So what is going to happen is going to impact eventually to my employees and everyone else. Another good example I wanted to give you, about 3 months ago, we had a break-in into our convenience store. And the only thing they took is instant scratch-off tickets. We called police, FBI, everything happens. Stolen tickets was $3,500. In order to recover that $3,500, we have to sell minimum $70,000 worth of ticket, which is equivalent to 1 month of my revenue. So when we are looking at different aspects of it, balancing the budget, I think it's a good idea how to increase the revenue, not to penalize who's doing a great job. We are right on the border we are Frederick County, so 20 minutes to Virginia, 20 minutes to West Virginia, and 30 minutes to Pennsylvania. Now, the cigarette price is down there. It's about $4 cheaper than us. So people are driving down there and buying other things, and we are suffering. So it's a kind request to consider not to penalize people doing a great job. Thank you so much.
Thank you very much.
Thank you.
Chairperson Barnes, Vice Chair Chang, and esteemed committee members. I'm here to ask that you to remove any reference to Article Health General Sections 7101 and 7409, leaving all provisions of the Self-Direction Act intact. But I'm here to tell you a little bit of how the Self-Direction Act came to be. I'm a nurse, my name's Patty Saylor, and I work for people who self-direct their own services. And I have been doing that for 17 years. And I'm also the parent of a former participant in self-direction who is deceased. The Self-Direction Act was put into place. We brought legislation 3 years in a row. And the third year, the HGO chairperson at that time, Shane Pendergrass, said something's going on here. We need to see what these people, what's going on in their lives. So she commissioned the Maryland Self-Direction Program Work Group at that time. And work group members consisted of the Honorable Karen Lewis Young, the Honorable Susan Lee, both bill sponsors, delegates Kipke, Bella Castro, Bandari, Resnick, and Valentino Smith. The remaining membership was comprised of people with disabilities, family members, advocates and advocate agencies, and state agency representatives. Additionally, the work group enlisted input from nationally recognized subject matter experts and public comment from stakeholders. The work group met from July of 2021 through the end of December 2021, with the final work group report being submitted on March 7th, 2022. My written testimony has a copy of that report. A Self-Direction Act was subsequently passed unanimously in the Senate and the House, with provisions to be implemented July 1, 2022. Many of the provisions needed waiver amendments. And so the act, many of those amendments went into 2023. So that's a mere 8 months ago. That's not enough time. So the people spoke up. We did a study. Legislators were involved. We came out with this IFDGS, and we'd like it to remain in place until further look at it.
Okay, great. Thank you very much, Mr. Saylor. Question from Delegate Grice.
Thank you, Mr. Vice Chair. Matt, how many years have you been coming to the General Assembly to testify? I'm just curious.
I think it's been since about 2011 or 2012, so way back in the way back.
I know it's, I remember when my first year was 10 years ago, and I was on the health and then it was, I guess it was HHS, now it's Health and Social Services. I was very impressed with your testimony then, and I still am. I know you spend most of your time in our subcommittee. I just want you to know, to keep up the good work, because there are certain people when they come in where it's hard for us to pay attention because we get real busy, but there are some people when they do come in, it captures our attentions and all of our attention. And that's the case when you do. So I just wanted to let you know that and keep up the good work.
Well, I appreciate the compliment.
Thank you very much, Delegate Grice, for your kindness. Thank you very much, Matt, and to the entire panel. Are there any other questions from members of the panel here? Okay, great. We're going to call up the next set of witnesses. Thank you very much. The next we have Elizabeth LaFrance, self-directed, Daria Willis with Howard Community College. Those are the two we have for in person, and the rest will be virtual.
Good afternoon. My name is Elizabeth LaFrance. I'm on the board of the Self-Directed Advocacy Network of Maryland, and my son Brendan self-directs. Listening to the testimony earlier about the Enough program, I wanted to say that self-direction, well, there's a bi-directional link between developmental disabilities and poverty. And self-direction is a wonderful tool to be able to weaken that link. having a child with a disability means, especially these kinds, means that your household income is impacted. One parent usually can't work. If you are working, I lost 2 jobs myself, and until I had found a job where I could work from home. And then when my son graduated, I continued with that job, then finally retired. IFDGS funding is built into the provider rate. It's in the rate. Full access to the funds only became possible when the waiver was amended last July. There's no data. I don't know, how the department came up with the figure that they did, but I think we need to discuss the fiscal impact. Two things that the law did. One was require the department to inform people about self-direction annually, which they weren't doing. This will help us reach other communities who aren't involved in self-direction in this great program that lifts people, it helps families stay out of poverty. And the last thing I wanted to say was that, the day-to-day administrator, most of the people who started in self-direction are in their 40s, who now their parents are in their 60s and 70s. If they don't have the day-to-day administrator, they're going to have to stop self-direction because there's no other position that can give. Every other position has to do direct supports. The day-to-day administrator is an indirect support, and we need that so our kids can continue when we can. Thank you.
Great, thank you very much, Ms. LaFrance. Are there any questions for Ms. LaFrance?
Sorry.
Delegate McCombs has a question for you. Ms. LaFrance.
Thank you. Could you just, very succinctly describe how the self-direction program has changed your life and your care of your family member?
Oh, sure. Well, my family, I'm a support broker too. In my family, my son was fortunate enough to start self-direction very early, but a lot of my clients came into it late after they had been through traditional providers who don't have the capacity, especially for people with higher needs, medical or behavior. And they are so relieved that it just transforms their lives. I mean, I have a client who somehow missed out on services, and at age 40 his family was struggling. I mean, they couldn't even afford to buy a car, and they just the whole family pitching in, and they were able, once they got into self-direction, he was able to hire staff. Mom and dad are older, they can sleep through the night because they have overnight supports. I mean, it's transformative, it really is. And it is not fiscally worse than providers. I mean, we get the same rates. I don't see how self-direction could even cost more when there's parity, and actually self-direction has less access to those rates. Providers bill the full rate. We just bill what part of the rate that we use. So thank you.
Question from Delegate Edelson.
Thank you, Mr. Vice Chair. Just to follow up on my colleague's question, could you give us a little bit more understanding of how the proposed cuts in the budget will impact you and your clients?
Sure. So right now, it's IFDGS is really an umbrella term for program and general administrative. So program would be, you want to go to the gym or participate in a community class. Those things are limited, with the limited funds. We've always kind of had access to that with the limited funds. To me, the really important part, because we want to be able to sustain self-direction and not have people have to go, where would they go? They didn't have a place to go to begin with, but once people get, their parents can no longer help, and some people just don't have family. Having that administrative position that can run the program, because there's a lot of responsibility that people take on when they self-direct. You know, it's not just, you know, you agree to take these responsibilities. Someone has to do that. And if a parent can't or a family can't, a lot of these people would have to go back to traditional services.
Understood. Thank you.
Thank
so
you.
much.
Great, thank you very much, Dr. Eagleson. Are there any other questions? Okay, great. We have also Brad Phillips and Teresa Felder going to come up, and then also just want to check one more time, Daria Willis with Howard Community College.
Vice Chairman Chang, Daria Willis had to leave early for a meeting. I'm sorry she won't be able to be here. But good evening, Chair Barnes, Vice Chair Chang, members of the Appropriations Committee. My name is Brad Phillips, and I'm here on behalf of all 15 CADE funded community colleges and asking for your support to reject the proposed BRFA reductions in this year's BRFA. I'll hit 2 or 3 points, and just want to start by saying this rebasing of back to 26.5 and the narrative of we're getting more funding with less students. I just want to go back to where we started. The BRFA of 2011 decimated our funding level percentage tied to 22. It's taken 13 years to get back to where we should have been all along at 29% funding, which was the policy goal that equated funding for community colleges equitably with what the four-year public institutions received. This BRFA, what it would do is not only cut funding for 2024, but for 2025, it would cut 22.6, the next year 28 million, 29 million, 30 million, and so on in perpetuity. That would be a total of $136 million cut in the next 5 years, in a time when 72% of the jobs that are coming available will require some level of post-secondary education. Just to summarize, I think what the point I really want to make is that, you know, all the work that we've been able to accomplish and the growth that we've been able to make as a state to actually fund and look at helping populations of students that are underserved and underrepresented, being able to reach this level of funding, even though enrollment may look like it did, we've graduated more students than ever before. And we just would request that you do not balance reduced support for the economically disadvantaged students with the greatest educational needs the most. If I can, one last point. I have a number of presidents in the audience that I would like to acknowledge, if that's okay. Dawn Lindsay was here, but she had to leave. We have Dr. Klauber from Hagerstown Community College, Dr. Copper Smith from Chesapeake, Dr. Bolt from Cecil College, Dr. Ball from Carroll Community College, Dr. Midcap from Garrett College, and we also have Trustee Reza Jafari from Chesapeake College, and of course we have Teresa Felder from Hartford Community College.
Good evening. It said good afternoon earlier, but it's good evening to all our esteemed committee members. I am Dr. Teresa Felder, president of Hartford Community College. I want to emphasize the critical importance of maintaining the CADE funding formula and express strong opposition to the proposed cuts to community colleges. Some of the delegates have already noted, we serve students who are otherwise underrepresented in higher education. Receiving full CADE funding for the past 2 years has allowed our college to increase much needed student support services for these students. We've expanded mental health support, our food pantry, and resources for students' emergency financial needs. We've also added a retention scholarship to provide additional financial assistance to students who are near completion but cannot fully pay their tuition. Full CADE funding and the addition of much needed student support services have improved student retention, contributing to an 11% increase in enrollment in the fall of 2023. Overall, community colleges are up 8% compared to 2% at public four-year institutions. This growth highlights the vital role of state funding in sustaining essential student support services while keeping tuition affordable. Disrupting CADE funding during enrollment growth will create resource constraints, jeopardizing equitable access to education for all Marylanders, disproportionately affecting vulnerable students and hindering their success. Fully funding the CADE formula is a strategic investment in Maryland's future that ensures access to higher education, supports workforce development, and fosters economic prosperity. Lastly, Governor Moore's agenda outlines 4 priorities. Maryland's community colleges are uniquely positioned to address 2 of these: making Maryland's economy more competitive and expanding opportunities and support for Maryland families. Fully funding Maryland's community college also aligns with Governor Moore's campaign promise to leave no one behind. I implore you to reject the BRFA and sustain current funding levels in support of community colleges, our students, and the communities we serve. Thank you.
Thank you. Thanks for what you both do for community colleges.
Thank you.
Thank you.
Any questions? Delegate McComas.
Thank you, Mr. Chair. Dr. Felder, could you just kind of explain to the committee how instrumental that the Harford Community College is as far as being an incubator, but also a magnifier of the economic development for Harford County, as far as the, you know, the teaching, the collaboration with Towson and just beyond?
Sure. Thank you, Delegate McComas, who represents Harford County so well. Thank you. So it's been noted that community colleges are key to workforce development. We are, which is closely tied to economic development. I sit on the Economic Development Advisory Board for the county, and we work closely with our businesses to make sure that we are meeting the needs of our businesses. We look at the needs in our communities as community colleges, and we align our programming to meet those needs. We also prepare students for transfer to 4-year institutions. We have TUNE on our campus. And again, we work to align our programs so that students can seamlessly transfer to a 4-year institution. So we believe, again, that we are critical to the health and vitality of the communities that we serve. And we partner with our local government, our community businesses, as well as our nonprofits to do so. Thank you.
Any other questions? I don't see any. Thank you all for being with us.
Thank you.
We do have some virtual witnesses. Let's just pull them up as we can. As many as you can pull up, it's fine. Lou Prescott, Christina Lopez, Kawaja Jamal, Steve Bress. If you're listening, be prepared. We're moving to you all and you have 2 minutes to testify. Okay, Steve Bress, you're on 2 minutes. As many as you can pull up, that's fine.
My name's Steve Bress, and I've been a Maryland resident for more than 50 years. I urge you to vote unfavorably on HB 352. My son is on DDA's Community Pathways Waiver and Self-Directed Services, of which IFDGS is one aspect. The current bill seeks to unnecessarily cut the allowed expenditures under his already approved budget. As I understand it, his budget will not change, but his choices as to what he can do with unused funds already allocated to him will be impaired. In his case, he requires a number of nutritional supplements as recommended by his doctors, which are covered by IFDGS. He also requires some dental work that's not fully covered by insurance, which is also under IFDGS potentially, and he requires a little more dental work than his typical peers would. In theory, there is currently no limit to how much of his unused funds may be used toward this goal, but that's not entirely correct. Any request for funding for an IFDGS item over $5,000 must currently both be covered by funds in his budget and specifically approved by the DDA. This bill would draw an arbitrary line in the sand as to how much of the money that's already allocated to his needs could be used to support his needs and goals under the DDA program. Or to put it another way, if his dental work this year would exceed $5,000, under this bill, he would be out of luck. Perhaps he should only have repairs done this year, some repairs done this year, and ignore the pay until the following year. I'm sure that's not the goal. That's just one of the many realities of what getting rid of the IFDGS could do. What one of the earlier people had mentioned, though, is that no one's really sure if the budget that was made up to say what this would cost is correct. I haven't talked to very many people who have $100,000 left over in their budget, or $95,000, which is what the budgetary number was. I don't believe every last person is going to exceed a lot, but as this is a very new bill and it's barely had time to percolate through. It would be very nice to know what the actual numbers are before starting to cut services. The point is, it doesn't affect any of the budgets because all this IFDGS stuff is already allocated, unless there's another change that I'm not aware of. Thank you very much. Please vote unfavorably on HB 352. Thank you.
Right. Steve, thank you so much for being with us and sticking out the late hour. We appreciate your testimony. Sarah.
Yes,
Sarah Prescott. You have 2 minutes.
Chairman Barnes, Vice Chair Chang, members of the Appropriations Committee, thank you for the opportunity to speak with you today regarding House Bill 352. I'm Sarah Truscott, board member of the Licensed Clinical Professional Counselors of Maryland, with hundreds of active members and graduates. Although we understand and appreciate the administration's absolute right to redirect funding due to priorities and deficit reduction, we sincerely request that you consider the following. The Board of Professional Counselors and Therapists receives special funding through fees from the mental health care professionals under the board. The board needs our help with providing and expediting staffing, funding for technical automation of application processing, as is done in Arizona, and if funding balances remain high, to consider a reduction in professional fees. We welcome your assistance to support the board through reduction of the $1.6 million requested in this bill, and by working with the department to provide enhanced administrative assistance through fast-tracking application automation and with human resources in the hiring process for staff and recruitment and retention. Thank you for your kind and favorable consideration.
Ms. Truscott, thank you for being with us and your testimony today. Christina Lopez, welcome. You have 2 minutes.
Thank you. Good evening, esteemed members of the Appropriation Committee. My name is Christina Lopez. I am president of the Maryland Association for the Education of Young Children. MDAYC is a professional association of nearly 2,000 early childhood educators, allied professionals, and families. We promote high-quality early learning for all children birth through age 8. And I am here today to advocate for the preservation and enhancement of the Child Care Scholarship Program in our great state. Firstly, it's imperative that we safeguard the funding allocated for the CCPSP to ensure continued access to quality childcare for families statewide. Recent policy strides, such as expanded family eligibility and waived copays, must be upheld to sustain the progress in our childcare system. Secondly, we urge you to work with the early care and education workforce to fortify the framework of the CCSP policies and practices. Endorsing the governor's proposed allocation for childcare and sustaining investments in the CCS budget are critical steps in this endeavor. Lastly, we must oppose the BFA provision that would enable the administration to impose an enrollment freeze without legislative oversight. Ensuring accountability and transparency in decision-making processes is paramount to the integrity of our childcare system. The reinstatement of family co-payments poses financial challenges and threatens the accessibility of childcare services. We know through research that affordable childcare plays an indispensable role in sustaining workforce participation, particularly among women. Equitable compensation and support mechanisms are essential to the vitality of our childcare workforce. Access to early child care education and care is not just an educational issue, it's a social justice issue, and it's critical to our economy. That's why we urge you to approve with that one opposition. Thank you.
Perfect. Thank you. Perfect timing. Any questions? Okay. Thank you so much for being with us. Have a great day. That concludes the bill hearing, Madam Secretary. Thank you so much for being with us this long day. We appreciate you, all the great work you do. Nope, committee, we do. That's a great reminder. We have 13 bills left and we have a budget hearing. So we're going to get to those as expeditiously as we can. We do have a very important bill, Delegate Shetty's Bill 1439.
All right, guys, let's switch and talk about trauma.
Good evening, friends and colleagues, Mr. Chair, Mr. Vice Chair, distinguished friends of the Appropriations Committee. For the record, Delegate Emily Shetty here to request a favorable vote on HB 1439, which would provide some improvements to the funding of our trauma system. So I don't need to beat a dead horse. We have had the privilege of having a full committee briefing. Thank you, Mr. Chair, for that, on our amazing trauma system here in the state. There was last year a bill that we passed to establish a commission to study the funding of our trauma system. It came out with several recommendations as part of the trauma briefing. We all heard the preliminary recommendations, which have since been finalized, and they're submitted in your floor system for your review. What my bill does is it takes several of those recommendations that require legislation and puts them into law, hopefully once this is passed. So there are three major components. One is it makes the pie bigger, right? So we have a challenge with the funding, the special fund for the program. So it bumps up the MVA fees from the annual $17 to $24.50 a year. This would increase funds to the trauma fund by $34.2 million. It also increases a new fee, not a new fee, but brings in a new fee and funding source that I hope can be bipartisan as well, which is a 10% increase on the DUI conviction fines that are assessed. So this is after somebody is criminally charged and convicted of a DUI, they have to pay a criminal fine. And this would increase those fines by 10%, capture it and put it into the trauma fund. This follows one of the recommendations of the Trauma Commission, which was that, we need to be thinking of additional potential sources of revenue that are tied to the way in which people end up in our trauma system. The other major thing that the bill does is it adds flexibility to MHCC to spend down the current fund. So right now there is funding that we appropriated over to the MHCC for the administration of the Physicians Trauma Fund. They are restricted from spending some of that down. What this bill does is it adds additional providers that could reimburse against the fund. It adds additional flexibility to the commission to be able to spend down the resources that they collect. And the third thing that it does, I'm going to flag this, is that it removes the Aviation Command Division from MSOF. MSOF has a projected $35 million budget deficit over the next couple of years. So as a point of discussion, we put in the bill as drafted an idea that's been kicking around to remove Aviation Command from it. It's like a $46 million component of MSOF every year. After hearing from many advocates on this idea, we've requested an amendment to bring it back into MSOF and restore that. So you'll see there are many advocates who have submitted written testimony asking for that to be restored. One of the amendments that we are proposing would do that. So if you have concerns about that component, rest assured I've got you covered.
We'll be adopting. So anyone.
Sorry.
We will be adopting that amendment.
Yes,
so
thank you, sir. And then the other thing the bill does is it sort of authorizes the distribution of dollars in a couple of different ways. So one section would be to our only freestanding hospital, shock trauma. They cannot currently reimburse against the physician trauma fund. That is why they are specifically called out as receiving additional funds, which are desperately needed. And then the other component is it distributes it to the physician trauma fund, which needs the money. There will be amendments. I know MHCC, HSCRC, and others have brought additional ideas. I'm working with all advocates as well as others in the General Assembly to address these concerns. But for now, I would love to have an opportunity to answer any questions. And I want to note that there are several folks who signed up to testify. If you are still here in the audience, please note the late hour and that Me Too testimony is always welcome. Happy to answer any questions.
The work during the summer and everyone on the committee there. Thanks for the work you've done.
Thank
This
you.
is certainly going to be a priority for the committee this year to make sure we get this right. Any questions? Let's not go.
The 10% increase on DUIs, how much,
Yeah.
is there a projection on how much that will bring in?
Yeah, thank you for the question. So the fiscal note notes that at a minimum, under certain assumptions, that it would bring in $300,000. But the fines right now are $1,000 on first offense, $2,000 on subsequent offenses. So the 10% increase is respectively $100 and $200. So using the assumption of the minimum $1,000 fine, then the DLS estimated $300,000 at 10%.
Okay, thank you. We were trying to find it. I guess the thing and I agree with the chair's comments. I know how much work you put into this, and as did the group that are behind you over the summer. Was trying to figure out if it was meaningful enough that if we were to double that number, theoretically make it 20 or 30% to reduce the registration fees, if that was feasible.
I think that is an excellent suggestion, and I will take it into consideration. I do think that it's worth looking now that we have numbers. It was very difficult for us to get the numbers from the judiciary on the tickets and the fines. And so now that we have a fiscal note with the estimate, it's easier for us to kind of play around with the figures.
Okay. I'm just excited that we have so many Republicans today interested in revenue. Mangione.
Yeah, I know. It's wonderful.
Hold on. For the record, Republicans are not for DUIs.
All right, duly noted. There was some doubts. Anyway, seriously, thank you for the bill. Any other questions for the bill sponsor? Okay, we do have some witnesses, as you've mentioned: Ben Steffen, Christy Snedeker, Robert Phillips, and Zachary Achiaga. See you all. Whoever wants to start, the microphone's on there, so go ahead.
So, good afternoon, Chair, members of the committee, Ben Steffen, Executive Director of the Maryland Healthcare Commission, and also co-chair along with Dr. Ted Delbridge of the Commission on Trauma Funding. I'm not going to say too much today other than you've heard me before, and I'd like to give opportunities for others to speak. But what I would say is that Delegate Shetty's bill conforms with the recommendations of the Commission on Trauma Funding. The Healthcare Commission strongly supports passage of the bill, and I'll be happy to answer any questions. I also want to note and thank Delegate Shetty as well as Senator Alfred. We were a little late in getting the report in. We appreciate their patience. I know that it's caused some challenges, but we'll do everything we can to accelerate and answer any questions. Thank you.
Good afternoon. Oh, there we go. Good afternoon. I'm Dr. Christy Snedeker, Vice President of the R. Adams Cali Shock Trauma Center. You have heard what our needs are. Dr. Scalea came to speak to you as a committee. You visited us. Dr. Scalea wanted me to send his regrets. He's traveling back in earnest and just couldn't make it today. I don't have anything else to add. You have the written testimony. We're so grateful that this is a conversation at this committee's level. We're here with our partners. Thank you to Delegate Shetty for all of her work, and we certainly support with the amendment that she put forward for aviation to be kept in MSOF. We're grateful for that amendment today and are requesting a favorable report.
Thanks, Christy. Just to reintroduce myself, I'm Zach Arciaga. I'm one of the trauma program managers, a part of the TraumaNet system. We recognize that there's been a lot of effort around this, and we just want to thank each and every one of you for this. We recognize also that the components of the system make up the whole, ultimately similar to a tributary. And so however we strengthen those bonds of flow for us as a trauma center to really improve outcome, that's really our goal. And we recognize that you all are an important part of this legislative process. So just hearing what Delegate Shetty had just mentioned, we support a favorable outcome as well. Thank you.
Good afternoon, Mr. Chairman and members of the committee. My name is Eric Smothers. I'm president of the Maryland State Firemen's Association. And I want to also echo the work and commitment behind to continue to make MSOF solvent and going forward. And also for Delegate Shetty and the amendment. And we are in support of the amendment to maintain the Maryland State Police Aviation Command within the coalition and in partnerships. It certainly makes Maryland safer, and we have a model system in Maryland that is second to none, and maintaining that is vital and key for us, especially in the fire service. So we want to say thank you very much for your efforts here.
Okay, thanks for your advocacy. Appreciate you all. Good to see you. All right, Michael Cox, Theodore Delbridge, Michael Sanderson, Jennifer Witten, Raymond Fang. I think that was 5, but we could fit you all. Go ahead. Go ahead.
Mr. Chairman, I'll go first. Jennifer Witten here, committee members. I'm here today in support representing Lifebridge Sinai Hospital. Again, I want to echo the sentiments towards Delegate Shetty. She had a lot of passion. She attended every single meeting of the task force and was very diligent about her efforts. So thank you. We are here today in support as well. Appreciate the consideration. Sinai Hospital serves over 3,000 trauma patients each year, and we have the privilege to do that. And we do that by looking at all of the infrastructure that's needed for that. So the support that you're all considering would be really critical for us to continue those programs. So we look forward to the further debate on how we sort of look at the structure of the funding as it moves along the process, but hope you all give this a favorable report. So thank you.
So Chairman Barnes, members of the Appropriations Committee, thank you for the opportunity to speak to you this evening. And I sympathize with you for the late night you're going to have. My name is Raymond Fang, and I've been a trauma surgeon in Maryland for 13 years. I am currently the trauma medical director at Johns Hopkins Bayview Medical Center, a level 2 trauma center in the Maryland system. And I've been the trauma medical director for 7 years. I first arrived to Maryland as an active duty Air Force trauma surgeon assigned to the R. Adams Cali Shock Trauma Center, where I practiced for 6 years. Today, I'm here on behalf of the Maryland Trauma Center Network, also known as TraumaNet. TraumaNet is an organization solely focused on improving trauma care in Maryland and offering our patients the best chance for recovery after injury that can occur unexpectedly at any time of day or night, anywhere in our state. TraumaNet's members are the 10 Maryland trauma centers, which include shock trauma, and the 3 specialty centers for burn, hand, and eye injuries. A year ago, TraumaNet and its members expressed concerns about the financial health of our state trauma system, and you took action. We thank you for both a one-time investment in trauma care in this year's budget, as well as creating the Commission to Study Trauma Center funding in Maryland to better understand the issue. In 2003, the Maryland Trauma Physician Services Fund was created to support Maryland's trauma centers. In the subsequent 20 years, there have been few changes in the fund structure, despite significant changes in the medical economic landscape. The fund's limitations, both in annual revenue and authorized uses, hinders its capability to support trauma care in our state. The Trauma Funding Commission concluded that, quote, it's in the public's best interest to fund a trauma system that is in a perpetual state of readiness for the next injured person, close quote. The simple reality is that readiness has a cost that is not adequately supported by Maryland's unique hospital rate system. Among several recommendations, the Commission specifically recommended that the trauma fund support for on-call payments be increased to better cover these physician readiness costs, and that the MHCC be allowed greater flexibility to award trauma fund grants to support trauma center activities. Additional trauma readiness costs included in hospital rates should be standardized and transparent. And to be accountable for this public investment, Maryland trauma centers should be expected to excel when benchmarked against our national peers. The Maryland trauma system exists to care for our fellow Marylanders, our friends, our families, and perhaps ourselves. And we thank you for your support.
Thank you so much. Yes, sir.
Good evening, Chairman Barnes, members of the committee, and especially to Delegate Shetty. I'm Dr. Ted Delbridge, Executive Director for MEMS, the Maryland Institute for Emergency Medical Services Systems, and I'll take a hint, me too. HB 1439 provides the needed financial support to the state's trauma center, so they'll be there at any time for any Marylander. And with amendment to maintain funding by the MEMSOF for the State Police Aviation Command, we hope for a favorable report. Thanks.
Good evening, Mr. Chairman. Michael Cox, the Executive Director of the Maryland Fire Rescue Institute. I too will take the me too, save you some time since you have a long night. I just want to say that here in Maryland, we have the finest EMS and trauma system across the country, and we definitely appreciate what Delegate Shetty has done and you members of the committee, and we fully support the bill.
Mr. Chairman, Michael Sanderson with MACO. We've submitted support with amendments testimony. We like this bill. We also see a natural synergy between this bill and one of our own initiative bills that you're going to hear later this session, working with Delegate Jones on. Last year, you passed a task force, a commission to look and look at advancing firefighting across the state of Maryland. Those recommendations are going to be before you in a bill. This may be the perfect vehicle to do something on top of, not to compete with, but on top of what you've already heard. I think the synergies would be obvious when you hear both bills. So keep that in mind, please.
All right. Well, thank you all to our doctors who are with us. Thanks for the work you do, our firefighters and everyone. Thanks for being with us, sticking it out with us today. Have a good day. I think we are down to one virtual witness here, Jennifer Fritzine from Children's. Do we have? Okay. Hey, Jennifer, are you turn your camera on and your audio? Not responding. Okay, Jennifer, I'm so sorry that you've been with us all day. We're gonna give you just one more second here and then we're gonna have to move on because we do have 12 more bills. So we're gonna give you just another second to get your camera on and turn your audio on. Okay. All right, we will, Jennifer, if you are watching this later, we will accept your written testimony and we will make sure every member of the committee gets it. That concludes the bill hearing on House Bill 1439. And now move to House Bill 389, Delegate Healy. And I should say, Delegate, before you start, we have our friends from ENT here. Welcome. All right, good to see you all. Thanks for being with us.
Thank you very much, Mr. Chairman, members of the committee. This bill, there's a history to it, and I want to ask your indulgence for a couple seconds because this was one of the first issues that came before me a long time ago, my first term when I was in Ways and Means, and Ways and Means had transportation funding and policy. And State Highway at that time had an actual policy that they did not build sidewalks along state roads, period. And among my colleagues who were on the committee at the time, Delegate Carolyn Howard, Delegate Jim Rosapip, and I kind of put our heads together to try to get that policy changed. And it's a story I tell a lot because it tells the need for persistence and being kind of modest at the beginning. We asked for just the change of the policy, and in order to get that, we accepted a $2 million cap statewide on any sidewalks per year. But we got the policy changed, and they were building sidewalks along state highways after a while. One of those sidewalks is right along Route 1, between right near where you live, Mr. Chairman. People used to get off the bus in front of the Armory and have no place to get to if they wanted to walk up to College Park. So they had to walk in the street or crisscross back and forth to where there might be a small patch of sidewalk. That has changed because of what we did. Now, one of the other aspects of that is that the sidewalks had to be petitioned by the local government, and the local government had to agree to maintain the sidewalks. Fast forward to now, people take for granted that they can walk along the sidewalks. And we have a policy now about urban highways, so that the state will build those roads so people don't have to walk and push baby carriages down Kenilworth Avenue, that there will be sidewalks there. And so all of these things have happened over the years. Now it's time to go back and look at why we're not getting more of this and to include, as we should, bike paths. And that is where the world is now. It's all these years have changed. I want to refer to the fiscal note because there's a little bit of an explanation about what's covered now, what's not. What I'm proposing is that we take out the requirement that the local governments must commit forever to maintaining sidewalks and bike paths along the state highways, and that it would become a more negotiable issue. I know I have been in conversation with State Highway, and I had a good conversation with the administrator before session, and I talked with their legislative people this morning. And I'm hopeful that we can continue to work on finding a solution, because I understand the financial problems. But really, these things are built in the right of way. They really are the responsibility of the state to maintain. I will be working on some amendments, perhaps to more clearly define what maintenance means so that it can become a shared responsibility, and that the state highway people can handle the things, the big, expensive, hard to do things where you need heavy equipment. But for mowing lawns and taking up snow, local governments probably have the equipment to do that at the local level, and it could be something that could be done. I would ask that you give me a little time to work with State Highway and not act on this immediately. And I have a few people from the bicycle coalition that are very much interested in this. There's a particular stretch of road near Greenbelt, near NASA, that we've been working on for a while. But we don't want to do this piecemeal. It's time to change the policy. And if that means we take baby steps, it's fine. But I think we need to change the policy this year if we possibly can. And I'm happy to answer any questions.
Thank you, Mr. Chair. Thank you, Delegate. So I only heard you mentioning places in Prince George's County. This would apply statewide though, correct?
Absolutely. I'm only mentioning that because it's my district.
I get it. So considering the fact that State Highway Administration, the only jurisdiction that it does not maintain the roads of is Baltimore City, have you talked to them about whether this applies in Baltimore City or not?
It would not, because it's only along state highways, and that's the current law.
Well, there are state highways in Baltimore City.
Okay.
I understand that.
Okay, I'm sorry.
The point that I'm making.
Okay, I'm sorry. I'm misunderstanding your question.
No, I think you've answered it correctly. You're saying that it's not going to apply in Baltimore City.
As far as I know, but we could make that happen too.
And are you saying you need time because of the portion in the fiscal note that talks about the fact that the State Highway Administration doesn't have a good grasp on how much more funds they will need in order to maintain the sidewalks in every jurisdiction along the urban highways?
Yes.
And that it could be up to $10 million.
That's what I want to work on.
Okay.
Thomas.
Thank you, Mr. Chair. Just briefly, can you get some documentation as to how many people might have been injured within the last, let's say, 10 years along the highway because they were forced to go walk along the highway because there wasn't a bike path or, some kind of way that they wouldn't have?
I think State Highway would be the only people that would have, or maybe the local governments might have that, but I don't have that information.
Well, but could you see if they would?
I will ask.
Okay. Well, no, there's a reason I'm asking, because I just see a lot of people. Well, one way you could maybe make it cheaper is there's a lot of, like, there's a Northern Central Trail in Baltimore County, and maybe it wouldn't have to be concrete, a set sidewalk, but just maybe some, just some gravel or something, so somebody could get off the road and walk on it. I'm just thinking, because I think it's very dangerous. I see a lot of people going across highways, state roads in my district, and it's scary as heck watching it.
Yeah.
Okay. All right. I'm just teasing you, though. All right. Thank you. Any other questions for Delegate Healy? All right. We do have some witnesses, Delegate Haley, so feel free to stick around. Seth
Okay.
Grimes,
I will.
Jeff Lemieux. And we have a virtual witness, Seth Grimes, Jeff Lemieux.
Chair, thank you. I am Seth Grimes with the Washington Area Bicyclist Association. I am authorized to speak also for Bike Maryland Coalition members that include Bike Annapolis and Anne Arundel County, Bike Howard County, East Coast Greenway, Frederick Bicycle Coalition. And I am going to not read from my written testimony. Instead, I will extemporize by saying, first of all, we do have a problem. If you take a look at my face, you'll see the bridge of my nose is abraded because last week on my way to a hearing, I tripped on Maryland 70, Roe Boulevard, about a mile, less than a mile from here, on a sidewalk that had buckled. It was about 3 inches and I didn't see it and I went flying onto my face. I'm kind of embarrassed to be saying this. We have a problem that our sidewalks are not being maintained along state highways. That is because current state code, and it's decades ago, imposes a responsibility without any kind of actual affirmative assent from the people imposed on it. What this change that Delegate Healy is proposing would do would force attention on the maintenance issue to be negotiated by the State Highway Administration and localities. It would not disrupt the current agreements in place, but it would potentially lead to agreements for maintenance where it doesn't place the burden on state highway. Let me address the fiscal note. First, the reason that the numbers are fuzzy is that the maintenance is not happening. Delegate Spiegel, I actually consulted before he joined the General Assembly when he was at the city of Gaithersburg and asked about quantifying the costs that Gaithersburg spends. I had similar conversations with the Department of Public Works and Transportation in Prince George's County. Those numbers are very hard to come by because the maintenance is not being done. That's why I'm here. We do want to see the additional creation of bikeways and sidewalks. We are a safety organization, and we do get from Montgomery County. I talked to the county authorities that they are concerned about the costs being imposed on them. Finally, the fiscal note, you'll note it includes that there is a decrease in costs for localities. Taxpayers will pay nothing extra. What we're doing is talking about a shifting of costs potentially. Thank you.
Yes, sir.
Hi, I'm Jeff Lemieux from Friends of the Greenbelt East Trail, and I think I'm the reason for this, so I wanted to come in person in case you have questions. The Greenbelt East Trail is a proposed trail along State Route 193 between Greenbelt and Glendale. It would provide a safe access for people riding the bus, walking, and riding their bikes or scooters to Eleanor Roosevelt High School, Duvall High School, Goddard Space Flight Center, and it would also create a regional connection between the trail that goes soon from Prince George's into Anne Arundel County and also the Washington, D.C. Trails network, which in Prince George's County is mostly the Anacostia River Trail system. And the history behind this effort is that I approached Delegate Healy last year at this time, and I said, we're having trouble getting MDOT to do a feasibility study because we can't get Prince George's County and the city of Greenbelt to sign off on indefinite maintenance expenditure of any bike trail or sidewalk that we would build. And we're trying to get these sorts of protection features on Route 193 precisely to lower the load on our trauma centers. We've had 129 people killed in Prince George's County in traffic over the last in 2023, most of them on state roads. And so this is really it's not about maintenance, it's about safety. We're trying to get new things added to make bikers, walkers, and bus riders safe. And this clause in the law, not the petitioning part, the cities and the county were happy to petition, but they were very hesitant to sign off on maintenance. It was the maintenance part that really was a bottleneck. And with that, I would just say that, thank you. And I'm happy to answer your questions, but this is about expediting safer walkways and bikeways throughout the state by removing this clause.
Thank you. Thanks to you both for being with us today. We do have a virtual witness. Carol, are you able to? No? Okay. Melissa Schweiguth. Melissa, if you can turn your camera on and your audio.
Ways and bikeways throughout the state by removing this clause.
Melissa, you need to turn off the YouTube. It's gonna, there you go. Virtual. Melissa, you have 2 minutes.
Okay, thank you very much. My name is Melissa Schweiskuth. I also live in District 22. We have packed the virtual house. I'm going to start by saying me too, because you are very busy and you've been sitting for 5 hours. So feel free to take a stretch, but continue actively listening while I say my short comments. Because you've been sitting for 5 hours. This is really tough and I appreciate it. So again, I just wanted to reiterate the support for a favorable report on HB 389. I appreciate the comments about, sort of double checking the fiscal and policy note, which again assumes that everything is going to default to SHA, although as Delegate Healy has noted, her intent is that this be negotiable. And I just really wanted to emphasize, that the point here is that this maintenance issue right now, that this is sort of the deciding factor for whether we have a bike path or a sidewalk. It is not safety. But the reason that we're creating bike paths and sidewalks is, should be because we care about people are using those areas. People want to cycle, they want to walk, or they're already doing so, and they're not safe. So safety should be the factor. And then we can negotiate and figure out again, who's going to pay those maintenance and repair costs. Again, I regularly bike for commuting and errands. I live in a state road connecting urban residential areas and trail system heavily used by bike commuters, and regularly drive on state roads that bisect residential, school, commercial, and transit center areas, including Maryland 450 and 202. And I'm just always shocked at the poor quality of the sidewalks or lack thereof, bicyclists that are just riding, in the lane, in shallows, because these are desirable roads for cyclists and commuters, but unfortunately they're not safe. So I do ask that you support this bill, that you support HB 389. I do have more detailed.
Thank you so much. Thank you very much for your testimony and being with us today. Any questions for the three witnesses that are here? Delegate Spiegel.
Thank you, Mr. Chair. Mr. Grimes, good to see you as always. I just wanted to clarify, you weren't suggesting earlier that Gaithersburg doesn't take care of its sidewalks, right?
Gaithersburg is fine city government.
Thank you.
Despite your departure.
Thank you.
Thank you. All right. Great idea, Delegate. Thanks for the vote. Oh, Delegate, no, go ahead.
Very quickly, the fiscal note says between $1 and $10 million from the Transportation Trust Fund would be the cost, and the MDOT doesn't even have an assessment of how many paths that there are that they would be responsible for. So that's kind of an impediment to what we're doing. And
If I could.
go ahead.
I've thought about that. I mean, I just thought about it today because I saw the fiscal note and I looked carefully at the letter from MDOT. You're right, there isn't a lot of data there. And I was thinking about what happened when we changed the policy 30 years ago. Maybe we could put a cap for the first few years and see what happens. And then we could collect data and then we'll have something to measure as we go forward.
Well, we'll certainly put it all into the mix. I will tell you that my husband bikes 100 miles a week, and my brother is the founder of Free Bikes for Kids in Maryland. So I'm really enthusiastic about what you're saying and the need for this. But I guess the question would be how we're going to find the money. But thank you for coming and bringing up the topic.
Okay, I'll keep working on it. Thank you.
Thank you all for being with us. It's a bill hearing. Oh, Delegate Rowe.
I'm sorry.
House Bill 1119, Delegate Rosenberg.
Thank you so much.
Thank you, Mr. Chairman and members of the committee, as well as the people here from Economic Matters. This bill is here because the Surgeon General of the United States has attested to the profound risk that our children have from the addictive nature of algorithms. And that is why our Attorney General Brown, along with, I believe, 48 states, the AGs from 48 states, so this is not a partisan lawsuit that's been filed against the media companies, the platform companies that use these algorithms to addict children most noticeably, but they want us to keep going further so that we can see more advertising. The harm is to children. Why do we need this bill when the lawsuit has been filed? It's because we've, in two other instances already, created separate funds, as this committee well knows, for the proceeds of the lawsuits against big tobacco, as well as against the opioid distributors and manufacturers. Without these funds, the money would go into the general fund and could be used for any legal purpose. But with the creation of these funds, the money goes to enumerated purposes in the statute to deal with the problems caused by the harm that prompted the lawsuit. In this instance, we would be creating a separate fund for the money from the lawsuit that the state has entered into against these companies, these media companies, and it would be used to address the problems caused by the addictive nature of their product. The AG has an amendment that has been distributed in terms that is acceptable to me as the sponsor. And this is also an issue that's been cross-filed over in the Senate because of the nature of the lawsuit. So I would urge a favorable report with the amendment from the Attorney General.
Questions for the bill sponsor? Seems pretty straightforward. We do have some witnesses, so thanks for being with us, Delegate. We have William Kress, Steve Sakamoto Wengel. Either of them here. We have an online witness, Hannah Abrams. Do you want to pull up Hannah? Is she here? Okay. Hannah, please turn on your camera and your audio. Hey, Hannah, you have 2 minutes.
Chair Barnes, Vice Chair Chang, committee member.
Yep, you're ready. We hear you.
Committee members, my name is Hannah Abrams, and I'm here on behalf of the Consumer Protection Division of the Office of the Attorney General. Thank you for letting me speak to you today. As you've heard, social media companies use algorithms to maximize the amount of time we spend on their platforms. Higher engagement means a higher number of impressions on advertisements. So by keeping us addicted, social media platforms make more money. Research has shown that this increased use leads to higher levels of anxiety and depression, particularly in young users, as well as body image issues and disordered eating issues, with young women particularly at risk. House Bill 1119 establishes the Algorithmic Addiction Fund to address these harms. It directs money collected from cases involving the misuse of algorithms into a fund that would support the treatment and prevention of algorithmic addiction and other mental health issues. The division submitted an amendment that would narrow the source of the funds to only penalties collected. Restitution is often a component of settlements, and the division wants to ensure that funds collected for the purpose of restitution go directly to impacted consumers. The amendment also ties the source of the money more closely to the harm the fund is intended to remedy, specifically the mental health harms resulting from harmful algorithms. As drafted, HB 1119 would have swept in any money collected from any judgment involving a technology or social media company. The amendment narrows the settlements to cases involving the misuse of algorithms that result in mental health consequences, particularly in children. We ask the committee to issue a favorable report with the amendments offered. Thank you.
Okay, thanks for your testimony. Any questions? I don't see any. Thank you so much for being with us. Have a great day. That concludes the bill hearing on House Bill 1119, House Bill 901. Delegate Wallach.
All right, I promise this will be quick. Good evening, Mr. Chair, Mr. Vice Chair, and members of the Appropriations Committee. For the record, I am Delegate Sarah Wallach, here to present HB 901, part-time senatorial and delegate scholarships. The General Assembly values making costly higher education more accessible to Marylanders, and scholarships and the scholarships that the members offer are valuable tools in making that possible. However, currently, individuals with disabilities who can't take the minimum 6 credits are deemed ineligible and cannot apply and gain access to those scholarships. This is what happened to a constituent in my district who was interested in applying for the delegate scholarship, and that is why I'm bringing this bill. HB 901 enables individuals with documented disabilities to obtain a waiver from the Maryland Higher Education Commission from taking a minimum of 6 credits so that they too can be considered for the delegate and senator scholarships. We value accessibility, and this bill will ensure that we are also inclusive. It has no fiscal note. This bill is being cross-filed by Senator Zucker in the same posture, so both the senatorial and the delegate scholarships can be updated. I urge a favorable report, and thank you.
Good afternoon, Chair Barnes, Vice Chair Chang, committee members. Thank you for the opportunity to present this evening on House Bill 901. Derek Coley with the Maryland Higher Education Commission. Delegate Wolick, thank you for reaching out to Secretary Rye at the MHEC regarding this bill. This bill is very critical to address those individuals with disabilities who want to achieve their educational attainment. We would ask for a favorable report on this bill. It is most critical to help those Marylanders. Thank you all.
Delegate, any questions for the sponsor or the Mr. Coley? Okay, thanks for being with us. Looks like there's one other witness. I'm not sure if Rachel London is with us.
She had to leave.
Excuse me?
She had to go.
Okay, no problem. All right, that concludes the bill hearing. We'll move on to House Bill 741, Delegate Phillips. Delegate, if you have a panel, you can bring them up with you.
Dr. Rose is with me. Thank you, Mr. Chair. I've lost my my other witness.
Kenneth Mills?
Yes, he
Got
went
it.
back to Baltimore.
Okay, thank you.
He did provide written testimony.
We will look at it. Thanks.
Thank you. Good evening, Chairman Barnes, Vice Chair Chang, and the members of the Appropriations Committee. I had to think back. I didn't make it here last year, so this is my first time in the committee, Mr. Chairman. So for the record, Delegate N. Scott Phillips, 10th Legislative District, and I'm here today to request a favorable report on House Bill 741, the Northwest Baltimore County Sports Tourism Facility feasibility study. Sports tourism is a growing phenomenon. It creates jobs, attracts visitors. Most importantly, it creates a multi-use venue for local, regional, and national sports tournaments and events in a family-friendly environment. This bill has been reviewed and vetted by the delegation, Baltimore County delegation. It's been reviewed with the Baltimore County government, and it has been reviewed with the Maryland Stadium Authority. Why do this? Sports tourism is one of the growing industries. It generates income from a multitude of events. It brings in visitors, restaurants, food, beverage kiosks, etc. The example that I used that really came to mind is a place called Spooky Nook in Manheim, Pennsylvania. In 2017, they did a financial impact, $87.1 million in total business sales, $28.4 million in total labor income, and 1,346 total jobs. This is a community, very small community outside of Lancaster, Pennsylvania. Another example is the Boo Williams Sportsplex in Hampton, Virginia. The city of Hampton indicates that the impact on the city every year is approximately $10 million. These are just a couple examples of the potential impact that could be derived from a comparable sports tourism facility in Maryland. So the question is why Northwest Baltimore County? It's unique. On the site today that the MSA would be looking at is an indoor soccer field, an indoor ice hockey rink, and several outdoor playing fields owned by Baltimore County or the Baltimore County Revenue Authority. It's located on 80 acres of land, and it sits at the apex or the intersection of Maryland State Route 30, Maryland Interstate 795, and Maryland State Route 140. As a site, it's well suited for potential development. To evaluate and determine the feasibility of this venture, I am asking in House Bill 741 to have the Maryland Stadium Authority to examine the revenue prospects and projected costs of building this facility. I firmly believe a sports tourism facility will generate revenue for Baltimore County, but also for the state of Maryland as a whole. And so with that, I ask for a favorable report on House Bill 741. I should mention that the Maryland Stadium Authority and the Sports Tourism Director has also placed I believe, a favorable letter in the file for your review. To talk a little bit about the economics of sports tourism, I've asked Dr. Rhodes to join us from Towson State University.
Good evening. Thank you for inviting me, and thank you for listening to my comments. I'm Dr. Tom Rhodes. I'm a professor of economics at Towson University, and for the about 20 years out of the 25 years I've been there, I've been doing sports economics research, and I've been teaching on the topic. Sometimes in a market setting, the private sector underprovides a good or service. This can occur when there are positive externalities. That is, it's not just the buyer and the seller that benefit from private commerce. In markets where positive externalities exist, such as the market for higher education, of which I'm a part, economists typically recommend some measure of government intervention or assistance. I think it's likely that the proposed sports tourism facility in Northwest Baltimore County will provide positive externalities. Attracting athletes of all ages from the surrounding Mid-Atlantic region for tournaments and other athletic events at the facility would benefit area businesses, hotels, and restaurants that would see an increased amount of revenue. Most important for the state of Maryland, much of that revenue would be coming from out-of-state tourists coming and staying for the athletic event. But the benefits likely don't end there. A facility like this can also be used by area residents when there are no tournaments or other athletic events going on. This is where the positive externalities enter the picture, and this is why I support House Bill 741. The type of modern sports tourism facility necessary to be competitive in the market not only brings out-of-state revenue to the area, but it also provides benefits for more area residents as they engage in physical exercise and fitness training. A healthier, more fit, and more engaged community also provides benefits to other members of the community that are not using the new sports facility. Healthier people generally are more productive, miss less work due to illness, and require less medical care in the long run. Employers benefit from healthier workers, and healthcare facilities benefit from less strain on their resources. These positive externalities are not insequential and suggest that fiscal assistance is reasonable. It's also a strong reason to support House Bill 741. Thank you.
Thank you for your testimony. Any questions for the bill sponsor, Delegate Metzger?
Yes, thank you. Thank you, Delegate Phillips. Question I have, has Baltimore County voted on this yet?
The delegation, yes, we have. And we do have a letter in the file.
Okay, and did Baltimore County support it?
Yes, Baltimore County government is supporting it as well.
Okay, thank you.
And if I could, Mr. Chair, I forgot to mention, there are a couple of amendments, friendly amendments that we are accepting. One came from the Maryland Stadium Authority, which said, quite frankly, they probably want to do this in 18 months. And so we would change the date to January 31st, 2026 for the final report. They also indicated they'd like to kind of bifurcate the study. And in the first 12 months, which would be approximately, and this might help with the fiscal note, approximately $125,000 would be an economic impact study. And then the second half, the last 6 months, they would really look at more the site facility and provide a more robust report based on the location. So it would extend it beyond one fiscal year. Yeah, and the second amendment was Baltimore County government asked, and they weren't listed as one of the organizations to be reviewed, to participate in this study, was Baltimore County Department of Recreation and Parks. And hopefully my staff has sent that to the members of the committee, those two amendments.
To the bill. Good to see you.
Thank you.
Have a good day. Thanks for being with us. That concludes the bill hearing. We move to House Bill 904, Delegate Heineball. Cap with you. Richard can come on up.
Chairman Barnes, Vice Chair Chang,
Appropriation Committee colleagues. Thank you for the opportunity to present House Bill 904 for your consideration. I know it's been a long day. This bill doesn't involve a lot of money, but it's very important to Garrett County. For the record, my name is Jim Heinbaugh. I represent District 1A, which is Garrett and Allegheny County. With me today to my right is Dr. Richard Midcap, who is president of Garrett College. I'll just cut to the chase in terms of the narrative of the bill, what this bill does. Garrett College it currently has a cost share ratio with the state on capital projects of 50-50, which means the county pays for 50% of the project and the state pays 50% of the project. What this bill would do would effectively increase the state share on the cost share ratio to somewhere around 68 or 69%, which is consistent with the neighboring county and Allegheny County, where Allegheny College of Maryland is. Important to note, there's no overall increase in state funding for capital projects for community colleges. It's the same amount of money, so there's no additional cost to the state. It's also noteworthy, I think, to mention that the Maryland Association of Community College Council of Presidents unanimously voted to support this. So it's not an issue with the other community college, which I think says a lot for that organization. While it's late, I do need to take a couple minutes just to try to explain very quickly why I believe this change is justified. Garrett County, by most traditional measures of wealth, is the second or third poorest county in the state. It's also the most sparsely populated county in the state. And Garrett College is by far the smallest community college in the state. However, Garrett College, all the conversation today about community colleges has been very helpful because that's what this is all about. Garrett College is critical to the economic and well-being and actually the future of Garrett County. This has been proven over and over again. When I returned to the county years ago to become the director of economic development, the annual average unemployment rate was almost 14%. We developed a plan that Garrett College was a central part of, and just over, I think it was 3 years, we reduced unemployment to less than 5%, sustained it at less than 5% for 5 years. So that's an indicator of how effective the community college can be in helping us with the economy. I don't know how to, what I want to say is that this isn't about the county trying to get a free ride. The county commissioners have invested $22 million in capital projects at Garrett College over the last 19 years. That's a lot of money to Garrett County. The county also has invested $9 million on what is called the Garrett County Scholarship Program. We started that program when I was in economic development. So whereas every kid that graduates from high school in Garrett County gets 2 years of tuition paid for by the county. That program was subsequently modified that if you didn't want to go the academic route, you could use that to get a certificate in either welding, CDL for truck driving, nursing, et cetera. So I mentioned that just to say that the county has invested heavily in the college. And we're proud of that scholarship program because that gave a lot of kids an opportunity to go to college that probably wouldn't have gone to college. Many of those kids, they were the first person in their family to have their college experience. Now, to kind of wind this up, as the county starts looking ahead, it's pretty obvious given the situation that they're going to have to shift funds from capital to cover operating expenses. One good example, the cost to fully fund the county's public school system is expected to go up by about $14 million over the next 9 years. So the bottom line to this is the county's not going to be able to continue to invest in capital at the same rate that they have in the past. Also, Garrett College got hit with a 21% reduction in the BFA, which is somewhere north of $900,000 a year to them, which is a big deal to a small college. So it's for these reasons that Garrett County is requesting a change in the cost share ratio for capital projects at Garrett College. With the help of this bill, I'm hopeful it'll be possible to continue to modernize and upgrade the college's infrastructure and help the college remain a viable institution, which is absolutely critical to the future of Garrett County. Thank you for your patience and time and consideration. And this concludes my have to have this on because of my hearing aids. I'm sorry. So I have a reason. So this concludes my testimony, subject to any questions you have. And I, again, thanks for your patience and understanding, and I'll turn the floor over to Dr. Midcap.
All right.
Good evening, Chairman Barnes, Vice Chair Chang. Delegate Heinball has done an excellent job of summarizing it. I think the only thing I would add is just to make sure to put a little bit of context. By law right now, single counties that have their own community college pay 50% of the capital costs. And that is just an extremely heavy lift for our county. We are by far the smallest jurisdiction in the state that supports its own community college. As a frame of reference, Garrett County has 29,000 residents. The next smallest counties that support one single community college are Allegheny with about 71,000 and Cecil County with about 100,000. And Delegate Heinball is absolutely correct. I've been president for 7 years, and I don't know that I know of any jurisdiction that supports their community college as well as Garrett. We're very fortunate with what we get from county government, both in capital and operating, but this would make a huge difference in allowing us to do future capital projects. Thank you very much. I'm staying overnight.
All right. Good plan. Excellent. Any questions for our own Colonel Heineball or his witness? Delegate Ralph.
Thank you, Mr. Chair. I just said I have to ask this question because I literally was in Garrett County this weekend. I was right down the street from Garrett College. So I wanted to know what is kind of the premier outcome as far as job opportunities for folks coming out of Garrett College, and how would this affect, that pathway?
Well, two of our signature programs, or two statewide programs, Natural Resources and Wildlife Technology, and then Outdoor Leadership Education. Our regions, our county is just very suited to deliver those programs in the area. The students who aren't in those two statewide programs, most of them are in the first 2 years of a 4-year baccalaureate. Our biggest transfer partner in the state is Frostburg State University. So that's really most of it. If it's a career program, they're going through one of our signature programs, and otherwise they're preparing for transfer to 4-year schools.
I would just add to that, if I could, that Garrett College also operates a career and technology training center, a dedicated center that's basically dedicated to training people for the trades. And that's very important to us, particularly with you were there, the vacation home industry, and the construction goes on for electricians and plumbers and all that sort of thing. So not everybody is going to go the academic route, and that's why we formed the Career and Technology Training Center, was to help the other people get a good start on life. Thanks for your question.
One of the other things about what we do at Garrett, a little differently than some of the schools, almost all of the career and technology programs that Delegate Heinball mentioned are through our continuing education workforce training side. So students get in, get a workforce training certification, and get out with much quicker and at much lower expense.
Thank you. Hope you had a good time up there.
All right. Well, thanks for the bill. Thanks for being with us.
Thank you.
Hope you enjoyed Annapolis tonight. The next Delegate Heineball, stay here. You're 909. If you have a panel, you can bring them up.
This is so much fun. I could do this all night. I mean, don't tell me to stay here and do it all night. Oh, man. Chairman Barnes, Vice Chair Chang, members of the committee, thank you for the opportunity to present House Bill 909 for your consideration. Again, for the record, my name is Jim Heinball. I represent District 1A, which is Garrett and Allegheny counties. I filed this bill at the request of the Maryland Association of Counties, and I'm joined today by Michael Sanderson, to my left, the Executive Director of MACO. I'll ask Mr. Sanderson to address the details of the bill. But I just want to say in broad terms, this bill is intended to offer what might be called a second bite at the apple with regard to non-recurring costs. The bill would allow a county board of education and county government to agree on or before June 1st each year to designate certain spending as non-recurring costs. The theory here being that county budgets are still in a state of flux up until, I know in my history was up until late May, early June. The current suspense for submitting those non-recurring costs or expenses is March 31st. So if we wait till June 1st, the counties might actually discover that they have more money that they can dedicate to non-recurring expenses. The bill is in no way intended to undercut or circumvent the maintenance of effort calculation process. It's just, as I said, it's just intended to give county governments an opportunity to contribute additional funds in the non-recurring expense category. This concludes my testimony. I'll turn the floor over to Michael Sanderson.
Mr. Chair and committee members, Michael Sanderson with MACO. We're grateful for the leadership and working with us from the delegate and former county commissioner. The nuts and bolts of this bill, this is small ball stuff. You've probably never even heard of this process. I'm sure you're familiar with maintenance of effort in general as a guide. Counties need to keep funding per pupil the same as the year before. Now, alongside that is your share of the blueprint. It's the greater of the two. Maintenance of effort has been in the law for a long, long time, and this specific process has been in the law for a long, long time, but it's not very frequently used. And the reason is it comes too soon in the process. The idea is if a county has extra money of a one-time nature, we're not sure we can spend it forever. We're not sure we can put this extra money into the maintenance of effort base, but we want to buy some books or some computers or do the one-time cost to launch a new program or something along those lines, spend the one-time money above and beyond what you have to and keep it out of the base for the following year. So that process makes a lot of sense, but the reason only 2 or 3 counties in a typical year use it is because you've got to apply by March. So this bill is saying if the county and the school board agree, and only if they agree, you get a second chance later in the process. We're done. The county commissioners have worked through their priorities. They basically got what they think is going to be the final version of the budget. And hey, there's 400 grand. We could buy some library books or we could buy some laptops or something like that. One time, not forever. We probably couldn't commit to this forever, but we can do it now here. That's what this bill allows. So, but we're only talking about if you're doing more than you have to. There's no way that this brings the level down. You already have to be clear in the bar. So that's the nature of the bill. We think it's just nuts and bolts, good idea, and encourage a favorable report.
Delegate, any questions for Delegate Hannibal or Mako? All right, do we have other witnesses? What do we do? Yeah, we do Ria Gupta, John Williams. Good to see you, Ria. And is Robert Silkworth with us or is he gone? Okay.
Good afternoon, good evening, Chair and committee members. Thank you for having us. My name is Ria Gupta, representing Strong Schools Maryland. As you know, we are a network of education advocates dedicated to ensure the full funding and faithful implementation of the blueprint, which calls for an equitable investment into the Maryland education system. And I'm here today to strongly oppose House Bill 909. One thing that came with the passage of the blueprint was innovative funding approaches by the General Assembly and administration, and the reinforcement of the concept of wealth equalized, where both the state and local jurisdictions come together to fully fund Maryland's education system. I think this bill jeopardizes the functioning of that well thought out funding mechanism. Overall, we're concerned that the bill mischaracterizes costs that are in excess of the local share amount as non-reoccurring and supplemental, when those costs may be crucial and necessary to support students in the school district. I want to emphasize that the DLS fiscal and policy note said that this bill fails to define certain expenditures, providing no limit to the allowable exclusion. I think this conflates the idea of local share of major education aid as a ceiling or a max when we know that it's truly the floor. And we honestly have no real understanding about how this will impact local and state aid, leaving our students in limbo. We all know education costs in Maryland are rising due to economic factors like inflation, and because Maryland, with the passage of the blueprint, recognized what it actually means to meet the needs of students so they can learn and thrive in school. Senate Bill 803 is an irresponsible attempt to shirk out the responsibility to fully fund schools at the local level. Thank you.
Mr. Chairman, Mr. Vice Chairman, members of the committee, John Willems representing the Maryland Association of Boards of Education here this evening in strong opposition to House Bill 909. MABE opposes the bill, which purports to deal with non-recurring cost exclusions from the minimum maintenance of effort amount mandated to be provided the next fiscal year and school year. However, the bill would allow for local agreements to exclude funding amounts based on increases in local funding called for under the law. This bill could therefore see agreements to reduce the amount of mandated local funding in the next year without involving any commensurate one-time increases in funding on a one-year basis, which is the definition of non-recurring cost. This bill does not just change a date with regard to agreements on non-recurring costs. It actually does something very different, which we thought was tricky and going to be difficult to explain. Thankfully, the fiscal note writer got it and basically said, this bill's not about non-recurring costs. Not sure what it's about, but it's not about non-recurring costs. Urge the committee and the committee council's close scrutiny of this bill and any bill that purports to make a minor change that actually could carve out and undercut the local commitment, which is uneven at best with regard to sustaining the blueprint going forward. Thank you.
Thank you. Thanks for your testimony. Any questions for two opponents? Okay, thanks for being with us.
Thank you.
The bill hearing moved to Delegate Embry, I see has been patiently waiting. House Bill 1451. Delegate, if you have a panel, you can certainly bring them up. Yep. Nice to see you.
Thank you. Very happy to be here. Chair Barnes, Vice Chair Chang, members of this committee, thank you so much for having me. It's an unusual evening where the Judiciary Committee is at home and in bed and appropriations is going strong. So I'm very excited to be here. Elizabeth Embry, District 43A, in support of House Bill 1451. We are so lucky in the state of Maryland to have such a healthy and successful and stellar arts community that contributes in countless ways, including to our economy. The Maryland Department of Commerce concluded 2 years ago that the creative arts economy contributes $837 million of economic activity to Maryland. So we're grateful and happy that they are part of our state. This bill is an attempt to support local artists. We have world-class arts institutions in the state of Maryland. They are amazing, and they are in many ways engaged with the community and engaged with local artists. But we want as a state to have a strategy going forward to look at how arts institutions can support local artists by providing access to resources, opportunities for exhibition, and other things that have not been thought of, but we know that this arts incubator work group will come up with them. The bill puts together, and I also want to note this is a bill that costs the state no money. It can be absorbed entirely by existing budgets for the Maryland State Arts Council and all those who will participate. It includes local artists, it includes local arts councils, the State Arts Council will be staffing it. Educators, and then institutions, as well as others who are interested in being part of this. And so I think it's a really important opportunity to look at all the resources we have in Maryland and use them to support our local artists who do incredible work. But we all know that creating a career as an artist can be financially unstable and very challenging. So with that, I will turn it over to my excellent panel and welcome any questions.
Good evening, Chair Barnes, Vice Chair Chang, and committee members. For the record, my name is Stephen Garrett Davis. I serve as the Executive Director of the Maryland State Arts Council, part of the Department of Commerce. I'm here today on behalf of the department and the council in support of HB 1451 to establish the Arts Incubator Work Group. I'd like to thank Delegate Embry for introducing this bill in the House and recognizing the importance of Maryland's arts sector to the vibrancy and health of our state. The arts are a vital economic driver for Maryland, and the arts and culture production in total actually contributes $12.3 billion to the state's economy. And beyond this, the arts create jobs, attract visitors and visitor spending, improve health outcomes, improve educational outcomes, help us interpret our shared history, and support us to build understanding within and across communities in our state. For these reasons, and with the third largest public per capita investment in the arts in the country, the Maryland State Arts Council supports around 350 arts organizations, small and large, and hundreds of artists in every jurisdiction, every legislative district in Maryland. In our work throughout the state, we hear the same concerns from artists in urban, suburban, and rural areas that the availability and cost of rehearsal, performance, studio, and exhibition space, as well as the fees that arts organizations are able to pay artists for engagements, do not adequately support artists to live and work in Maryland. And artists are central to a healthy arts sector. Even with Maryland's robust public investment, the continually rising operational costs of arts organizations and the organization's revenue models require them to pass along costs to artists in what they charge for space rental and what they can pay in artist fees. The Maryland State Arts Council welcomes the opportunity to staff the work group and provide the space for research so that we can continue to lead the nation in our support for the arts and artists. We respectfully ask for the committee's favorable report, and thank you, and I'd be happy to answer any questions.
Thank you, Chairman Barnes, Vice Chairman Chang, honorable members of the committee. My name is Nicholas Cohen. I'm Executive Director of Maryland Citizens for the Arts. I'm here today to ask for committee support for House Bill 1451, a bill to form the Arts Incubator Work Group. I would also like to thank Delegate Embry for her commitment to Maryland artists and for filing this bill, and of course to the Maryland State Arts Council for their incredible support to all of us in the arts. Maryland's artists embody our town's essence and our community's spirit. They number in the thousands and provide incredible benefit to our state. Their work sparks inspiration, bolsters local economies, and draws tourism, contributing significantly to our state's financial well-being through taxes and additional revenue. A recent creative industry report by Dun & Bradstreet stated that Maryland artists represent a significant portion of the arts sector and that almost 20,000 artists participate in the workforce within the Maryland economy. However, artists navigate a challenging financial landscape intensified by economic headwinds and rising expenses. Their unique fiscal burdens from securing materials and venue space to facing erratic income streams. These all necessitate stronger support systems, including grants, subsidies, and fair opportunities that recognize their contributions and alleviate their economic hardships. So we must construct an infrastructure tailored to their varied needs, encompassing financial support, proper access to spaces, and business development. House Bill 1451 aims to establish a work group to examine and address some of these very issues. It has the potential to guide our state towards proactive investment in the prosperity and success of our remarkable artists. Therefore, I urge this committee to produce a favorable report for House Bill 1451. Thank you.
Good evening. My name is Maggie Villegas. I am a creator, a strategist, and an organizer for a just creative economy. I moved to Maryland 17 years ago to pursue my passion as a full-time theater artist, and I now serve as the executive director of the Baltimore Creatives Acceleration Network, a movement to prepare, resource, and inspire Baltimore creatives to own their genius, build mindful creative enterprises, and shape our future. As a representative of the Baltimore Creatives Acceleration Network, I'd like to express my support for HB 1451 to establish an arts incubator work group charged with developing a comprehensive analysis and actionable plan to address and improve the infrastructure of support for artists in the state of Maryland. BCAN was catalyzed by the Maryland Institute of College of Art in 2017 to cultivate a stronger and more equitable creative ecosystem and economy in Baltimore. Since our inception, our organization has supported over 2,400 creatives and entrepreneurs through business acceleration programs, networking events, coaching programs, and funding collaboratives. Through BCAN's work and through my personal experience as a self-employed creative in the performing arts, I've become keenly aware of the urgent need to reimagine the ways that artists are supported in our city and across the state. According to the U.S. Bureau of Economic Analysis, Maryland's arts and culture sector contributed 68,000 jobs and $10.2 billion to Maryland's economy in 2020. And as you heard from Stephen, that number is up to $12.3 billion. By 2030, Deloitte projects that the creative economy will grow by 40%. Despite this sector's robust economic activity and promise, the artists who are at the core of the state's creative future are chronically left out of the economic benefits that their ingenuity generates. Artists are no strangers to being asked to labor with no or low compensation. Musicians are asked to advance performances and promote for venues at a fraction of the door. Muralist artworks are featured in publications without credit or licensing. Designers are asked to develop branding via design competition. Artists can't subsist without support, and the reality is that many of the institutions that are well positioned to support artists as part of their missions are often complicit in the undervaluing of artists' labor, placing the burden of underfunded organizations and projects on artists, forcing artists to operate at a loss and framing it as opportunity. Meanwhile, artists go into debt, they get behind on rent, they sacrifice wellness needs, and they struggle to support themselves and their families. Artists leave the state for better pay in LA, New York, Atlanta.
Thank you. Thank you so much. The 2 minutes is up.
Please support us by advancing this legislation. Thank you so much for your time.
Thank you. Thanks for being with us today and all you do for the arts. We have another witness.
Good evening, honorable members of the committee. My name is Lisa Lumber Clark, and I'm the Chief Operating Officer for the Black Art Today Foundation, a nonprofit located in Upper Marlboro, Maryland, Prince George's County, Maryland. We're dedicated to fostering and promoting the creation, appreciation, and preservation of Black visual art. I'm here today to express our strong support for HB 1451, a bill to establish arts incubator work groups. The arts community in Maryland, particularly for Black artists, face numerous challenges, including limited access to studio space, mentorship, professional development opportunities, and financial resources. These barriers often hinder the growth and the success of talented artists, preventing them from reaching their full potential and contributing their unique voices to our cultural landscape. House Bill 1451 offers a promising solution by establishing an arts incubator work group. This work group will bring together stakeholders from diverse backgrounds, including artists, arts organizations, educators, policymakers, and business leaders to develop a comprehensive plan for creating and supporting arts incubators throughout the state. Arts incubators provide critical resources to support that can empower Black artists to thrive. These resources can include affordable studio space, mentorship and professional development, financial resources, and networking opportunities. As an organization dedicated to supporting Black artists, we believe that House Bill 1451 has the potential to make a significant positive impact on our community. By fostering a more supportive environment for artists to create and thrive, we can cultivate a richer, more vibrant art scene in Maryland, reflects the diverse voices and perspective of our state. We urge the committee to favorably consider House Bill 1451 and recognize the transformative potential of establishing an arts incubator work group by investing in arts incubation. Thank you for your time and consideration.
Any questions for the bill sponsor or the panel? Okay. Edelson gives you a thumbs up. Thanks for being with us. All right. Have a great day. Thanks for the bill. House Bill get graced. And that concludes page 1 of our bill hearings.
On a panel here, Michael Sanderson is also here to testify as well, but I don't see him, but I'm sure he'll be in. There we go. If he doesn't come in, he supports the bill. And then, so for the record, Mr. No is not here. So if you want to take note of that. Thank you, Mr. Chairman, members of the committee. For the record, Delegate Grice, presenting House Bill 902. And what this bill is going to do is it's going to help facilitate a partnership that we've already established between our Head Start program in Caroline County, and we're hopefully going to expand this to also Cecil County and Harford County. And this is something that we can do throughout the entire state. And what we're trying to do is address this big challenge that we have right now with Pillar 1 of the blueprint and the universal 3-year-old pre-K. And the challenges that we have that we're hoping to address with this partnership, one is space. I know all of our LEAs across the state, doesn't matter if it's Montgomery County, Garrett County, or the smallest counties anywhere, is that the issue is we don't have enough space in our elementary schools to create an entire new grade. And it'll be very costly. We don't want to put 3-year-olds in portable classrooms. And so what this solution is going to do is we have with our federal Head Start programs already, they have the space, at least with our community action agency that we partner with in those 3 counties that I just mentioned. They have the space, they have the logistics, they have the transportation already in place. They also have the CDA training program that our public school systems have as well, as far as trying to attract teachers and offer this tuition reimbursement, tuition payment for that as well. And the challenge that we have when it comes really down to it is that with our federal Head Start program, they're only funded up to 120% of poverty. And so anything over that, they need extra money to be able to bring more students into the program. And with the blueprint, that goes up to 300% of poverty now, and then it's going to go up to 600% of poverty. So we'll have to figure out how are we going to be able to cover that gap. And the federal government's not going to add more money. And so what we're asking for is help from both the state and our local governments, and also our school systems to be able to cover that gap as well. And currently through the Ulysses Curry Head Start program, that's the only source of funding for these Head Start programs. And right now it's funded at $3 million. The bill doesn't have any mandatory appropriation in it. However, we are asking for hopefully some money to add to that program to be able to help facilitate this program. And we were briefed last week in our education subcommittee. So they get that $3 million through the capacity building grant and the pre-K expansion grant. And then throughout the last, we've been working on this for 3 years now. And so over the last year, we met with the chair of our education subcommittee, Delegate Palakadouj Carr, who is the early childhood subcommittee chair, and also Rachel Heise over the summer too. And it seems like we do have a really good partnership with all of our policymakers in those regards as well. And so just want to note very quickly before I finish, if you look at the fiscal note, the note writer looked at the federal Head Start regulations and also our pre-K structural elements, and they found really no challenges there, so it shouldn't be a problem. My last note I cannot read, so we're going to skip right over that. All right. So anyhow, what we're trying to accomplish here, this is a unique, and it's sort of thinking outside the box, you know, and as you all, if you've been around long enough to know, I was not a huge advocate of the blueprint to start off with. I fought it, and I'm going back home now, and I tell my folks back home, all of our partners, that listen, this is the law now. Let's do everything we possibly can to implement the blueprint. Let's think outside the box. Let's find all these different and unique and creative ways that we can establish partnerships with all of our community partners, and let's figure out a way to make it work. And this is how we're going to figure out how we're going to accomplish the first pillar. If it doesn't work in Caroline County, Cecil County, or Harford County, then you know what? Then we won't implement it throughout the rest of the state. But if it does, it doesn't mean we can expand this to the rest of the state who's challenged with that first pillar. So I ask that we move favorably on this bill.
Hi, Chairman Barnes, the rest of the committee. For the record, I am Chris Benzing. I am the Executive Director of Maryland Rural Development Corporation. I am the Community Action Agency for the Upper Shore of Maryland. We also have a Head Start program. I'll start my testimony by saying, you guys have been sitting for 6 hours. You deserve a better looking panel than this to look at. Sorry, this is what we got. So there are a couple of amendments to the bill. Basically, all they're doing is tightening up the language to ensure that the funding that is available will only go to the Head Starts. Why is it only going to Head Starts? Well, the Head Starts are in a position right now to best implement what is needed in the blueprint. In Pillar 1, a private provider, Head Start, has to provide 30% of the pre-K services in a LEA. Harford County, for example, we met with them just like right over lunch today. They need 600 seats to make their 30%. They have 16 right now. If my Head Start does it, we take 200 more. We'll take 200 for them. They're a third of the way finished. This is the easiest way to do it. What we're looking for is making some changes into some basic, the basic laws, the way they're set up. Getting some extra funding. He didn't say it, but I will. We're looking at increasing the Curry Fund to $10 million. You're not allowed to say you want more money. I got it. So we're looking for funding. Also, there's a provision that we're working on outside of this bill that the LEA can't fund us and we remain a private provider. We're not looking for funding from the school system. We don't want that fight. But if they give us a break on rent, we want to make sure we're not disqualified. And also there's some credentialing issues that work now for K through 12 credentialing that aren't in place for pre-K. It's a simple thing, MSD, we're already working to do it. Thank you.
Yeah.
Mr. Chairman, thanks to the delegate. Great idea. Me too.
I could have done that.
I'm a little delirious.
No kidding.
Delegate Smith.
Thank you, Mr. Chair. I just wanted to commend Delegate Grice for all of the work you've done in the interim to develop your bill. You've driven all over the state. You've met me at a Starbucks in my district in Baltimore. And so I just want to thank you for a lot of the work that's most important doesn't happen here in the complex. So I just want to thank you for that.
Any other questions? Okay.
Thank you.
Thank you. This is a go hearing. House Bill 1009, our Vice Chair. The Vice Chair, if the other people who are signed up are part of your panel, you can, yep. Pam Casemeyer, I see, and Michael Patty, welcome. See you, Pam.
Good evening, Mr. Chairman and members of the House Appropriations Committee. I'm Mark Chang, member of Maryland House Delegates District 32. And this evening presenting House Bill 1009. Federally qualified health centers are an important resource in our community. And like other organizations, they seek funding from our state to be able to help serve, especially underserved and vulnerable communities all across our state. And currently it's established for those organizations that are federally qualified that the state right to recover is 30 years for both owned property and leased property. And initially the bill we established was to have that reduced down to 15 for both, but the amendments has been submitted to the committee that it would just be the state right to recovery for leased property be 15 years. And the reason why is because it would be consistent with other organizations that are receiving state funding through the capital program that all of us have organizations that apply through and that we help them go through the process. And again, these are organizations that really serve those who really need the most help. And so if we can make our state program consistent across the board, the capital programs to help the FQHC, that would be really great. Appreciate the consideration of a favorable report. Thank you.
Thanks. Yeah. Hello, Mr. Chairman, members of the committee, Pam Casemeyer. I'm here on behalf of the Mid-Atlantic Association of Community Health Centers, and I'll go real quick because you've had a long day. There is currently an existing capital grant program already in place under MDH for federally qualified health centers. There's 3 or 4 capital grant programs, as you all know, under the health department. And we're really here on behalf of the federally qualified health centers because of the issue that Delegate Chang raised. In working through that program, we've had some FQHCs who have had challenges because of the 15-year lease requirement, but 30-year right of recovery requirement. You have landlords that will say, that timing doesn't really work. So we've worked with the health department. There will be an amendment as Delegate Chang made. The health department's good with the change. It'll make us consistent with other DJS grant programs, and it'll help support the effort to ensure that federally qualified health centers are able to use the capital grant program to expand access in medically underserved areas, which is where they are federally required to be located. And with that, we'd ask for a favorable report with the amendments that that Delegate Chang referenced.
And Michael Patty here tonight on behalf of the Maryland Community Health System, a network of 7 federally qualified health centers around the state with 55 care sites around the Eastern Shore, Central and Western Maryland. So just here in support, I just want to thank the Vice Chair for his commitment and working with us.
Any questions for the Vice Chair or the panel? Okay, good to see you.
Great. Thank you very much, Mr. Chairman.
You have another bill, Mr. Vice Chair, 1398.
Thank you very much. May we call to our panel, Mr. Chairman?
Excellent.
Great. Thank you very much. Good evening, Mr. Chairman, members of the House Appropriations Committee. I'm Mark Chang, member of Maryland House Delegates District 32, and this evening I'd like to present to the committee House Bill 1398, which is the Janet L. Hoffman Loan Assistance Repayment Program eligibility. As a state, we are facing a shortage of veterinarians and also veterinary professionals in our state, especially to help our furry friends across our state. And we really need to do more to help them. And what the program would do is extend the loan assistance repayment program for those who are in the profession. These are individuals who actually receive graduate, professional, and undergraduate degree through an accredited veterinary college or university. But these professionals are serving in organizations like shelters and those government organizations, and also the local organization, animal shelters that really need the most help. So it's really a way to attract those folks to be able to serve in those areas that we really need help in providing animal welfare. And the requirement would be that those who are employed, that they will work a minimum of 20 hours, and those who are volunteering in those services provide 15 hours of service per week. So that is the bill, and this evening have a panel who would like to provide additional testimony. Thank you, Mr. Chairman.
Great, thank you.
Good evening, Chair, committee members. My name is Mary Ann Tabrizi, and I'm a Humane Policy Volunteer Leader with the Humane Society of the United States in support of House Bill 1398. We know that the veterinary shortage is impacting all Maryland pet owners, but it is even more profound impact on our shelters and rescues. The committee will hear from my fellow panelists a little bit more about the veterinary crisis facing Maryland shelters and why this matters, not just for shelter pets, but also for our local communities. This bill is a fiscally constrained response to that crisis. Last year, there was a bill for veterinary loan forgiveness for all veterinarians practicing in Maryland, and that bill had a sizable fiscal note. And we recognize the budget crisis facing the state. So this year, that is why advocates have come back with a more narrowly tailored bill. Using existing Janet Hoffman Loan Assistance Program, this bill limits the administration and oversight needed. This is an incredibly successful program that has a proven track record of success for many professions, such as teachers, social workers, and other deserving professionals currently able to seek loan forgiveness under this program. Veterinarians who work in or volunteer for shelters are sacrificing more lucrative private practices to instead serve our more vulnerable communities and animals in far more difficult conditions and treating far more traumatic cases. We welcome a conversation with the committee about right-sizing the cost of this bill, and after consulting with our shelter partners, we'd like to see the cutoff for volunteer hours reduced to 8 hours a week as opposed to 15 hours. So we understand the need to keep the fiscal note constrained, and this bill is a win for the state. It encourages veterinarian providers to come to Maryland and to veterinarians to stay in Maryland. Thank you.
Good evening. My name is Katie Flory. I'm the Community Care and Advocacy Director for the Maryland SPCA, and I am also the treasurer of PAWS, which is the Professional Animal Workers Society. I have also put in written testimony, and you've heard from my colleague a little bit about the bill. I'd like to tell you why we need it. I've worked in this field for almost 19 years. I have never seen a shortage as bad as we are having right now. At the Maryland SPCA in 2023, we had to close our low-cost vet clinic because we could not keep enough veterinarians there to run it. I also run community clinics. I've had to cancel at least 2 of those last year because I didn't have a veterinarian that was able to work that. We've seen shelters across the state unable to provide timely care at all because they do not have a veterinarian on staff or one that is able to volunteer. This bill will go a long way in helping people and animals. And you might say, well, how does this help people? It does. I'm also one of those people who unfortunately 2 years ago lost one of my animals because I could not find a vet to see that animal. And unfortunately it passed away. It's no one's fault. We need help. Please, I'm asking you to provide a favorable report so that we can help people and animals around the state of Maryland. Thank you very much.
Good afternoon. My name is Jennifer Bevan Dangle. I'm the State Director for the Humane Society of the United States here in Maryland. I'm only going to add 2 little points here because you've heard more than enough good testimony to why this matters. Our shelters and rescues are primarily locally funded. Some of them do get private donations as well, but there is a significant cost burden at the local level when shelters have to turn to private practice vets, have to pay full price for services because they can't get vets in their door. Anne Arundel County, it took them 6 months to fill a veterinary position. They had to open the job twice because they couldn't find a vet who was willing to take the salary that they were offering. It's below half of what you could make in the private market if you're, trying to attract veterinary talent. And we've heard about the SPCA having to close back their hours. Barks, also the Baltimore Animal Rescue and Care Center shelter, also shared with us they've had to cut back their hours and their services available to community members. So there's a price that's being borne at the local level. And while we know that while the bill doesn't have a fiscal note, we would obviously be encouraging this committee to put more money into the Janet Hoffman program to cover this new addition. That cost does come out of the state, but we are saving money back on that local end. And I know that our colleagues from MACO would be very grateful to any help to help shelters, pets, and again, those local budgets. So.
Any questions for the vice chair or the panel? Okay, thank you all for being with us. I think we do have an online witness who I believe is with us, Susan Nelson. Susan, if you are listening, please turn on your camera and your audio, and you have 2 minutes. Right, Susan. Susan, we're going to give you another minute or 2. Turn on your camera and all right, there you are. Welcome. You have 2 minutes.
Thank you. Good evening, Chair Barnes, Vice Chair Chang, and committee members. My name is Suzanne Nelson. I am a staff veterinarian at the Maryland SPCA in Baltimore. Can you hear me?
Yep, we can. We can hear you.
Thank you for allowing me to testify today in support of HB 1398, the expansion of the Janet L. Hoffman Loan Assistance Repayment Program to include shelter veterinarians and volunteer veterinarians. Shelter veterinarians perform a range of duties for shelter animals, pets belonging to low-income households, and the public at large. This work ranges from life-saving surgeries to essential vaccines. The work is deeply rewarding, but the hours are long, the work is physically and emotionally straining, and we typically earn significantly less than our colleagues in private practice. A recent survey of veterinary students found a high level of interest in shelter medicine. However, one of the top deterrents for entering the field is the concern over annual salary. In 2022, the average student loan debt of new veterinary graduates was nearly $150,000. That number is actually a slight decrease over the previous year. It's not uncommon for veterinarians to have $200,000 or even $300,000 in student loan debt. Even with federal loan repayment programs, shelter veterinarians often struggle to make monthly loan payments. This bill would go a long way in attracting and keeping veterinarians, including paid and volunteer shelter veterinarians, in Maryland to provide important services to our communities. I urge the passage of this bill with the amendment to raise the salary cap. Without the salary amendment, the program would actually exclude most or all shelter veterinarians in Maryland. I hope you will consider a favorable report for us for this bill. Thank you for your time and consideration.
Okay, thank you so much for being with us. Any questions for the witness? Okay, thanks, Susan. Have a great night. Thanks for being with us. That concludes the bill hearing. We will now move to House Bill 900, Delegate Solomon, and I know you have a panel. Jeff, Grant, Josh, you guys want to come on up? Good to see you guys.
Good evening, everybody. Thank you for sticking around. For the record, Delegate Solomon, and I am proud here to be presenting HB 900, and I'm proud to be joined by brothers and sisters from labor, from our firefighters who risk their lives on a regular basis to keep us all safe. This is a bill, I'll just kind of start off. I usually don't do something that my county is going to strongly oppose. So I will preface it with that it's going to be probably an interesting dynamic. And this bill does two things. The first thing that it does, we'll get sort of the more complicated piece out of the way, is it just clarifies some sections of the code to make sure that firefighters are getting the proper information on what they're owed, what their salary should be, what their overtime should be, and if there is a discrepancy, it creates clarity in the law on how those grievance procedures should be rolled out. The second part of the bill, frankly, is the more clear and easy to understand, but it's the more controversial piece. And I'm going to start with, I think we all kind of know the standard 40-hour work week, right? That is kind of the standard for most jobs and occupations. It's been on the books since the Great Depression, except for firefighters. So the federal statute actually says that you don't have to pay a firefighter overtime until they've worked at least 52 hours. Think about that for people who literally risk their lives. They're not just sitting around. They're not at a desk, which is frankly where I spend most of my time. I will own that one. They're running into burning buildings. They have an incredibly high rate of cancer, all of this stuff. They don't know that their last call, their call could be the last one they ever have to take. So that's the federal statute. We don't have anything in state code that sets a maximum level. We have most of our counties that employ professional firefighters, and I think most of you who represent more rural jurisdictions know that not every county actually employs professional firefighters, but those that do, for the most part, it's 42 hours. That's kind of the standard, except for a handful of jurisdictions, including Montgomery County, hence the opposition, where you don't actually have to pay a firefighter overtime until they've worked 48 hours. In essentially a 7-day period, and it's measured over 28 days is the 4-week essential period. So what our bill would require is that you could not work more than 168 hours, which is essentially 42 hours per week. And if you did, you would just have to be paid overtime. There's nothing in here that says the schedule has to change. There's nothing in here that says you can't work more than 42 hours. It just says that if you work more than 42, you have to be paid overtime for it. And the reason I brought this bill when I was approached by the firefighters is that's just basic fairness, right? Again, these are folks who literally risk their lives every single day. And what we are saying is we know we have a crisis. We know we have a shortage of workers. And we are saying we want to make sure that you have an appropriate work-life balance, and that when you do have to work overtime to ensure that your communities are kept safe, that you are fairly compensated for it like you would in any other profession, frankly, that does not require you to risk life and limb. So I want to just touch on, you'll hear, from the panel, sort of the real important reasons for why this will improve morale, why this will improve the life of firefighters. I wanted to go through and refute just a couple of the points that you're going to hear from the opposition folks and that are in the opposition testimony that's been submitted. So I think the Maryland Association of Counties is going to be here, and they kind of made it seem like Montgomery County, this was just something new that was adopted. Montgomery County's actually had the 48-hour cap or the 48-hour schedule for almost 30 years. And yes, this was something that they tried to collectively bargain. It's been bargained in the other jurisdictions that have the 42-hour limit. And the county said no. It's not going to be probably super cheap for the county. Again, this bill has no fiscal note for the state. It'll be on the counties to pick up the costs for this. But again, we feel like this is the right thing to do. And so this isn't some backdoor way to sort of circumvent collective bargaining procedures. I worked with the library to do some research. We believe heavily, obviously, in this committee about precedent, particularly when it comes to collective bargaining. Just in the little bit of research that we did, we found at least 3 examples in the last 5 years where we, the General Assembly, passed legislation that essentially imposed a cost mandate on local jurisdictions on things that you could argue would be more appropriately left for collective bargaining. And that was just for first responders, not including any other category of employees. That was just for first responders. And the second thing that you're going to hear, and it was mentioned actually in one of the bill testimonies earlier today, has been this commission that's done, honestly, yeoman's work. And I know Jeff was on it, looking at sort of the holistic shortage that we have in first responders and firefighters, both professional and volunteer, and then in EMS. And so one of the comments was, well, this was never raised in the context of that commission, and it's not one of the recommendations in the report, as if the only legislation we can do are things that come out of a report. But I wanted to just point a couple of things in the report that actually completely bolster the arguments that we're making. So first of all, two of the folks who are the MACO representatives on the commission, one who is the co-chair, come from jurisdictions that already have a 42-hour cap. Again, they collectively bargain those, but they made a conscious decision that their counties and their county firefighters would benefit from that 42-hour work week limit. So that's the first thing. When you look at some of the surveys in here and some of the responses, the report does say that wages are too low, and it says the incomes fall below the state household income median creates an economic signal to those who may be considering fire and EMS as a career path. Basically, it says we don't pay them enough. So again, this is if you're working more than those 42 hours, you should get fairly compensated for your overtime. The other piece that was fascinating in there is that when the report surveyed professional firefighters and looked at compensation and recommended updates, all of the surveys from the professional firefighters cited things like work-life balance and lack of pay as 2 of the biggest reasons why they didn't stay in the profession. And there was one survey in particular that was really interesting. It surveyed professional firefighters at the beginning of their career and then at the end of their career. And lo and behold, those 2 issues were the ones that, essentially got the worst ratings by firefighters when they were at the end of their career. And we're trying to address that. So again, we make conscious decisions all the time as a General Assembly, as a committee to, frankly, impose cost burdens on local jurisdictions because we believe it's the right thing to do at a policy level for not only those communities, but for the state. And so to me, this bill is, again, about fairness to those who risk life and limb every day to keep us safe. So thank you for sticking with me. Sorry for the minutia, and I'm happy to take questions and turn it over to my panel.
Okay, let's hear from the panel and then we'll do questions.
Hi, good evening, Mr. Chair. Jeff Buttle, President of the Professional Firefighters of Maryland. We are the state level affiliate of the International Association of Firefighters, representing a little over 10,000 active and retired members across the state of Maryland. You're going to hear from my colleagues here in a minute on a number of the topics of the reasons for this bill. So I won't be repetitive and go over those now, but I did want to address, while I had the opportunity, some of the opposition that was submitted to this bill. I believe the delegate mentioned it in his introduction, but MACO is citing that Montgomery County recently switched to a 24-hour shift model. I don't know where that comes from. My home jurisdiction, where I'm a firefighter and still currently serve as a firefighter, is Montgomery County, and I have a little over 25 years of service there currently. And for the 25 years that I've been employed, we've always worked the 2-shift-a-week schedule. So I'm not sure what they're referring to about a recently negotiated change in our schedule. Also, the Montgomery County executive submitted some written testimony referencing hours of work being a mandatory subject to bargaining. If this bill were to pass today and be signed into law tomorrow, nothing, not one thing would change about our work schedule. So this bill does not address work schedules. It doesn't mandate a change in our work schedule. Our work schedule would be exactly the same. And either party moving forward in the future, would still be free to bargain work schedules, however it is that they see fit. And then finally, Mr. Chair, I was a little confused that Anne Arundel County, Maryland submitted written unfavorable testimony. The firefighters in Anne Arundel County they currently work a 42-hour work week. And the paid leave provision to count towards their hours is currently in place. So there'd be no change for it, would be status quo. So with that, I encourage a favorable report and look forward to working with the committee on this important piece of legislation. Thank you.
Thank you. Good evening, Chairman Barnes and esteemed members of this committee. My name is Grant Walker. I am the first district representative for the Professional Firefighters of Maryland, representing Howard County, Montgomery County, Prince George's, Charles, Calvert, and St. Mary's counties, as well as concurrently serving as the president of the Prince George's County Professional Firefighters and Paramedics Association, IFF Local 1619, where I get to represent 1,800 of the active and retired members from Prince George's County. Today, I'm here in support of House Bill 900. Everyday Maryland firefighters show up to work religiously during global pandemics, during hazardous weather, during the cold and hot months of the year. But unlike the normal American population that receives overtime at 40 hours in a work week, firefighters are confined by a law that was passed 100 years ago by Congress. Many of our fire departments across the nation have expressed difficulties with recruiting and retaining firefighters. I sat on the commission to strengthen firefighting and EMS in Maryland over the last year. The bills proffered in that document do not go far enough to make the Maryland the most attractive state in the nation for firefighters. This bill would change that. What this bill does is it levels the playing field across Maryland for the purposes of overtime, and it makes it the most attractive state in the nation to attract firefighters when we are in dire need of them. What this bill does not do is mandate a schedule change or dictate how local jurisdictions run their fire departments. If you were to enact this bill today, you would see zero discernible change in the delivery of service to your communities. However, it would ensure that every Maryland firefighter is compensated fairly for the extra hours that they are working outside of their normally scheduled hours. With that, I ask you for a favorable report for HB 900. Thank you.
I don't know how I'm going to follow that. They've really squared away, but good evening, Chair Barnes, Vice Chair Chang, and esteemed members of the House Appropriations Committee. My name is Josh Fannin, and I am the president of IAFF Local 964, Baltimore Fire Officers. Before you today to speak in favor of House Bill 900, thanking Delegate Solomon for his leadership on this issue, while encouraging consideration of a friendly amendment that would allow for departments to calculate overtime for a schedule with less than a 42-hour work week, or allowing employers to adopt a less than 42-hour work week, accomplished by amending the text to add no more than in line 24 of page 1. I've submitted written testimony for further context. I'd like to provide some more information to you today as to what the thought process is behind this bill. Most all labor industries fall under the 40-hour work week prescribed by the FLSA. Firefighters are the notable exception, although paradoxically, paramedics are not. They are a 40-hour work week. You may ask why firefighters are treated so differently, and there is no good answer for that. There is no reason to treat us differently. Additionally, over the course of the past 80 years, our call volumes are increasing across the board, and we are far past due to receive some work week protection, just like any other labor industry. The 40-hour work week for other industries dictates at what point overtime should be paid to employees. Because overtime is a 50% increase in an employee's hourly rate, most employers wisely limit the amount of overtime employees work and stay within that 40-hour parameter. That is the purpose of this legislation, to keep firefighters' schedules within a reasonable parameter. The purpose is not to increase the amount of overtime firefighters receive, but for them to be working those more hours, they would be compensated appropriately if that happened. I think this might have been covered, but there are 24 counties in Maryland, including Baltimore. And I'll end there and say thank you, and we ask for a favorable report.
Questions for bill sponsor or the panel? Well, let me just thank the panel and the other firefighters that are with us for your service. I know, particularly in Prince George's County, where I represent, mandated overtime is becoming onerous, to put it lightly, and becoming a real deterrent to people serving in the fire service. And we're having trouble attracting firefighters. And so thank you for the bill, delegate, and thank you for your service. We do have some opposition, so hold on your hats, committee. We got opposition today to the bill. Earl Stoddard and Michael Sanderson. Mr. Sanderson, it's been a while since we had opposition from you, so it's a surprise, you know, we're waiting for it and wondering what this would be a good time to do another Me Too testimony if you wanted it.
Good evening, Chair Barnes and members of the committee. For the record, my name is Earl Stoddard. I'm an Assistant Chief Administrative Officer in Montgomery County, here testifying in opposition to HB 900. This bill will require a computation of overtime that for each hour worked over 168 hours for a 28-day period, a 42-hour work week. That overtime calculation would not just be based on hours of the firefighters being on duty. It would also include any leave they took during that period as well. In Montgomery County, hours of work and schedule are a subject of mandatory bargaining, and as such, the county and the local IAFF unit just engaged in good faith bargaining that resulted in an agreement that was signed on January 30th that continues the decades-long 24-hour on, 48-hour off schedule that results in an average of 48 hours worked per week. Therefore, this bill would result in a minimum of 6 hours of overtime per week for every career member of the service. The implications of this change go beyond the fiscal. The county would need to revisit the hours of work portion of the labor agreement with the IAFF and aim for an alternate schedule that did not contain the level of mandatory overtime that the bill would mandate. In doing so, there would be collateral impacts to the member availability based on the required rest periods that would be part of that any new schedule that would address. To combat issues of member availability, the county would have to upstaff its department to offset the unavailability of those resources. And that upstaffing period could take upwards of 6 months to 2 years, depending on the availability of new recruits, the training period required, and the like. During the period of reduced member availability and inadequate baseline staffing.
Just need to conclude now.
Okay, great. We believe that there will be impacts on service, availability of members for training, and the ability of our urban search and rescue team, among others, to be available. For these reasons, the county executive requests that the committee not advance this legislation.
Okay.
Mr. Chairman, committee members, Michael Sanderson with Mako. I think you've probably heard in the fiscal note and so forth, this is a local fiscal effect. There's probably a number of jurisdictions who have dramatic numbers about what this would cost to fully comply with this. They have to go back and revisit and so forth. But I want to take the bait a little bit about collective bargaining and this bill going to the local bargaining table and deciding an issue that you have otherwise said should be settled there. I mean, if counties for some reason found a sympathetic legislator put in a bill that said, we want to mandate just 8-hour shifts for all firefighters. We want to do that. We want to put that in a bill. The panel who was just here would all be before you saying, you should not intrude on the bargaining process. You should let us negotiate the working conditions, the timetables, the overtime. All those things are central, not theoretical, not peripheral bargaining issues, but they're central issues. Like overtime, there's a reason why the Fair Labor Standards Act excludes firefighters. It's because of these shifts. I mean, that's why. There's not no reason. There's an obvious reason. So the reason you sent this to be bargained locally is to have it settled at the local level. Not everybody's thrilled with what they get out of the bargaining table. I get that. But the answer to come to Annapolis and fix it, the one piece that you don't like, I do think there's a precedent problem with this bill, as well as the fiscal effect. You'll end up saying everything we don't like, we'll run to Annapolis and we'll find friendly folks to put in a bill and awesome and effective sponsors. You have a great panel. I get it. I think you should resist that temptation. It's going to cost a ton of money to do this. I mean, we're all in for firefighters. It's one of our top initiatives for this year. We very much want Delegate Jones's bill to pass. We want to find the money to do it any way we can. We're trying to do what we can, but we also think these local decisions should stay local. Thank you.
Statute all the time. We don't leave every particular to collective bargaining, so that doesn't exactly jive.
Absolutely. There's a certain degree where you say this is an absolute, and there are a number of areas, just like the topic in this bill, where you've always said it's the centerpiece of local bargaining.
So you can agree that there are times that we do this, and I guess that's that degree and that line is sort of for this body to decide.
Everything before you today is for this body to decide, of course.
Fair enough. Touche. Any other questions for the panel? Okay. Good to see you all. Thanks for coming. Have a good day. That concludes the bill hearing. We'll now move to House Bill 949.
Mr. Chairman, Appropriations Committee, Delegate Joe Vogel here. I have 15 people testifying in support of this bill. I'm just kidding. It's just me. I'll make it quick. House Bill 949 recognizes that early detection of cancer is critical to saving lives. As we look at our state workers who are having to use paid sick leave to access those cancer screenings, we recognize that often they run out of leave time or don't want to have to use their sick leave or alternative forms of leave to get that cancer screening. So what this bill does is follows in the footsteps of Baltimore City and makes state workers eligible for 4 hours of paid leave for cancer screenings in any 12-month period. I will note that there is a letter from the Baltimore City Cancer Program, which notes how successful this has been in the city of Baltimore, and a letter of support as well from AFSCME Maryland. With that, I urge a favorable report on House Bill 949.
Okay, well, thank you for the testimony. Thanks for sticking around with us, delegate. Any questions for the bill sponsor? All right, free to go.
Thank you.
Have a good day. Committee, do not get up. We're going to break for 2 minutes so we can just change over and get ready for our budget hearing. We're joined by our Special Secretary Martin. You can bring your team up so you're ready when we get going, and that way we can be as efficient as possible. So just stay where you are. We're going to break for 2 or 3 minutes just to change over.